Okay, give me two. Good. Good morning, everybody. Good morning. Okay, I think it's we'd like to start day 2 of the Pathogens project, creating the framework for tomorrow's pathogen research. My name is Ravi Gupta, one of the co-chairs. And I'd just like to start by, of course, thanking you all for joining us again, and of course, those of you who are online following us. I also want to just recap day 1, really, so that we can remind ourselves of what's been discussed. Very briefly, we started with a panel discussion of a group of virologists from around the world, trying to identify what we believed were key risks and key challenges from the point of view of studying pathogens with pandemic potential, whether they related to work that we're doing in laboratories to try and better understand them, or whether it was to do with contact between humans and animals, and how we may move forward in terms of creating a strategy or framework from which people can work globally in a safe manner. We then heard from an expert group of panelists who represented various organizations, and we went to the supranational level, as it were, and heard about their efforts to engage stakeholders and to work towards a safe, biosecure environment, engaging all key individuals across continents. And then in the last session, we drilled down to country level and heard about particular challenges individuals are facing in their respective countries in terms of doing pathogen research, what's available to them in terms of government guidance, and where future challenges may lie and where the opportunities lie. And so this morning, it gives me great pleasure to continue that discussion of country-level challenges and experiences. And I'd like to introduce Dr. George Gao, who's Vice President of the National Natural Science Foundation of China. Dr. Gao is obviously very well known globally, being the head of the China CDC at the start of the pandemic. He trained as a veterinary surgeon and then went into microbiology, training in Oxford in immunology as well as virology before moving to Harvard, where he continued work in structural biology. And then moved back to China and has been at the Chinese Academy of Sciences and works in the area of pandemic pathogens and emerging pathogens, and is both trained in virology, immunology, and structural biology. And from my point of view, that's an excellent combination of skill sets for anybody who's in a policy or a decision-making role, because, of course, understanding the breadth of scientific endeavor is really important when we deal with new and emerging pathogens, so that you can harness the knowledge that's out there in order to best tackle the challenge you're facing. So without further ado, I will present to you Dr. George Gao.
Thank you for your introduction, and thanks to the organizers for inviting me to be here. It's a great pleasure to talk something about biosafety and biosecurity in China. And as we are here for tomorrow's pathogen research, so why we are here? We want to prevent the next potential possible pandemic. So let's start with the word. I realized yesterday when I talked to Philippe, and you there French, you also use the biosafety and biosecurity could be, the same word in French, and in Chinese could be the same. But we try to divide those two words in Chinese as two different words. You read this Chinese. I know a lot of people, you can read Chinese. But when you direct translate, it's biosecurity, biosafety in China. In Chinese, it's one word. The first one, we call it 生物安全. Now, I really want to pay condolences to my mentor at Oxford. I did a PhD, started with real virology with Ernie Gould, who just passed away last month, and also in memory of my second postdoc mentor, Don Wiley, for structural biology. So I started at vet, and then virus, bacteriology, structural biology, and immunology, and vaccinology. I'm doing something under epidemiology as well. So this is me, but I want to memorize those two. Just passed away, and they are great scientists. They taught me to be a scientist. First part, let me give you a very quick introduction about the biosafety and biosecurity in China. So SARS is really a turning point for China. We did a great deal of the jobs, and not just for the facility, but also for the regulations. Go and read the regulations, laws in China. Maybe we have the most stringent, laws or regulations in China. Go and visit the labs. We also have the most strict settings. Go and have a look in China. I was at Harvard, I worked at Oxford. I visited so many countries, especially for the BSL-3 lab or BS4 lab. Go and there, regulations, laws, facilities, they are okay. They are good. They are in good quality. I think, a lot of audience, my friend, you visit China, because SARS is a turning point. For the biosafety, we pay a great deal for the biosafety because it's so important. And the laws, regulations, and the standards, we have laws, we have, it's as a national law. We also have regulations. We have a lot of national regulations. We put, so many standards. Go read them. Some of them are already translated into different kind of languages, including English. And also, for the management, as I said, laws, regulations are there. You have everything there. Where is the implementation? Where is the execution? And in my opinion, it's always there. It's in good place. It's because we call the full chain management. Starting from the sample collection, sample transportation, and to sample processing, and then for the recording, for the data storage, analysis. So everything is in the full set. So this is, all this for the biosafety. Give you an example, even for the transportation, even for me, it took a long time for all this paperwork. For the scientists, usually we would complain why it took so long time. But that's something necessary. You got to do it. So this is general, in China. And also, preservation and storage, and go and visit it. I think you are welcome to come and visit. I had a lot of friends, because we have a US-China joint meeting for the biosafety and biosecurity. For the last, I think I was the coordinator in China side. My vice president of China Academy of Sciences, Dr. Zhang Yaping, was the chair. And Diane Griffin, the US NAS, is the chair. We have a joint meeting before. Now we are talking about before COVID and after COVID. We are living in the world divided by COVID. So before COVID, our communication is very good. We had, dialogue and meetings. All those academicians and NAS members, we will get together to make sure biosafety is enforced in both countries. Sometimes we would invite some students like the Japanese or someone from Thailand and the UK scientists would join us. That's a very good program. So even when we have this SARS-CoV-2 or COVID, we immediately had these laboratory biosafety guidelines. So it's so clear. Of course, this was attacked. Thought we try to limit, to restrict people's research. It's not. So this is because from the very beginning, this virus was defined as BSL-3 virus. So you have to follow all these guidelines. So that's, it's so clear. And we have all this for the hospitals and for the CDC system. And for all these systems, all the guidelines, all the paperworks are there. We learn from you, US, UK. As I said, SARS is the turning point. We had some lab leakage at that time. We have to admit. So we realized that's very important. That's very, very important. So this is why, everything is in order. And also, more importantly, we even put a new journal. This is edited by our chief biosafety officer, expert, Wu Guizhen, for biosafety and health, to make Chinese research for all those pathogens transparent and open. So I learned from MMWR, China CDC. We had a new journal called China CDC Weekly. That was started in November 2019. So I remembered, even in the Lancet journal, they have a profile, introduce me. They are claiming appointment of George Gao as the DG of China CDC means China's outreach for the world. So you have all these China CDC Weekly, Biosafety Health. That's two examples of new journals. Now, everybody wants to know what happened in the early days during this pandemic, what we have learned from this COVID-19 pandemic. I would say three threes. What? 3 stages in China. First, lockdown containment, then zero COVID, and then now dynamic. So in general, would you this state? And 3 steps: science-based, public understanding, public involvement, and political will, and swift administration decision. Those 3 steps. And then you have 3 pieces of work done immediately. The disease was first seen in Wuhan, China. The virus was first isolated in China by China CDC, by my group, our group. The sequence was first released in GSAT from us, from China. And also epidemiological parameters were released through the New England Journal of Medicine. Everything's there. I think no one ever thought this could be a pandemic like this one. So this is what I call 3 threes. And public contributions for the China CDC or China's measures, of course, a lot of argument, a lot of challenge, sometimes it's attack. But let's tell you what China has done, what we see. In the whole world, the rest of the world, you have, I call it, you have a lake. Can you see the spring where the water comes from? You can't. But China, we have the spring. Whenever, we lock down, and after the lockdown, on April 8th, the virus, the disease is not in China anymore because lockdown and containment. I said because that's the community level. That's something cannot be done, implemented in China because of that we have very strong community level measures. Community level is a key for the public health issue. So anyway, so we have the spring, you have the lake, we have the waves, you have a tsunami. So this is exactly what happened here. And I said 3 steps: science-based, public involvement, and administration decision. I called seeking the truth, being pragmatic. For any administration work, you science-based, when you do something for implementation administration, being pragmatic. You can do something by science. For example, because I was trained as a vet, I know the animal field. Whenever you have a virus, foot-and-mouth disease, African swine fever, culling, kill the host. That's it. By science, great. By science, you could do that for COVID-2 and COVID-19 and SARS-CoV-2. Can you do that in practice? No way. So this is why science and administration, sometimes they are so different. So what the early days? Late December, we had some PUE, pneumonia with unknown etiology. PUE always regarded as the first line of the most dangerous disease. Everyone sitting here. We are sitting here with this bulletin of atomic scientists. We are get together. We are experts. You are journalists, but you have an interest for the emerging, re-emerging pathogens. You are scientists working in this field. You are administrator. You are doing with this management of biorisk, biosafety. So we know PUE number 1. So initially, we have some pieces of coronavirus genes from third-party surveys. In China, in the hospital, such a big country, we have third-party surveys. They detected something. There's some noise and voices So in China CDC, we have 4 systems to catch those. We have a flu network. Everybody knows. We are collaborating lab for WHO. We have an ILI, influenza-like illness network system. We have a SARI, severe acute respiratory illness service system network. We have public health emergency events detection system. Those 4 would help you to catch anything. It's 24 hours on alert. But from very beginning, because no one knows what this is. So this is why, from very beginning, maybe only a sporadic case or cases. So this is exactly what happened in the early stage. But once we know it is pieces of genes, it's coronavirus, it's SARS-like, we are on the business. Immediately, lockdown, containment, all these measures. And because it is known for any coronavirus, very difficult to grow. So from very beginning, I'm involved. We tried many cell lines. We tried organoids. We tried lung tissues. Even I got some the scientists working on the lung transplantation. We got pieces. We tried. But within 5 days, it grows very well in viral cells. Why is that? Then that will link to the origins whatsoever. People will say, well, this is the virus, a lot of conspiracy stories, man-made, lab leakage. The virus already adapted to the cell lines very well. Well, it's possible. It's logical thinking. Where's the evidence? Where are the facts? The facts are the facts. That's the great philosopher Bertrand Russell said. The facts are the facts. We do have these facts, but initially we tried, we got the virus. Look, corona, because it looks like this. On the 7th January, we got this. And then me, Chen Wang, Peter Hobby, Fred Hayden, 2 Chinese, 1 British, 1 American. We wrote something, formally published January 24th. Can you see the submitted date? Must be under peer review, much earlier than this. We claim it could be a global health concern. That's our title. And then we released the genome on the 10th through GSHD. Everybody knows GSHD. GSHD is a kind of private, but now it's German, under German government. So GSHD released the sequence on the 10th. Of course, there's an argument. So as a scientist, I don't want to do any argument. Even in the early days, I was attacked. I kept quiet. I don't want to make anything big mess. We want science. We want the disease under control. We don't want to quarrel. We don't want to argue. We just want the science. We want exact measures or methods. We can get the disease under control. 10th, that's the first day. We have 3 correct. I use the word correct. Someone released pieces. Someone released wrong sequence, withdrew, and then re-release. So this is exactly what happened. And let's give you some evidence. New England Journal of Medicine, Pfizer, BioNTech vaccine developed based on this 10th January release sequence. And this European, for the diagnosis, based on that. Another one in the European country, they did this and they claimed on the 10th January, they got this sequence, they developed the diagnosis kits. Only, and why do we have COVID? Why? Is it black swan or gray rhino events? What's the probability? I was a member, not a member anymore. I was a member in the GPMB, Global Preparedness Monitoring Board, headed by Bulletin, former DG of WHO, former Prime Minister of Norway. We were sitting together. I fly here quite every year for this meeting. At the end of 2019, we have an annual report claiming flu, coronavirus are the most likely pathogens which would cause pandemic. See, we know that, but we are not ready. And I was in the event 2-1 organized by Tom Inglesby in the Johns Hopkins Public Health on the October 18th, 2019. Again, exactly before the COVID. The disease, we have a table exercise. We have a suspected, enemy. It's called CAPS. Coronavirus-associated pneumonia syndrome, exactly like the COVID-19. And then by that time, it's everything on the internet. And then in China, I was attacked. So, George, you went there, and the American told you they are going to release the virus. You got the virus, you came back to China, here you go. Conspiracy story. Very, very typical. Let's come back to science. So we know we have an exercise. We know it could be a coronavirus. Coronavirus-associated pneumonia syndrome, everything in the internet. I'm telling you the truth. I'm telling you what happened. This is even 2-1. We know knowledge about rotavirus, migratory birds, chicken, ducks, pigs, and human. Ebola may be bats, mammals, and human beings. All this story. But now I'm challenging this. Do we really have an intermediate host for the coronavirus? We need to rethink. Put it back to science, rethink. So far, we have 7 coronavirus for human infections. Everybody remember SARS, the first one in 1965, and then 2 years later, and you have the second one. And in 2004, you have OL63, you have HKU1. For the original HKU1, HKU1 was isolated by KY in Hong Kong. This is why it's called HKU1. For a long time, the scientists, virologists, they are so lazy. They didn't want to have this virus, alpha, beta, gamma, delta, Omicron. They named it as a place where you isolate the virus. So Hong Kong University #1. So with this virus, it confirmed by Brazilian scientists. In 1995, some samples stored in the freezer, they have the HKU1, 1995. Because it's not a pandemic, no one really noticed this. And then of course, you have MERS and you have COVID-19. For MERS, beautiful story. Bats, dromedary, human. Now we need to rethink, revisit about this hypothesis. For SARS, civet cat, maybe before civet cat, it's bats. Bats, civet cat, human. I'm calling, let's move back to rethink whether or not this hypothesis would work. I leave this because scientific question, all the scientific must be open. Leave it open, let's wait what we could get. And then for the COVID, we know. The virus was first seen, first identified, first isolated from human samples or environmental samples. We did the environmental sample. But the virus got into mink, so many animals. Now we know. You will never think mink is the intermediate host. We thought human to mink. We never thought mink to human. Now what about a civet cat? Maybe human to civet cat, not civet cat to human. Anyway, we need rethink. There's no evidence. We need evidence. We need facts. Back to 2016, I was asked by the transient microbiology. I'm doing administration work, also I'm a scientist. I'm doing a lot of research on corona and flu-related virus, Ebola as well, emerging viruses. I wrote, it is likely, not a matter of if, but when, we will have a coronavirus causing epidemic, even pandemic. 2016. And 2018, I was asked by the journal Cell. I was sitting there as advisory board member. Can you write something about what we can do for the emerging virus? I said in that paper, it's paper 2018. We cannot do anything. Only 2 things we can do. 2 things. First, surveillance. Second, basic research. Invest your money for the emerging virus research. Get your money there. Basic research, because we don't know which virus, when we will have another pandemic. So surveillance, basic research. The important thing I would say 3 times. So basic research, surveillance, and surveillance. Now, origin, raccoon dogs, pangolin, bats, a lot of stories, you read a lot. I don't want to exaggerate anymore, but there's no conclusion. Before our nature was accepted, a lot of scientists thought, okay, it's raccoon dogs. Now I think there was get a little bit lower down. Maybe the raw data there, they did reanalysis, maybe it's not. Anyway, so that's a long story. And this time, for the human beings, we did, I call it saturated vaccine development. Within such a short period of time, we got so many vaccines, especially in China. We have so many vaccines under clinical use or under clinical investigation. And for the 1918 flu, you are talking about 25 to 50 million death toll. This time, less than 10 million. We did achieve a great deal. Of course, for the public or the politics, they thought they want 0. We also have a life expectancy. You can't live forever, right? But this is why I think, politicians and the public, they demanded more. Last time, a week ago, I was in London. Tony Blair gave a keynote. That's the meeting supported by Rhodes Trust meeting, discussing the name called Early On, like this one called Pathogen Research. Tomorrow's Pathogen, that one called Always On. That's the meeting theme. Tony Blair gave a talk. He used the words, okay, I'm a politician sitting here, standing here, all the audience, you are experts, but I still have to say something. He used the word but. I was sitting the panelist, and I said, okay, Mr. Blair, Tony said, but ask the scientists would say, however. You know the words, however. Scientists found something, however, that's wrong. However, that, however. Remember, the public. The public would do, they use an even stronger word. Nonetheless. Come on, man, scientists, you are working so hard. We invest for you for basic research. Here's the virus, here's the pathogen. Get it done immediately. They use the word nonetheless. However, as a scientist, I use the word however. Saturated vaccine development save millions, billions of lives. You have to be really careful about that. From early days, I wrote a commentary in my journal called China CDC Weekly. If we don't share the vaccine, the virus will share the world. Now the virus shared the world. We still couldn't work together. I'm calling here for tomorrow's pathogen research. Let's work together. Nonetheless, work together is more important. However, work together is more important. But work together is more important. Remember those but, however, and nonetheless. So, as I said, the virus collaborate each other very well. Alpha, beta, gamma, now Omicron. Omicron, BA dot something, BA dot something, XBB something, and then, XA something, Okay, name it. They work so well. Great collaboration for the virus, one by one. And then they escape all the therapeutic monoclonal antibodies. This is the work from micropopulation immunity. They escape all the available monoclonal antibodies. Now I want to remind everybody, while we were working so hard, we are thinking about it, we did a great job. Remember, new pollutants. Now it's C memos. So we have to be really careful. We want a green world, we want a green earth, but we are doing some contaminations for the world. So what lessons we learn, and what we should learn from the COVID-19? One word, remember the word, global. Now we have deglobalization here, everywhere. But we have to call everybody, try to work together. Let's work together, not a virus. Remember, we are living in a global earth. That's a very small village. It's a small village. We are all villagers, living together, the global. And also, more importantly, those two words, I'll remind everybody, we are discussing for a long time, tolerance and resilience. Tolerance means tolerance to the environment, tolerance to the microbes. Look at me, cut me, have me, Dr. Gupta, cut me. How many cells do I have? 10 to the power of 13, roughly. Cut me again. How many microbes I carry? At least 10 times more than my cells. 10 to the power of 40. I am a mixture of my skeletal cell and microbes. So the Earth, how old the Earth? 407 billion years. And we have the human beings, what we call the Homo sapien, only one species. The virus, corona, SARS-CoV-2, 2 different species. You and me, black, white, doesn't matter. We are one species. They have SARS-1, SARS-2, 2 different species. We are only Homo sapiens, so we have to tolerate each other. So this is my last call. This is the lessons we should learn. Otherwise, we have another even worse pandemic. So for the post-COVID, I created those two words. We don't want phobia. We don't want hypognosia. We need to work together. I call it coronaphobia, corona hypognosia. So, this is something, again, I'm calling it to work together. And also we should work together, try to prevent the epidemiology. At the early stage, Fauci, everybody, including me, we were attacked. Say, guys, you work so hard. We invest so much money for your basic research. Why couldn't you get the virus down? The virus grew, and the death toll grew, death toll grew. The life, what happened? So I created another English word, inferiors. It got approved by Tony Fauci. I said, okay, you have an epidemic. You have the science for studying epidemics called epidemiology. What about the pathogen? The pathogen, I name it, inflammatory virus, inferiors. So I wrote a paper in China CDC Weekly last year. So, okay, let's start to study inferiors and epidemic, get a new science, new discipline as epidemiology. So we need to work together for virology, epidemiology, immunology, vaccinology, but also we need to work together for the study of epidemiology. We have so many journalists sitting here. This is your job. Make sure you deliver the correct information to the public. Make sure the public understand, the public involved in whatever you are doing. That's the lessons we should learn. Pandemic, epidemic, both are so important. So what about the next virus? Next coronavirus, of course, not COVID-19, because I was the one, we wrote something in the Lancet. We were against the name of SARS-CoV-2. Because we have some new viruses. But people would think SARS-1, SARS-2, the same virus, same species. And especially in China, it's called novel coronavirus disease. It's not. This one's novel. What about the next one? Novel. What about the third one? Novel. So, we need a good name. So we'll have disease X. Okay, here you go. We have monkeypox. July 23rd, the W claimed another fake event. In the 21st century, starting from pandemic H1N1, 209, we already have 7. And for the future, we need collaboration, competition, communication, and coordination. Those 4 C I wrote in the public Lancet Global Health with Africa CDC Director John Kangason. These 4 C we proposed, we need to work together for those 4 C. So welcome to visit China in Beijing. And I helped to erect the statue for flu virus in 2018 to commemorate the 1918 pandemic. So to educate the public, to understand what the virus looks like. Come visit Beijing in my institute, the Institute of Microbiology, Chinese Academy of Sciences. So I have 2 jobs. Oh no, I have 3 jobs. I have one job at Chinese Academy of Sciences as a scientist, DG of China CDC. So come and visit this. That was erected 2018. So it's so important. I initiated, thanks for the WHO agreed, Dr. Tedros made a remark, World Flu Day, that's November 1st. Finally, I would cite the great philosopher Bertrand Russell. Let me try to mimic the British accent. I will try hard. You have so many British sitting here. In 1952, Lord Russell was interviewed by a journalist of BBC. One last question, Lord Russell. Suppose this film would be looked at by our future descendants, say like Dead Sea Scroll, 1,000 years' time. What would you say to our future generation? Well, I should say 2 things. One is intellectual. For the intellectual, I would say, when you are studying any matters, or considering any philosophy, or keep asking yourself, what are the facts? The facts are the facts. The second thing I would say, moral. 2 words he left for us. For moral, I would say love is wise, hatred is foolish. I will stop here. Thank you very much.
Good morning, everyone. Is everyone awake? First, I'd like to thank Dr. Gao for a fascinating conversation this morning and presentation. My name is Suzette McKinney, and it's a pleasure to be with you all this morning. I am delighted to be moderating this panel on the range of risk on the horizon. So to get us started, I would like to ask each of our panelists to introduce themselves to the audience. Panelists, please just let us know your names and the organizations that you represent.
I'm Françoise Bayless, and I am a philosopher by training, not a scientist, so I ask your indulgence in terms of the comments I'll make. I'm from Canada, Halifax.
I'm Asha George. I'm the Executive Director of the Bipartisan Commission on Biodefense. I'm a public health person and an intelligence officer, but also very involved with politics. So I beg your indulgence today as well.
Jens Kuhn, Director of Virology on the contract side at the Integrated Research Facility at Fort Detrick.
Hi, my name is Paulian Lim. I'm the Director for the High Level Isolation Unit in Singapore at the National Center for Infectious Diseases. So I'm an adult ID physician, clinician by training, and I also do travel medicine and vaccines.
Great, thank you all. So as I'm sure our audience can understand with such a diverse panel this morning, I think we are in for a very interesting discussion. So one of the things that I failed to mention in my introduction, I am a member of the Science and Security Board for the Bulletin of the Atomic Scientists. Asha is also a member of the Science and Security Board. And for those of you who may be familiar with the Bulletin's 2023 clock statement, you may recall that in this year's statement, we called out the existing biological threat, landscape, and the need for the international community to improve its ability to prevent disease outbreaks, to detect them quickly when they occur, but also to respond to them effectively to limit their scope. After what began as our COVID-19 response, I think it's safe to say that we recognize that emerging and re-emerging infectious diseases are now occurring much more frequently than they have in the past, and with more than half of the infectious diseases that have occurred over the past 40 years being zoonotic in nature, the potential for another human pandemic, as Dr. Gao said, is not a matter of if, but rather a matter of when. But we also recognized that while pandemics and other infectious diseases are important, they are not the only biorisk that we should be concerned with. But rather, there is a full range of other risks that require just as much concern and preparedness capability. And the proliferation of these various types of biothreats will require deliberate collaboration and coordination across the international community in order to address them. So with that, I'd like to start our conversation this morning with Asha. Asha, can you speak to us a bit about your work at the Bipartisan Commission and tell us how you view the biorisk landscape shifting?
Sure. So the commission is a private sector commission. It is funded by the private sector as well. But it is composed of former senators and representatives, for the most part, who serve on the commission. And we operate the way a congressional commission would operate. So we run all-day meetings, very similar to hearings. We put out reports very similar to congressional staff and committee reports. And as part of that, we have to look at where we're going with the biological threat. Quite frankly, when Congress or probably any government, decides it's going to address something in legislation, they're often doing that 2 years after the initial incident. So for example, with our 9/11 Commission in the United States, the actual report came out in 2003, and then legislation followed thereafter. So 6 or 7 years, finally we have legislation that's addressing something that happened 6 years beforehand. So the commission, our commission doesn't want to do that. Our commission wants to look forward. And we do look at where we're going in the world. Now I will tell you, one of the challenges of this is that everybody wants to ground everything in what's going on this very second, today. And of course that makes sense from a forecasting perspective and even from a logical perspective. But the Commission strives to sort of leapfrog in terms of its thinking and go beyond that, or at least expand upon what's going on. So, for example, right now, our State Department says that there are two countries, Russia and North Korea, that are engaged in active biological weapons programs. And this is not some giant surprise, because both of those countries have stated this publicly, that this is what they're involved in. So, okay, I don't want to sit here and tell you, so therefore that means in the future, Russia and North Korea are going to be a problem. Instead, what I would tell you is there's a public health set of assumptions that we use to try and engage and push thinking forward. So there's a ratio. For every one thing you know about, there are 6 things that you don't. So at the least, we should be saying that for every 2 countries that we know about, there are 12 others that are involved in biological weapons programs and development and planning for utilization. So then what does that look like in the future? Will we see proliferation of programs or not? Now we have to start adding in other things. You know, what are our social constructs? How do we feel about it? I think old-timey thinking in which, you know, oh, no one would ever do that. I think we have to put that aside when we're talking about preparedness and planning. I think, too, we have to look at, and the Commission certainly looks at, the convergence of bio with other fields. These things, we all know this as scientists, they're not so discrete anymore. Biology and chemistry are coming together. Biology and other things are coming together as well, and things become more vague. And as they become more vague, I think the opportunity for risk to grow continues. I would also add that combining bio with other things like cyber is creating new arenas and new issues that we had not thought about before, and that defy choosing one scientific arena over the other to design risk reduction programs. But we see that moving forward. I would just add lastly that the Commission is trying to jump forward in time and not be so anchored by what is happening today, and tries to get out of the accusatory game. There's no point in that. Somebody will do something in the future. Something will happen with nature in the future. I think it is the way we need to think. But I would also say that we have a tendency as scientists and logical people to follow a construct, to follow that logical construct. And many of us focus on the construct to the exclusion of determining whether the different elements of that construct are true or fallacious. So you can have a beautiful construct, and then you have a whole bunch of stuff in between that's incorrect, but the construct is correct. We try to move beyond that. But I think too, it is important to follow an example that many countries in the world use. I am most familiar with Israel. Israel's determination to say everybody else over here believes that something is happening for a particular reason, or something will happen for a particular reason. And then they go out of their way to find somebody else and tell them, you have to take the opposite approach. You must go and prove the thing that nobody else, or try to prove the thing that nobody else is thinking. I think that's how we have to think as we're looking to the future. What happens with biological weapons use for biological warfare and bioterrorism, what happens with laboratory lapses, what happens with naturally occurring pandemics, and how these three things all interact with each other, because they will in the future, are important things for us to address.
Thank you, Asha. Jans, tell us your thoughts about how the landscape is shifting.
Okay, I'm coming at this from a different angle, from the virology side, I would say. And I want to start this with saying I do not like the word biorisk at all, and even less risky research. Because ultimately, I think we as experts look at it from a mathematical point. There's almost zero risk, there's 100% risk. But I think in the public, risk means there's something dangerous happening. The moment you say this word, the discussion is already thwarted. So if you go on a plane, you don't get a crash risk training, but you're getting a safety training with your seatbelt, right? And that changes perceptions. So I'm going to use biorisk because that was the task in the discussion. So I think it's a very complicated landscape because any single activity is affecting the other activity. And so therefore, something that decreases risk in one area might increase the risk in another. And I think that makes the discussion so complicated. So if I think biorisk as a virologist, we are in this wonderful position that we are supposed to anticipate everything that's coming, be ready for everything, and then immediately have something ready, because the public will demand this. But at the same time, we should also be completely considerate, very slow, go through all the regulations, and be as slow as possible so nothing bad happens. So it's very difficult to find a decent middle ground. And the threats are coming from different places, right? There's the natural risk. So we heard kind of, it seemed at least seemingly contradictory things in the yesterday. So we heard there's less contact of humans with animals over time. More and more people live in urban centers, so therefore the risk of zoonosis should actually go down. We also heard the number of infectious disease outbreaks are going up. So either these are contradictory and one of them is wrong, or they have nothing to do with each other. Either way, stuff might be coming our way. We have a responsibility as people, not as virologists, not as experts, but as people, to decrease that risk. And so that starts with, behavioral changes, questions about climate change, questions about nature preservations. All of these things influence how high that risk is that somebody will get infected, somebody will transmit something. Then we have the biorisk in the laboratory. And it's very important to remember that, yes, doing something can increase the risk, but not doing something can also increase the risk. If we are not prepared, we don't have a vaccine, and there's an outbreak, then biorisk is pretty high. On the other side, if nothing is coming and we have tons of activities in a particular area, we increase the risk that something might happen. Then there's the question, what's the biorisk if something goes wrong in the laboratory? It's a complete separate thing, like if somebody gets by accident infected. And here it's very important to differentiate between the individual agents that are worked on and also the different facilities that are worked on. So it's a little bit of a tangent, but we have risk classifications in various areas. We have building classifications, which is like the BSL 1, 2, 3, 4 in the US. They have different designations worldwide, but there's a certain idea that if you want to work on something that has a certain kind of risk associated with it, you need to go into this kind of infrastructure. We have risk group classifications for pathogens, and these are they're not directly linked. You can have a risk group 3 pathogen that requires BSL-4 containment and vice versa for certain reasons. But both of these things are built traditionally, built on the risk for the laboratory worker. They are not built on the idea of pandemic potential. So if you look at a BSL-4 laboratory, with the exception of variola virus, the viruses that are classified to have to be worked in these buildings are not highly transmissible. If you as a laboratory worker get infected, then the consequences can be dire, so therefore biosafety is up. But if somebody gets infected and would actually, in some way undetected, which I don't understand how that could actually work, but if somebody would get out of a laboratory and infect other people, a pandemic is very unlikely to start. But the perception of the public is Ebola and Lassa and Nipah is super dangerous, and so we need to focus on all of these things. If you go one level down, again, speaking about the US, BSL-3, there we have respiratory viruses, or even BSL-2, we have respiratory viruses. And if you, coronaviruses, rhinoviruses, all of these things were worked at these lower levels. They have a much higher pandemic potential in terms of transmission, at least, not necessarily of disease. But we're focusing less on discussing these agents because they don't sound dangerous. And so I think if we want to talk about biorisk, especially with the public, and this is a public meeting, we somehow need to bridge this gap so that the public understands where the actual risks are and are not so much driven by, like, you know, movies and other things. I don't know how to accomplish that, but I think that is a big problem. And then we have the question of overall surveillance, of actually anticipating things and understanding that. And in the mix of all of this, all of these experiments that have been done, we have the biowarfare problem. And so it is, I think we heard yesterday, and I would agree with this, at least on a theoretical level, that there's probably no need to reestablish viruses that have been eradicated. And that we can do alternative experiments to study things and so on. But at the same time, there's always the argument at that very moment, well, somebody else could be doing this, or somebody else could have it in the freezer. And so, you know, then it's coming down to probably what you guys are doing, a risk assessment of how likely is it that somebody has this in the freezer, how likely is it that this could escape or that it could be deliberately released, and are we prepared to say then we don't have anything? And vice versa, if we would start working on this, what is the risk that we create something? So I don't have an easy answer to this. I wish there was a bullet point where I could say we got to do this, and that will decrease the risk. But it is so manifold that we have to work on everything at the same time while finding a middle ground. And I think that's the crux of all of it.
Polian, I think you might have a response to that.
Yeah, so I come at this at a slightly different angle as an infectious disease clinician. So I see patients, and I've been seeing patients in outbreaks, you know, off and on since 2003 with SARS. And I think one of the challenges, and one of the things that we bring in the discipline of infectious disease, is a consideration of the interactions between the pathogen and the human host. So something that's a mild pathogen, you know, and it's an opportunistic infection, if the person is seriously immunocompromised, makes a difference. And I think we should bring that perspective to the discussion of, you know, forecasting or looking at biorisk and how it's changing, because we need to look at the other side of the equation, which is, you know, how is human society changing? Because it's really an interaction between, you know, what's happening with advances in science and biological sciences particularly, and what's happening in society. Because a given pathogen can be much more dangerous if there aren't countermeasures, if there aren't basic amenities. So something like cholera, which is on the upsurge around the world, is a problem in countries where, you know, water and sanitation supplies are less of a problem. It'd be are more of a problem, and it would be less of a problem in, you know, developed societies where that's not an issue. So I think when we look at the range of biorisk, we have to look at the range of what's happening in human society. And I would say that there are probably 3 or 4 changes that have happened that we need to consider when we're looking at sort of how biorisk is changing. I'd say the first one is actually urbanization. You know, 10 of the 20 megacities in the world are in Asia, in many in poorer countries. And one of the implications of urbanization is that respiratory infections with human-to-human spread are going to be more important, just because of the density of populations and how quickly, you know, health systems can get overwhelmed. We've seen that with COVID. I'd say the other part that we sometimes don't think about is, you know, the vectors, urban mosquitoes, for example. So if you think of diseases like a growth stalk, dengue and other arboviruses that are spread by Aedes aegypti would probably be on a, you know, a buy kind of a recommendation. It's a growth stalk. So things like yellow fever, you know, dengue, Zika, chikungunya, we may see sort of more outbreaks of that when you think about urban mosquito vectors. And I think the third part, if you sort of look outside of infectious diseases, is with the rise of urbanization, mass manufacturing, the implications for contamination, and the spread of that, for example, with the cough syrup contaminations, etc. Those kinds of things, as we start to move into larger sort of scales of production, are real issues that we need to think about. They're not as sexy as sort of, the scary sort of BSL-4 pathogens, but they are things that we need to think about. So that's urbanization. The second part, I think, is sort of climate change. And with climate change, again, the effect not just on vectors, but also the extrinsic incubation period for viral infections like dengue and so on. I think we will see more outbreaks of dengue as we move along, and that's already in the near horizon. But also, just the frequency of climate-associated disasters and their disproportionate impact on poorer communities, poorer countries, is something that we're going to have to think about from, what, if you sort of threw another infectious disease in there like leptospirosis on top of flooding or an earthquake, not that earthquake is sort of climate change related, but we are just seeing a lot of these kinds of interactions. And then the impact of conflict, and again, the fact that there are just a lot more sort of vulnerable populations, particularly women and children. But the other thing that has changed also in human demographics is just more vulnerable populations in terms of the aging population. We've got a lot more immunocompromised patients now compared to, say, 20, 30 years ago. You think about transplants, think about people living with, immunobiological, immunomodulators, etc. So I think those are all factors that we have to take onto the other side of the equation. Compared to that. And then the last thing I would throw in is just the issue of sort of the increased sort of polarization between countries and within countries. So, something that might be relatively lower risk is more of a risk when you look at the whole range of vulnerabilities, the weakest links, where things can spread, and just the increased sort of travel and access to migration and so on. So those are sort of the things I think about as a clinician when we look at that range of biorisk. And then you have to factor in all the, the scientific advances, the synthetic biology and everything else. But I don't think we spend enough time thinking about that human side and how that's changing.
Not only about the human side, but Jan's mentioned perception, the public perception about danger. But I also wonder what you all think about how we manage to shift the public's perception in terms of their own behavior and how they should behave after we see many of these outbreaks. I mean, if you look at what happened with COVID, we had so much opposition to the vaccine because people didn't understand the technology that brought the vaccine forward. So how do you think, what are your thoughts on, beginning to shift perception about just human behavior?
I have to jump in. Can you hear me? I have to jump in on this. We talk about COVID, like what happened with so much of the population being so adverse to the vaccine, as if it was some new thing. If look, there are cartoons back from when everybody was still dealing with smallpox in Canada, of all places, of protests. The anti-vaccine people not wanting to take the vaccine. This is not some new behavior. So Suzette, I have to say, there are a whole bunch of old behaviors that just continue consistently. That I don't know if it really has to do with technology or something else, just something to do with human nature. But I think we have to stop assuming as scientists and healthcare professionals and public health folks that somehow that's just going to change as as centuries move on, because I don't think that happens.
Sure.
It has not yet.
Francois, I see you looking down.
Well, I think that one of the things that we clearly have been talking about with the pandemic is a lack of trust on the part of the broader community vis-a-vis what science is or isn't doing. And I think one of the things that became really clear is, in some sense, a bit of a misunderstanding of how science works. And so things get said and published, and that's supposed to be true. And then when science learns more and, from the perspective of some, changes its mind, well then, you were wrong the first time and you said it with so much confidence, as opposed to understanding the ways in which knowledge production happens. And so for me, one of the things that's very interesting in that context is part of the response to this lack of trust has been the idea that what we need to do is to promote transparency and openness. So this has become, amongst the ethical principles on the procedural side, something that many people are starting to champion. And I think one of the things that I would encourage us to think about is how do we problematize that commitment? Because I think in the context of risk mitigation, one can understand why transparency and openness would be great. I think in the context of knowledge production, one can again understand why this would be, something very positive to pursue. But if I think back to your comments at the beginning, Asha, how does it fit in the context of concerns about biowarfare? Are you still championing transparency in the same kind of context of openness, et cetera? Sure. And
people don't want to share information. If it's my country versus your country, or my company versus your company, they don't want to share that either.
Right.
They
and
want
so,
that edge.
Right. So I think that becomes one of the things that's really interesting. So I think we have to actually start unpacking more clearly what is the commitment that we're asking of the scientific community when we say you should be committed to transparency and openness. And in response to the comment about competitiveness, I think one of the things we actually need to do is to shift or change the assumption that competitiveness is the prime mover in terms of the commitment to knowledge production. So I'm at least willing to call that into question. And in my own work, the language I use is collaborative ambition. So what would it look like if instead of being committed to competition, as that's what will spur innovation, we actually thought about collaborative ambition, and we thought about those with whom we wish to collaborate and those who would share the ambition in that sense. But if I can, while I have the floor, there's two other comments I wanted to make, again, in response to things that have been said. So Jens, you went on to sort of talk about the importance of decreasing risk and sort of suggesting it's very complex and how would one go about that. And I think, again, from the perspective of a philosopher, not a scientist, I'm then looking at sort of what are the core principles and values that you want to be able to advance. And I think one of the ones that's really important for us to think about is what would a commitment to social justice look like? And I think we actually heard some intimations of that yesterday in the context of recognizing that in certain low-income countries, the resources, both in terms of just dollars, but also personnel required to maintain some of these facilities is actually quite significant. And so if I think about what Dr. Gao was saying, if we're focusing on that word global, and we understand that this is a global challenge and a global problem, how do we meet that commitment, not only in our own country, but in other countries, and in ways that isn't seen to be sort of imposing from the outside a set of understandings or the ways in which standards should be established. And for me, that raises really interesting questions about how do you have rules, regulations, guidelines, codes of ethics, et cetera, that are context dependent and yet also harmonized. And then the last comment I wanted to make really builds on something that you were saying at the end there, Polian, is that the ways in which society is changing, I think, actually behooves us to rethink how we frame our commitments to social justice. And very often, a lot of that work is written in the context of the public interest. And again, in my own work, I'm actually trying to problematize that concept and to say, actually, I don't think it's the public interest that should be driving what we're doing, but rather it should be the common good. And interestingly, some people use those terms interchangeably, and in important ways, they are different. Ultimately, the public interest can collapse into majority rule. The public interest can collapse into a commitment to certain kinds of processes and procedures which then justify the outcome. It is in the public interest that we should do this. Even a certain kind of understanding of the harm-benefit ratio ultimately, typically, quite frankly, in the context of a commitment to certain kinds of liberal values, translates into an interest for a discrete community. The important thing about the common good is it recognizes that we all, right, us all, have a common interest in things like health, safety, security. And so that would be sort of my last comment with respect to understanding the ways in which the world is changing. We need to actually think about what it would mean to shift our commitment to the common good.
I'd like to also just respond to those questions.
Sure, go right ahead.
I think with an outbreak, one of the important principles we use in public health is and it's also important as a clinician when you're taking care of an individual patient, is the concept of proportionate restrictions. You only use the amount of restrictions that are needed. So I think we need to do a better job of articulating the particular risk So, if you see a guy and he's in your house and you think he has a gun, you would respond very differently than if this stranger was, say, the gardener coming to water your garden. So, in this case, like in Singapore, we were talking a little bit yesterday about when the restrictions started or the response started. And for us, it started on January 23rd. And it was the multi-ministry task force was convened. And then the next day, we had our first confirmed case of a tourist from Wuhan. And some of that context or history of how you respond and how you communicate the risk to your population in terms of making sure that they understand that the restrictions you're taking and the public health measures are actually proportionate to the danger was because, we went through SARS and it had a huge impact on the psyche of Singapore in 2003. And I think many of the countries that went through SARS responded very, very differently. There's an interesting discussion about how people who survived 9/11, some of those who survived had a different experience with sort of responding to personal danger and took it much more seriously in terms of running the minute things were looking a risk. So I think we as scientists and clinicians and public health people need to be able to articulate clearly to the public, to different populations, that the risk and the proportionate restrictions. But the other part of it is actually compassion for the groups that are disproportionately affected by the restrictions. So for example, in SARS, if you were put on quarantine for 10 days, the taxi drivers would rent their vehicles, and so it cost $90 a day, and they would make, say, $200, and the income was $100. And if they were put on quarantine, they basically had the clock ticking. They had to pay for the rent of the taxi vehicle, but they weren't allowed to work. And so, for daily wage workers, they worked out that the government would actually pay a quarantine subsidy to make up the cost of those who are losing income as daily wage workers. So you have to have both sides of that for the public to actually accept those kinds of proportionate restrictions, to know that their concerns, particularly in populations that are more vulnerable, are actually being heard and being met.
Can I just add a comment, though? I think that when we think about vulnerable populations, we also need to look at least if we take the most recent pandemic, the ways in which racialized populations are actually experiencing different risks. In some cases, they're under the gaze of the state in a very different kind of way. And also, in some cases, have had to advocate very strongly to have data collection that actually recognizes different kinds of risk profiles for different kinds of ethnic groups. So that's already 3 different strands of stress, which for different communities are going to affect their interpretation of, one, the risk, but also whether they genuinely believe the state has their interests at heart. And I think that that's a really important thing to kind of layer, on top of that, yeah.
Not to mention the level of trust, and can they actually trust that the state will use the data and the information that's collected in the manner in which they're saying they're going to use it. So I think that's another element as well for vulnerable populations. So, as we move throughout this conversation and think about the multitude of risks that are on the horizon, what are your thoughts on how we begin to improve? First and foremost, from a forecasting perspective, but then from this transparency and openness perspective that we've been talking about. So let's start with forecasting. Paul, Leon, I'll start with you.
Okay, sure. Forecasting biorisk, we'll just use that terminology, is a discipline, and it's basically mapping out in a logical, systematic way the potential risks or hazards that are thrown up by biological advances in biological science, and how that could impact human health and human flourishing. So, if you look at sort of the goal of forecasting, it's really to provide a more robust basis for decision makers, wherever they are, to make a judgment call, usually in situations where there is ongoing uncertainty and sometimes, stakes of different levels. So I think, in terms of pulling people together, forecasting needs experts who are willing to do 2 things. One is to be willing to look at in addition to sort of being knowledgeable about whatever it is, the range of science, to be willing to sort of look at anomalies, which sometimes can be weak signals for changes that are coming, or paradigm shifts. But the second thing that they need is, I would say, intelligent imagination. So the willingness to think about wild cards and things that, like black swans, that look inevitable but only on hindsight. Sort of the outliers that could change, change the game completely. So the WHO conducted a horizon scanning exercise for emerging tech and threats, and that's published in March of 2022, looking at the whole range of sort of different advances in science, and you can look at that. But basically, the need to sort of convene experts is one set of exercises. But in terms of improving biorisk forecasting, I'd say that the first thing we need to do is have better signal concentration. So sometimes if signals are sort of scattered, the thing that makes it significant is actually that concentration, better data collection, and also interpreting it, providing a context so that we can see how it actually, how worried we should be. So, investing in that function of public health intelligence. The second thing is new data sources. We are developing sort of new sources of data, everything from wastewater surveillance. There was a nice New England Journal article on that today, and how we're integrating that into surveillance for things like polio and also AMR, antimicrobial resistance. But we also have to figure out the limitations. So another sort of area of new data would be social listening and beginning to think about analysis of cyber threats and disinformation. So but we have to figure out the limitations on how to integrate that into existing surveillance data. But thirdly, I would say that it's actually human. We have to cultivate networks. And one of the early signals that we get are from alert clinicians, alert lab people, public health people, the people who are on the ground who see that anomaly, and if it sort of falls on the right ground, people will say, whoa, wait a minute, there's something weird here. Yeah. And that's what happened for us with SARS. 2 people from 2 different hospitals said, we've got someone coming back from Hong Kong. And we said, whoa, that's interesting. Maybe we should put a lid on this. But by the time the WHO alert came out on March the 12th for SARS, we were already 4 generations into the outbreak in the hospital. And Tan Tock Seng Hospital, which is where I work, was the hardest hit. So cultivating those informal networks and having those kinds of conversations, like what do you think about this, is actually one of our feelers, and it's not something that we tend to think about. The last thing I'd say is just cultivate vigilance. So all emerging infections come back. We're still waiting for the second coming of SARS, not SARS-2, but SARS-1, and basically rounding up the usual suspects, thinking through where it might come up again. But all emerging infections come back. So, it's just a matter of vigilance.
There's so much I could say from my experience in the world of preparedness, especially with regards to your last 2 comments. But, the piece in particular about cultivating vigilance is something that, as humans, we have a hard time with, especially in America. I always say, we get so complacent. Something happens, we respond, then we forget, and then when it happens again, it's like, oh no, but I digress. Jans, I'd love to hear your thoughts about how we improve with forecasting.
Yeah, so I think there are 3 different ways, or 3 different, let's say, pathways to forecasting, and they don't need to be merged into one. So the first one is something is here already, we know something, and the drivers of it becoming more risky for us are not driven by the pathogen, but by the outside. So that's mainly what I understand you were talking about. So, if we have climate change and we get more mosquitoes, or the ticks start wandering into different areas and they carry a particular pathogen, we might get more cases, and that's a problem that we need to deal with. The second aspect are the unknown black swan events. And so we have, I would say, traditionally the BSL-3, BSL-4 community was in that area. They looked at these very exotic agents where only one case of infection was known in 1960, and they create an infrastructure so that if the unlikely event happens, something comes up, we are somewhat prepared. And I think it's very important to keep those two things separate. The one is an anticipation of a possibility, the other thing is real right here, but we also know how to handle it to a certain degree. And then the third path is the biowarfare question of somebody might do something nefarious and then we're going to be surprised by something. So I think all of these things need to happen in parallel, and the three, let's call them enterprises, need to be in touch with each other. Most importantly, they should not look down on each other, as in like you're doing the same old, or you're doing stuff that will never happen and all of this, right? So there needs to be a little bit of an understanding of why we're doing these individual things. And then it needs to be very well communicated. And so I want to respond to something from before, the question of how can we change the behavior of the public. We need to be very, very careful when we say things like this, because it is very easily interpreted as very arrogant. That like the smart people sit on the podium and say, you guys don't know anything, and so you need to change your behavior. So what it comes down to is how do we provide resources for everyone so that everyone can make up their own minds and understand the complex topics that are being communicated. So it's very easy to throw out there and say, well, we need better education in schools on science and those things. But there have been attempts in the last decade to increase communication, and I would ultimately say they have failed. So many journals, not many, very few journals have mandated for publication of papers to have a common abstract next to the scientific abstract. And the idea behind this, I suspect, was to put into normal words of what you've been doing. But if you look actually how these things are written, they're basically rewording the abstract. The same complicated terms are in the abstract. Now, if the journals would take responsibility to enforce authors to write the same abstract, but you're not allowed to use the following terms, and make this clearer, I think we would move very quickly forward. Right? So don't say SARS-CoV-2 is a nidovirus and that has the typical 3'5' structure. You already lost everyone. But if you say, like, viruses are things like a little bit like bacteria, I mean, like, you need to go into this onto a lower level. You cannot expect people to become virologists. And it's very arrogant to go out there and say you should understand all of this. So I think we need to get away from the individual talking to somebody else or the expert on a panel educating the world on things, but more to a decentralized approach like these journals have been trying to do. And maybe also take responsibility as scientists and maybe mandate it that we do public outreach for real, where we actually explain the work that we do, the experiments that we do, on a kind of common marketplace and in understandable words. And everybody will say immediately, this sounds like a great idea, and nobody will do it. If it's not mandated, scientists are busy, of course, they have work to do. They're not going to get rewarded for these kind of things in terms of pay or grants or whatever other pressures they are under. So if this is not built into the overall structure, that will not change. And so, I have been in these discussions for 20 years, like most of you, and we have talked about public outreach and education and better understanding for those 20 years. I think it's time that this is being institutionalized in some form. And so ultimately, what all of this means to me is that every single part and every single party in this discussion needs to take a responsibility for their own actions and how we could contribute to make all of this better. And so I look at communication with the public a little bit like at communication with editors and reviewers. If I write something and the reviewer bashes me, then I can take two approaches. I can take the arrogant approach of saying, well, that reviewer is really not smart guy, doesn't even understand what I'm saying. Oh my God, is he uneducated? Or I could take it as an opportunity to say, obviously I wrote wrong. I need to rephrase the sentence to make it clearer. And so when we sit here and we say, like, people don't take vaccines, first of all, I would be very careful of mashing people who don't take vaccines with anti-vaxxers. They're very different people. But if we sit here and we complain about that, then we have failed communicating why the vaccines are important. And we cannot simply say, well, they're all vacuous. I mean, obviously we need to come up with better review articles, better interactions with journalists and so on. And the journalists need to take a responsibility also, and I don't know how to enforce that, to get rid of the clicky headlines. We as authors, as scientists, also need to take a responsibility to not put the flashy things into the title, but actually be honest that we're only working with one virus and that this is not extrapolatable to all viruses, that we don't put the obligatory sentence in the end of the article that this will also help against all cancer. You know, I mean, people do this because there is a process of publishing articles and going through journals. So it is a selling strategy, and you know, people learn how to do this, and people are dependent on this process. They need to get good journal articles in order to get the grants. So that needs to be understood, number one. But on the other hand, we could also change the grant structure, the publication structure to a certain degree where we make this unnecessary or where we discourage this. And I think that would go a long way.
Go ahead.
I was going to jump in a little bit on the issue of trust and communicating with the public, because I think there are a lot of, I mean, distrust is not monolithic, okay? There is, it's hard to trust something when you don't understand it, so that's addressing sort of issue of, that you've spoken to. And, you know, I think there is a drop in scientific literacy in many ways, but, you know, I mean, how many people in the public would have heard of mRNA before the mRNA vaccines? You know, the first year of the pandemic, everyone was an amateur epidemiologist. The second year, everyone was an amateur vaccinologist. But you know, I've been doing vaccines for a long time, and I constantly face that challenge of talking to patients, and they'll say, you know, I do travel vaccines, and they've never heard of yellow fever or Japanese encephalitis, and I'll try to explain to them that it's an infection you get from mosquito bites, and they've never heard of it. But then they'll say, what's the risk, doc? And even a simple thing like, you know, influenza vaccine, if you are required to say there is a 1 in a million chance of Guillain-Barré syndrome, and then you have to spend the next 10 minutes trying to explain Guillain-Barré syndrome, it takes a disproportionate amount of time in that interaction, that clinical interaction, that is not appropriate to the importance, the relative frequency. So a lot of times as clinicians, we struggle with how much to tell patients, and how to sort of pitch it at a level that they can understand. And it sounds a little bit paternalistic, but I think what happens is that we're talking about trust in things that you don't understand. Then there's also trust in the process, and then there's trust in the honesty or integrity of the person, the motivations. And I think those are actually three separate things. And if you, for example, trust your doctor that they are not motivated by profit. So I actually will say to my patients, you know, whether I give you 5 shots or 2 shots for this trip you're looking forward to doesn't make a difference to my salary. I'm trying to remove from them that distrust of motivations, which, you know, you hear a lot in the anti-vaccine side, you know, that there's this huge pharmaceutical profit motive in the boosters, for example. But I think we also should take responsibility for how we communicate, because we're often up here in our heads. And one of the things that we tried to explain in Singapore, for example, was the fact that half the people who ended up at one point of the outbreak in ICU were vaccinated people compared to 50% were unvaccinated. And we had to go back and say, actually 90% of the population is unvaccinated. So the fact that 50% of people in ICU are unvaccinated is actually a disproportionate risk. And you know, we were publishing stuff in the newspapers with a lot of numbers, but what you know, I sort of suggested that we actually do it as bar graphs because it's much more intuitive. Very simple ways in how we present data to patients. You know, if you tell someone there is a 1 in 10,000 chance of anaphylaxis, you know, with this vaccine, or 1 in 100,000, you know, that's, you know, it sort of makes them scared. But what I told people during our national vaccination campaign rollout was that we're making all of you sit down for 30 minutes to observe you for anaphylaxis for that 1 in 100,000. We're wasting 99,999, you know, half hours of people, you know, 50,000 man hours, because that's our commitment to safety. You know, we don't want anyone to get harmed, and we know that sometimes people develop anaphylaxis after they walk out of the clinic. You know, we can only keep you here for 30 minutes, but that's our commitment, and we give you information to deal with that tailing risk. So I think a lot depends on how we explain things to patients. and to the population at the public health level.
Sure.
But if I can just jump in here, I think it's really important not to reduce the issue to just science and what you do or don't understand about the science. I mean, if you look at what happened with this most recent pandemic, it was a failure to understand how the political system works. It was a failure in some cases to understand how the research review process works. I mean, like, this happened way too fast. It's like, well, what is it that you think happened too fast? Well, you know, in some cases, it was actually understanding the ways in which governments had changed the review process, not to make it less thorough, but to actually compress timelines, understanding that there was stuff in the pipeline and that we weren't going to take the typical 5 years to review something, right? But it doesn't mean that it was any less safe, right? So I just want to, you know, make it a little bit more complex in one sense to say it's not just about what people do or don't understand about science, it's what people do or don't understand about the way in which the world is organized to promote safety. And then I think the trust part is where I would come back to saying it's not clear that all communities actually believe and trust their government for a variety of reasons. And I think that's really important when you think about it in a global perspective. You know, I was in Vietnam when, you know, I got called back by the government, you know, saying, you know, if you're away from home, Canadians come home, there's something happening. But what was happening in Vietnam was very different in terms of precautionary measures. And what was also fascinating is I felt more at risk getting on that plane and coming home than I did while I was in Vietnam. But when I spoke to people there, it was very interesting. Very quickly they said, my government wouldn't ask me to do this unless it was good for me. And I thought, I can't imagine a Canadian saying that, right? And so it's just a different worldview. And I think that, you know, in a way, like, we can laugh, but I think that's what's really important, is understanding there are different worldviews in which information is being dropped. And people are hearing it differently, and they have a different life history, a different cultural context, in some cases a different religious perspective, a different understanding of science, et cetera. And that's what makes it so complex. So if I can, I just want to respond to your comment about the intellectual imagination and to encourage us to think about the moral imagination. And the moral imagination really has to take us to embracing diversity and respect for difference. And that's what I think makes it so complicated.
Just to extend this for 1 second also to us, because I would say there are many people, even in this room, who do not understand the complexities of doing an experiment, and how much regulation there already is, and why there is a little bit of a chasm between the regulatory, if there's such a thing as a community, and the virology community, because there is this perception that virologists go into, we discussed this briefly yesterday, go into the lab and just say, ooh, today I'm going to do the following thing. And in reality, at least in my world, it often takes a year before you do the first experiment, right? So the understanding, you're absolutely right, the understanding of how individual communities work, not only to the outside in the public and the outside people, but even within the scientific communities, we do not understand each other either.
Right, but I just really want to, you know, insist on the issue of trust, in the sense that when I have my car fixed, I don't actually understand half of what the mechanic's going to do to my car, right? But I'll ask, and I'll get some kind of an answer. But at the end of the day, I either trust that he's ripping me off, or that she's trying to sell me a bill of goods, or. And the world is getting so complicated that the issue really becomes, who am I going to trust? Because I'm actually not going to understand all the science. I'm not going to understand the whole review process. I'm not going to understand the political system. And so the question is, who can I trust? And I think that's where it really comes back to figuring out what are the pillars on which we can build trust for the future. So I think that's where I was trying to get back to the moral imagination, right? Like, what's the world we're trying to build?
And not only those pillars, but who can we sort of work with in more of a collaborative sense that members of the public will trust? Who can we bring on our side to help us relay those messages? Back to the issue of what you were talking about communication with the public. We are running very quickly out of time. I want to make sure that we have at least a few minutes to address some questions from the audience. Asha, I know I think I see you have another comment. But
all I was going to say is everything we're talking about right now, I know we're talking about current day, but all of it can be forecasted and should be forecasted. We should be talking about where things are going to be in another decade, another century. Are we still going to be struggling with trust? Are we, you know, we need to get today beyond the notion of old-timey ways of getting information and understand that, you know, we all have iPhones.
Sure.
That's great. What's happening in another 10 years, 20 years from now? I don't think we're all going to have iPhones anymore. We're going to have something else.
Right.
So I just wanted to make that point.
Thank you.
All of it can be forecasted.
So I see the microphones moving around. There's a question right here in the front of the room.
While that's happening, I just want to make one last comment
Sure.
on predictions. I predict that we will go into a period of apathy and complacence after the. I mean, it happens with every
As we
pandemic.
typically do.
Yeah, it's like the 10 years of rains, the desert blooms, and then there's a desert in between the rains.
I predict that that's not going to happen. And the reason is we have all these infectious disease going on, one right after another. I don't think we're going to get a chance to rest and have the opportunity to be apathetic.
Let's go with a question in the front.
Thank you for a very insightful panel. Paul, I have a comment on something you said about vaccine risk and how to communicate it. When we communicate benefit, that is at a population level. But when we communicate risk, it is at an individual level. So for example, when you tell somebody that if you give polio vaccine to your child, there is a 1 in a million chance of that child getting poliomyelitis, that person perceives it as 100% risk for my child. So this is something that we will always have to struggle with. My question to you is different. You talked about 10 out of 20 megacities in the world being in low and middle income countries. What about the risk of air pollution, which is growing? And again, if you see all the cities that have high levels of air pollution are in our part of the world. How does that play into the added risk of prolonging disease, of increasing the ability to transmit disease?
Thanks. I'd say that actually communicating benefits always at the individual level because I'm a clinician. And I think we actually specifically will say, this will not prevent COVID, but it will reduce your risk of COVID. And if all of us can reduce that risk, it's like having 20 bullets ricocheting around a room instead of 2,000 bullets where you're more likely to stop one. But it's also bringing the disease home to your family. I mean, Singapore is, people live in multi-generational households. And it's also, the risk of infecting kids and so on and so forth. So we do try to communicate that risk at an individual level because people make decisions for their own benefit, but also their families. I'd say about the air pollution issue, it does change and modify the biorisk because I think it makes people more vulnerable to respiratory infections. That's the first thing. Secondly, I think with an aging population worldwide, I mean, obviously in low-income countries, there is a population pyramid that's much more weighted towards younger people. But as the population as a whole starts to age, you actually see long-term sequelae of infections and long-term sequelae of air pollution. And so you're potentially getting respiratory infections on top of a damaged lung. And I think those are real issues that we haven't begun. We think about these risks in silos, climate change, antimicrobial resistance, but all of this stuff actually comes together and weaves together in a tapestry that's, it's sort of an all hazards approach that we need to begin to think in a very sort of interdisciplinary way.
And I would just like to add one comment, though. I think we have very good data that shows the general public does not work well with statistical information. But one of the things that I think is important to say is that when, given the kind of scenario you described, they actually don't move to 100% my child will be affected. They actually move to 50-50. And the reason they move to 50-50 is because the process is it will or it won't. Right? And that's really the only options before them, right? It will or it won't, and we won't know till after the fact. So I think you're right to say that the public doesn't work well with statistical information. We have good data to support that, but the way in which they shift isn't 100% in the wrong direction.
And it looks like we have time for one more question. There's one over to the left side of the room.
See, regarding the framework that we are trying to create, at least that's the mandate of the conference, to handle biorisk. We are talking a lot about trust, and you guys mentioned in different how we regain trust from the public. And I think that we are forgetting one point that is key of everything that we are discussing here, that when something bad happens, the public wants to know how that happened. And scientists, we are giving very generic responses where we are, in some cases, we are saying we don't know what happened. And we are normalizing that when, in fact, that should be one of the first things that we should prepare for the future to handle biorisk. Well, we know next time that there is a problem, the public will demand to know what happened. So if we knew that with coronaviruses, we needed to do a right investigation in wet markets or in different conditions of respiratory, how it is that as scientists, we fail to address that, that response. Why we don't have the samples to be able to test where this is coming from, how to evaluate the risk. Why, if we have so many warnings of this is what happened when there is an outbreak, this is the response that we need to get, we were not prepared. I mean, I hear George earlier talking about all the experience that we have, that China have handling that risk, but we were not prepared to deal with this time to answer, these are the samples that need to be collected, this is the way that we're going to provide the public with information that is needed to say, this is the story, this is the reason that why we are living this. I mean, I think that we need to handle that risk too.
Any response from the panel?
I just say that on the one hand, I think we need to understand that other communities struggle with the same thing. A crime can be committed and everybody can be screaming and yelling about, well, you know, who did it and why did they do it? And law enforcement has no problem saying, we're conducting an investigation and this is what we're doing to conduct that investigation, but we don't know. We don't know yet. The demands still come, but it doesn't seem to matter to law enforcement. They just progress, and someday they say, this is what we think happened. I think that's one thing. I think another thing is we are assuming, because we are a self-selected group here, and we have some bias, that the entire scientific community, medical community, public health community, everybody, that everybody has taken responsibility for answering this question. What happened? Why did it happen? Where did it come from? And I don't think that that's the case. I think we assume some entities are responsible, but I really don't think that's the case. And so in that situation, and what we found ourselves in with COVID and other diseases as well, is we have a popcorn effect, you know, different people jumping up and trying to explain and others not trying to explain. And I think that adds to this whole confusion. So certainly that's something we can address in advance, you know, maybe assigning some responsibility or some people taking responsibility. But until that happens, I think we're stuck with the same, we will always be stuck with the same kind of response and confusion going forward.
I would just like to comment with one sentence.
Very quickly.
Yes, two. I think there is one difference, though, between what Gus says and what you says in terms of the crime comparison. Crime is overall understood by people because they watch crime shows. So there is a certain kind of the process of what the detective is doing, and there's a certain kind of idea how long it takes, and now they're going to do the evidence collecting, and then they're going to ask all the people, and they're going to do that. In science, this is not really understood, and so if I understood what Gus said correctly, it's not about that we immediately can say what happened, but that we can immediately say, these are the things that are in place, what will be done now, step by step, and then these individual results of the individual steps will be communicated properly. Rather than this, there's 3 commissions, very important people that do something.
Right.
Well, I would like to take an opportunity to thank you all for joining us this morning for this discussion, and to ask the audience to join me in thanking our panelists today.
Great. Thank you.
And just as a reminder, in terms of our schedule, we're at the point now where we are going to transition into a break, and we will resume here in this room at 11:15. Thank you.
Oh, yeah, it's coming. Hello, everybody. So I think we're beginning the next session just before the lunch. And we will talk about empirical studies striking risk. So we have been talking a lot about biosafety and biosecurity. And most of us, when we heard these words, we think on policies, regulation, and we forget sometimes that biosafety itself is a science. So in this session, we will present empirical studies that creates the evidence that helps to create new policy on biosafety and biosecurity, but also to boost the compliance to the existing policies and to prioritize between these policies. So today, we have three amazing speakers. Dr. Rocco Casagrande, that is a founder and chair of the board of Krypton Scientific. Dr. Gregory Koblenz, that is associate professor and director of the Bioscience graduate program at George Mason University and Schar School of Policy and Government. And Dr. Weiwen Zhang, that is the distinguished professor of synthetic biology and biochemical engineering in the Tianjin University of China. So I have a question for the three of them. And my first question will be, so could you tell us what is your research and how your research informs biosafety and biorisk measures? So I think we will begin by Rocco.
Yes, thank you for the question. So I guess before I say what I'm doing, I should probably start with why I'm doing it, because I'm not a biosafety professional. So over the last 20 years, we've conducted many risk assessments looking at the operations of some of the highest containment labs or policy affecting the pathogen research in the United States and globally. And while doing these risk assessments, we found that unlike in other high-risk industries, there's critical data lacking about what causes incidents and accidents and really the efficacy of various factors that mitigate risk. And you need that evidence because without it, it's very difficult to understand what factors in the laboratory or what components, what equipment, what procedures generate risk. It's difficult to understand what truly effectively mitigates risk and how to invest resources in mitigating risk. So, specifically, the panel yesterday talked about how containment environments differ from country to country, and that's very true. While conducting the gain-of-function risk and benefit assessment at a panel in front of the US National Academy of Sciences, Ron Fouché said that we had overestimated risk. And when I talked to him at the lunch break about why he thought that, he said that, well, one of your risk pathways is someone spilling a virus culture outside of a biosafety cabinet. And he said that's impossible because we use class 3 biosafety cabinets in Erasmus. And I said, well, Ron, that's really good to know, but our work was focused on the United States, and the very same flu labs in the United States working on the exact same pathogens as you do in Erasmus use an open-face class 2 biosafety cabinet, so you can spill out of it. He was not aware of that working on the exact same virus in these two advanced countries can be done with very different equipment. And the question is, who's right? Is it worth it doing work in a glove box, which is really difficult sometimes and has additional expense associated with it? And the fact is, the evidence isn't there to actually make that decision, so you get two different standards for the exact same pathogen. The other reason why you need evidence is because, scientists value evidence. That's their job. They're creating evidence. And when you tell them why they have to do something that's inconvenient, but you say, we think will bolster safety, they want to see why. What's your evidence? Why do you say that? Otherwise, they're very difficult to convince. And so you need this evidence not just to help with risk assessments, which I like, but also to make smart investments and to boost compliance. And so after complaining about the lack of evidence for about 10, 12 years, decided to try to do something about it. So I decided to try to find funding for research to fill some of these critical data gaps. And in the process, I didn't find any US government agency or NGO that had the mission to fund this biosafety research. But luckily, the Open Philanthropy Project found us and decided to fund 3 critical lines of research. The first of which is on the physical sciences. And here, with our collaborators at UC Berkeley, we're studying the physical processes behind laboratory accidents. So I have some slides here, just to show you some cool videos. So what we're doing is we're trying to understand what happens when you drop something. This is a T150 flask, which is commonly used in viral culture, and what it looks like when you drop it with a very, very high-speed camera. This camera takes 70,000 frames per second. It costs more than my car. And it can generate this visceral evidence to people working in the lab about why you might need respiratory protection. These accidents, this is a 96 well plate dropping. These accidents look very, very sloppy, and you can see very fine particles coming off them. And with holography, we can measure exactly how much is an aerosol versus a splash, which is important for understanding risk, but also convincing people to wear various types of PPE. Additionally, what you can do is once you understand the physics of it, it helps with risk assessments, right? But also, you can start intervening in that physics to re-engineer for safety. Here we have a slide with 2 different Petri plates that are exactly identical, but one has the vibrations dampened in it using marine epoxy. The exact same, the surface that's in contact with the liquid is exactly the same, just one is made to vibrate less. The elastic modulus is higher. And so with that simple intervention, you can create labware that is inherently going to generate less splashes and less aerosols. And that's very cool, because these interventions could be like a penny or 2 pennies per disposable item, because you're just changing the type of plastic or the amount of plastic that you're using. So in addition to the physical science work, I'll hand you that, we're also doing human reliability studies, where we're measuring how often humans make mistakes in the lab. And there, we found that in the life sciences, those data were almost completely absent. So to do our risk assessments, we had to get data on human reliability from other industries, like the rate of fine motor accidents. We had to analogize from aviation when someone was dropping a screw when fixing an airplane engine. And we had to analogize that into the laboratory. That's highly unsatisfactory. So we began to measure the rate at which various laboratorians make accidents while pipetting, how often they splash on the blotter paper, for instance, or on themselves. And in that measurement, we not only are able to, for the first time ever, measure how often per 1,000 manipulations people spill on the bench or on themselves, but also we ask them to call out when they think they made a mistake. So we ask them as they're going to say, okay, I think I touched the tip to the edge of the well, or I touched the tip to my glove or the blotter paper, or the tip fell off. And then we can see how much awareness these trained scientists have of the mistakes they made. And we found that over about 20,000 replicates, about scientists that are working understand about half the mistakes that they make, and the other half are occult. They don't have any idea that they're making them. This evidence is interesting, once again, for risk assessment, but also helps reinforce the maxim that all biosafety officers say, which is every time you work with hazardous materials, you must clean up your entire lab area, and every single time, regardless of whether you make accidents. Now we know why. The answer for why is because you only know half the time you're making a mistake. And we have the evidence for that. The other great thing about these experiments is they're done with a variety of collaborators, some from middle and low-income countries. We had collaborators in Tunisia, collaborators in Jordan. You heard Nisreen Mahmoud yesterday talk. She was one of our collaborators. And a collaborator from a very low-resource clinical lab in Brazil. And with these collaborators, we showed that they can contribute just as much to this research on the safety of pathogens that people can in a very well-equipped laboratory and well-resourced lab, because the main resource you need is worker time. Everyone has time for their workers, and because you just need thousands and thousands of worker hours to do these experiments, so they can contribute very well to it. Lastly, the other line of research that we have is gathering innovations and best practices that are in place in laboratories worldwide. So in this case, in all the work that we've done with risk assessments and containment labs, we found almost everywhere we went, there was a unique practice that was created to address some risk that was found in that laboratory. Either there was an incident and they did a root cause analysis and re-engineered things, or during their process of risk assessment, they identified some residual risk they didn't like, and so went on to create a further mitigation. These innovations we found were largely unique to their laboratory. They weren't being in place elsewhere, except they could have value in more places. The only reason why they weren't in place in more locations is people didn't bother to tell anyone. They didn't know they were being innovative. It was just their job. They didn't appreciate the creative thought that they were doing. So we undertook a project to interview about 60 or so thought leaders in biosafety and research in North America and Europe, and then about 60 or so thought leaders from low and middle income countries from about 50 countries. And we identified their practices, evaluated the ones that could have benefit if deployed more widely, and then brought everyone together to evaluate them jointly and disseminate the practices that we thought had value. And we're slowly writing that up into a book that we'll give out to disseminate that a little bit further. And I think those are the research lines I'd like to talk about today. Greg?
So Greg.
Great. Thank you. And to understand tomorrow's pathogen research agenda, which is the focus of this conference, you need to understand what the pathogen research enterprise looks like today, and what are the measures in place to ensure that research is being done safely, securely, and responsibly. And that's the primary purpose of the Global Biolabs initiative that I co-direct with Felipe Lensos from King's College London. When we started this initiative back in 2021, our goal was to provide as comprehensive and accurate a picture of the maximum containment labs around the world as possible, given the heightened interest in these labs in the aftermath of COVID-19. We've since went live with the website in May of 2021. Since that time, we've had 90,000 unique visitors. We average about 1,800 views a month to the website, which was rendered beautifully by the talented team at the Bulletin Economic Scientists, and so it provides a very user-friendly interface for both the public and policymakers and researchers to explore the world of high containment laboratories and biorisk management. We've also expanded the site to include not just the BSL-4 labs, but also BSL-3 enhanced labs. In addition, details about national biorisk management policies, including biosafety, biosecurity, and dual-use research oversight. You can find our latest report that we released last month here at the conference, at the table outside, as well as it being available for download from the website at globalbiolabs.org. I unfortunately don't have time to give you the full rundown of the report, so I'll just give you a couple of highlights, and I encourage you to visit the site to get more information if you're interested. So overall, there are more than 100 high-consequence biomedical research facilities around the world conducting research with dangerous pathogens of a variety of sorts. 69 of these labs are what are called BSL-4 labs in the US designation. Other countries have other designations. These 69 labs are either in operation, under construction, or planned in 27 different countries. In addition, there are 57 BSL-3 enhanced laboratories that are BSL-3 labs that have undertaken additional biosafety measures to conduct research that is higher risk than that usually conducted in a BSL-3 laboratory. We've also collected data on the characteristics of these laboratories. So, for example, about 75% of the BSL-4 labs, 80% of the BSL-3 enhanced labs are located in urban areas. In addition, we've tracked the growth of the BSL-4 lab enterprise over the years. And based on our data, about 3/4 of all BSL-4 labs have become operational since 2000. Right? And this was due to a large building boom in high maximum containment laboratories after the anthrax litter attacks in 2001, after SARS in 2003. And in addition, there's been an additional building boom due to the pandemic. We've had 9 countries announce plans to build 12 new BSL-4 labs since the start of the pandemic. For 5 of these countries, this will be their first BSL-4 lab, and most of these new labs will be built in Asia. And I think that helps highlight the areas that need further attention from a biorisk management perspective. We've also, in the latest edition of our report and our website, we've included information on the national scorecards for biorisk management that evaluate the biosafety, biosecurity, and dual-use research oversight policies in place in the different countries that have BSL-4 labs. And this is original data generated by the Global Biolabs team. Speaking of which, we have two members of the team in the audience, Myra Emineros from King's College London and Becca Ehrenhardt from George Mason University. Without them and the rest of the team, this research would not have been possible. Again, just to give you kind of the quick snapshot of where we are at with biorisk management in these countries, biosafety governance is the most well-developed of these three areas. 21 countries that we evaluated out of 27 scored high. The weakest areas were in the areas of inventory requirements and required use of PPE. On the biosecurity side, I think it was 12 countries scored high, and the rest scored medium and low. And in that biosecurity domain, the biggest weakness was the lack of rules about screening DNA synthesis orders for biosecurity. In addition, the number of countries with cybersecurity requirements was also on the low end. The area which we are weakest globally is on dual-use research oversight. Only one country, Canada, scored high in that regard. Two other countries scored medium, and the rest of the 24 countries we studied scored low. Many of those countries received a score of 0, meaning they have no mandatory or voluntary measures to monitor dual-use research in their country. So as you can see, there is still a lot of work to be done in this area to enhance biorisk management around the world. We have a set of recommendations in a report, which I won't go through, but I definitely encourage you to download the report and visit the website. And if you have feedback or comments on our data or on our report, you can contact us via the website, and we're always looking for comments and ways to improve our research. And I'm happy to answer questions when we get to the Q&A session. Thank you.
Okay.
Dr. Wei.
Okay, thank you. And I think before I start, I would like to introduce my background a little bit so you can understand what we are thinking. I'm a microbiology by training and also currently a synthetic biology scientist. But unlike the expert in this room, we are not working with pathogen, and we basically use the synthetic biology working with the good bacteria, basically like cyanobacteria, and to use CO2 and generate good compounds. But we are a group, the first group of scientists in China who realized the potential dual-use issue of the synthetic technology, synthetic biology technology, and the related technology. So about 9 years ago, and we start those kind of discussion and what kind of regulation, what kind of mechanism we need to safeguard the progress of the synthetic biology research in China. So we have, since then, we have been doing sort of half time for me and still working on the wet lab, but also working with the policy study. Before I give you some of the example that what we have done in the last 7-8 years, I will give you a couple of figures so you know the big picture. So in terms of the synthetic biology research, I think starting in China in 2011, I was among the first grantee receiving the National High-Tech Grant. At that time, the first 5 years is 2011 to 2015. The total money investment in the synthetic biology in China is close to $80 million, $80 million. But in the second 5 years cycle, that's starting from 2018 to the end of last year, 2022, the number increased to $382 million. Under the new circle, a 5-year circle starting from this year, we expect there will be $6 million spent on the synthetic biology. So you can see the number increase significantly, and also the personnel involved in synthetic biology research. For example, I remember that 2011 probably will be less than the people in this room, I think, working on the synthetic biology. But for right now, I just simply calculate the grant number, I think probably close to 10,000 people working on the synthetic biology in China. And give you an example, for example, my university, Tianjin University, is one of the leading synthetic biology research institute in China. We have about 1,000 graduate students working on synthetic biology and 200 or 300 new students coming every year. So that's the scale and also the number we are looking at. So we realized that, I mean, with the fast moving of the synthetic biology technology itself, and also the significant investment from the government, also in recent years, also from the private funding like venture capital and all that. So we need a mechanism to make sure that the technology is really doing good, doing benefit to the human society rather than something going wrong. For example, after the pandemic, when you introduce yourself as a synthetic biology, and the first question people will ask, are you working with virus? Something like that. I think, I mean, we need a mechanism to doing that. So in the last 7 years, I think we have been making effort in 3 aspects. I will introduce them. And the first one is at the national regulation and the law level. And in 2018, I'm leading the effort, basically writing the drafting the first biosafety protocol related to the new technology, and which was implemented by the Ministry of Science and Technology of China in the summer of that year. In that protocol, basically the first time we introduced the idea that biosafety is not just related to the pathogen, but also related to the technology itself. So we need to have certain regulation on that. For example, we basically also suggest 3 levels of the regulation for different risk level, basically high risk, low and middle and low risk. And also we suggest that every institution need to have a biosafety committee related to the new technology. And also, it just give you a number. We pull out the number related to synthetic biology out of NSF of China to see how many institutes getting grant related to synthetic biology. The number is 1,200. So you can imagine that a lot of people are doing this work, but without any biosafety or biosecurity regulation on that. So we started to work on that, and the one I just mentioned, 2018, that's one example. And also later in 2020, that's the Chinese biosecurity law, actually for the first time, also including the governors of dual-use technology into that law. That's also part of our contribution. So that's we try to set up a high-level regulation at the national level. Meanwhile, we also sort of expand our efforts, also drawing the collaboration from outside. My center is collaborating with Johns Hopkins, and we have a dialogue, track 2 dialogue between the US and China. That's happened 2019 in DC. And we're basically talking about the 2 major countries, what we can do to safeguard the synthetic biology research, which, I mean, the meeting was very good, and unfortunately it was interrupted by the pandemic. We still hope that we can resume it later the time in the near future. More recently, I actually working within the framework of BWC and collaborating with Johns Hopkins and also the AIP. We proposed a code of conduct called the Tianjin Biosecurity Guideline. Some of you may heard about that. We basically want to build or promote a culture of responsible research, especially in the bioresearch area. So that's the first aspect we have been working. The second aspect is education. Especially after the pandemic, we realized that how much we need regarding the education in terms of the biosafety and the biosecurity. So actually starting around the peak of the pandemic, that's, I remember it's March of the 2020 in China, that's pretty much the peak time. And we started several courses open to the general student. Actually, 85% of students coming from different, from the a major outside of biology, like a computer, social study, and the law school, and so on. And so far, we have put through more than 1,000 students out of the training at the end of last year, so within 2 years. So the idea is, in the future, I guess, by economy or by industry, basically, will utilize expertise from all major, and we don't want to limit our education to the bio student. We want to have education, more general biosafety education for general students. So for that kind of work, we also realize that how limited for the textbook and the teaching protocol and all that. So we are actually the first university basically implement those kind of education for engineer school. And so most of them probably will also go into, either they go into the government job or go into the industrial job. They probably will also relate to the biology or biosafety. So we give training to them and make some good effort. And more recently, we working with our colleague in UK, and we are writing a first textbook on biosecurity and biosafety. I hope it can be finished this year. The last aspect we have been working is tools. And I think both computational tools and the experiment tools for synthetic biology. For example, one of the work we finished recently is through the process of synthetic biology research, we try to identify the risk on each of the steps. And then we send out a questionnaire to the PI of the national project to ask them to identify the most possible risk step. And of course, there are many of them. And it's just turned out that the attitude towards biosafety turned out to be the top one, and the people think is the most important fact related to the safety and the biosafety of the lab. Other facts like infrastructure, quality, and years experience, and also the lab hygiene condition, and all that actually come lower than that. That's very interesting finding we found that, and also highlight the importance of the biosecurity and the biosafety education in China and also in other countries as well. I think that's pretty much the three aspects we have been doing, and also a little bit introduction to our institution. Thank you.
Thank you. So I have a second question before going to the public, and that would be like, what were the main challenges you faced during your research, and what lessons you learned from these challenges? So we can begin again by Rocco.
Sure. Well, the first challenge was finding an organization to fund the work, which I must say is still a challenge. I'm kind of surprised that we're several years later and there still isn't really an organization within the US that understands biosafety research as their primary mission. The second is we were working with researchers who either had not thought about biosafety before. So the data I showed you on the splashes is from people who are in the mechanical engineering department at Berkeley, but they had the tools to investigate some of these phenomena that we knew informed biosafety. So convincing them that these are interesting problems and that they should pivot their lab to this work was at first difficult, but since that time they realize how many data gaps there are and how fruitful this field of research can be, so they want to continue on. The secondly was engaging people who were already in the field of biosafety, but not on the research side. So our collaborators at the University of Maryland and Colorado State are in environmental health and safety. It was difficult for us even to give them money and for them to accept it to do work because they're in the overhead side of the university, not in the research side. So that was also a difficulty.
So what about you, Greg?
So we had a number of challenges. I mean, one of them relates to the fact that there's the terminology biosafety, biosecurity, dual-use research is not always used consistently, both between countries and even within countries. The way that countries designate biosafety levels and containment levels varies, particularly when it comes to the BSL-3 enhanced labs. There's very little national guidance on what that means. There's no international guidance whatsoever, and so there's a lot of variability in what labs consider to be enough additional safety measures to consider themselves a BSL-3 enhanced lab. A lot of these terms get used interchangeably. We studied 27 different countries, so there were language barriers to making sure that we're finding the right documents, because just the absence of the document doesn't mean they don't have regulations. Maybe we just can't find it. So that was a very kind of long process to make sure we were actually gathering all the right data and we were getting it translated properly. And then I think building the map was a challenge in terms of making sure that we had the right locations for laboratories and affiliations, institutions, and that sort of thing. And again, we took a lot of care to make sure we were getting it right. But that is a whole separate skill set to do kind of the geospatial analysis and do the geolocation. So I think we did a good job overcoming those challenges. But again, if people do find any ways to improve the site, we definitely would welcome the feedback.
So, and for Wei-Wen, I think the same question, but I will have, even in this field of synthetic biology, there's the research itself, but it has been also a movement of open research. Yes. So how do they interact, or how do they see when there's guidelines or there's regulation that trying to be included in these fields by other organizations or by governments that are not part of that movement? So, yeah.
Okay. I will try to answer the first part of the question first. That's the challenge. I think I can see, in the last several years of working in this particular area, I think I can see two major challenges we have been facing. The first one is actually the attitude from scientists. I think, myself is a scientist, and we always think that as long as my intention is good, I have every right to do everything I want. So that's what science should be, right? I guess, that's somehow when we start to, talk to people and discuss with people the potential issue, and I don't think everybody agree with us at the very beginning. I think most of us, I somehow recalled that I was giving a talk in Tsinghua University. I think that's before the pandemic, and several of the people in the audience started to question the potential. How much, how much the probability on that kind of things actually happen, and whether we need those kind of regulation for that. So that's one of the challenge, I think, through the pandemic, I think people are changing. Somehow, at least, I can see that kind of trends is changing. The second one is we are still working on that. That's sort of like the balance between the free science and the innovation and also the governance. I don't have a very good answer to that yet, but also that's different in different countries, basically. For example, in China, we really hope that bioeconomy can be part of the overall GDP, maybe a higher percentage and all that. But at the same time, almost everyone, especially from industry, they don't like this kind of governance or regulation, because that means cost. So we also facing a lot of those kind of issue, and up to now, even we have a China biosecurity law basically cover the dual use issue. But when we going further for the real practical regulation, still have a long way. Basically just cannot get a good balance, or cannot reach agreement what would be the best balance on that. Okay, that's the two major challenge. And to your second part of the question, I think for example, for the DIY group, and even the industry, industry, of course, they have different size. Some big company, they probably capable of doing, accept certain amount of regulation. They have people to deal with that. But when you think about the smaller one, like startup, for example, in 2018, when we proposed that every institution need to have a biosafety committee, and immediately the staff said, I'm not capable, and I cannot afford on it. So those are the real issues that we don't have a very good answer yet. But alternatively, we are thinking about, okay, if initially we are thinking about on the national level, and then the second level will be at the institution level. If not happening, then whether we have sort of intermediate, then we have another level, basically draw the expertise from the nearby university and institution to service to the industry and all that. So those are the issues I think a little bit related to your question. But regarding the people are doing the work in the garage, I don't think right now actually we have a good answer to that. I don't think they even know what the regulation is look like in the country. A lot of them just treat science as a free hobby. I can do whatever I want as long as my intention is good. It's actually has been discussed in multiple locations and the meeting. I don't think I have a good answer yet, but I welcome any comments on that. Yeah, thanks.
Thank you, thank you. So I think we're just in time for questions from the public about, yeah, so we have 3 questions, that's perfect.
Jonas Handbrink of Oxford University. Thank you very much for all the really interesting results, and I think this is exactly what we need to make better policies. I want to briefly plug some of my own work here. We're currently putting together a bibliometric analysis of enhancement of potential pandemic pathogen studies in influenza virus research. And we have some very preliminary results. I think overall we see that we identified about 50 studies over the last 12 years. And there was an increase in the last year. In 2022, we found a lot more studies. And overall, over the years, we also saw that there was a shift towards an increasing fraction of the research coming from Asia. And overall, I just want to say, if someone has any input, I'm very keen to make this study as helpful and robust and non-polarized as possible. So if anyone wants to talk to me about that, please do. One more question. Jens was saying about the BSL-3, BSL-4 lab challenge, that actually the more potential pandemic pathogens are being studied in the BSL-3. Greg, how do you see that impacting on the global biolabs work?
Yeah, so...
One member's supposed to take 3 questions.
Oh, yeah, 3 questions.
It's tempting, though.
Thank you all. I just want to thank you guys for your talks, but I would argue that biosafety as a profession is falling behind in synthetic biology worldwide and in silico. So I guess I have a question about what your thoughts are on how to improve it, and whether you'd make your guidelines more accessible to others around the world, for example. But kind of, and maybe to Rocco, I just want to make a comment. I don't know about funding, but during the pandemic, we were constantly dropping tubes of saliva when we were doing our COVID testing, and we didn't have any good data to say how far you could, have your next person spitting into a tube, because we did saliva testing for COVID, and we dropped them all the time. So I'm sure we caused a few people to get sick. But then, how do you build trust? Just kind of getting to the last panel, this is my question. How do you build trust based on the work that you're doing and not instill fear based on watching those things drop? How do you make the public, or not how do you make the public, I don't want to manipulate the public. How do you argue that the work that you're doing is actually for good, and how do you build trust?
Yeah, that's her question.
So this is for Rocco. Thanks very much for the work you're doing. You and I and others have had lots of conversations about the lack of empirical evidence behind biosafety. And I think it's very important that someone should be taking the lead in this, so thanks for that. Has anyone started looking at how organizational structures for considering risk and managing risk impact the efficacy of the response?
Okay, so I think we can begin. Maybe you can go first with the BSL-3 question, Greg?
Sure. So we we started with the BSL-4 labs in 2021, in part because they had the highest profile in the public due to the pandemic, and also, quite frankly, we knew there was a limited number of them, and so it was a way to start the process and get information out there. But we recognize that these were not the only labs that were conducting potentially risky research, and we said so at the time as well. When we moved to the next phase, we did think about looking at all BSL-3s, but I know from other studies that have been done that there are probably thousands of these labs around the world, and that was a little bit daunting. So we decided to expand our scope to the BSL-3 enhanced labs, and those are the labs that have actually been used, for example, to work with reconstructed 1918 virus, to do the gain-of-function research with mammal transmissible H5N1. So those are the labs that typically have been used to conduct research that is of concern for producing enhanced potential pandemic pathogens. Does not mean that there is not similar work being done at BSL-3 level or even lower, but given that these labs are promoted and described for that purpose, that's why we focused on them. If someone has the funding for us to go out and count the thousands of BSL-3 labs, we'd be happy to do that. But we recognize that would be a major undertaking. So we're trying to keep the scope limited, but acknowledging that there is other activity, other research, other facilities of concern. But it's a lot harder to map those than the ones we've identified.
I will comment on the synthetic biology question. It's, I guess, especially not just synthetic biology. For most of the sort of cutting-edge new technology research area, it seems to me it's almost like the quickest, the better. It's basically you try to come up with a new idea, and so that's how the society move forward. What we are trying to do is basically just to sort of ask people basically, or implement a checkpoint. Just think about the biosecurity and the biosafety consequence related to this research. I don't think anybody, or most of the people, when they do the cutting-edge research, they take that into consideration. I think they just do it, and I'm small scale, I'll just do it. But at this moment, even the small scale, I think, it can be going very fast. I think with new technology, for example, the AI-based design and also the high throughput technology, even a small idea can actually have a very big impact later on. I recall when the COVID-19 DNA sequence was released. I just recall that George said that's January of 2020, and then somebody in the community already started to synthesize the spike protein, the gene, and the synthesis of the gene, and put them in the vector, then ask everybody, if you want to do research, I will share with you. I was a little bit shocked at that moment. I think that's February of 2020, because the gene encoding the spike protein has been synthesized and freely transfer between people, and there's no regulation on that. Of course, later on, since the thing is too big, nobody cares about the small thing. But just think about the risk. If you have the similar things happened, not at this scale, at COVID-19, and the scientists just freely synthesize the whatever gene they want and give to people to doing research, that's actually a very significant risk associated to that. So that's why we are thinking sort of build a culture that for the scientists, when you start something new, and just have a second thought or give a checkpoint over there to think about any association or any issue with the biosafety and the biosecurity. But overall, I think, that's one end at the sort of scientist level. That's why we promote the code of conduct for scientists. But at the same time, I think that's probably not enough. I think that's why different level of regulation need to be kicked in. I think that's what I see for the issue. Thanks.
Thank you.
And then to Tim's question regarding the role of organizational and administrative setup in biosafety, I'm not aware of any other studies that are going on that way that are very evidence-driven. I have to say, there's a lot of really interesting studies that could be done. So for one, in the United States, we have some institutions that centralize shipping and receiving of pathogens, and others let it up to the lab level. And you get very interesting differences in the types of incidents that occur, whether you have professionals packing and receiving pathogen shipments versus not. And there's reasons for them to be set up in the different ways. So just understanding what the costs and benefits are of those different setups, and then what the effect is on safety and incidents would be extremely interesting. One of the things that stymied that type of research is an inability to measure anything, because luckily accidents are very, very rare. So you don't really have a lot of opportunity to measure. So one of the studies we just did was in collaboration with the University of Chicago and George Mason University and Texas AMU. They were able to share with us their records of violations of laboratories upon inspections. And we were able to look at all the different laboratories run by various PIs and look at their rate of violations over the years, and importantly, the rate where they got cited for the exact same violation multiple years running. And we found that with this very objective and transparent and evidence-based approach, we found that indeed there are just a handful of labs, roughly 20% of labs, that are responsible for 80% of the repeat violations in an institution. So there's something about this small minority of labs that isn't embracing the culture of biosafety. And now that we can measure it in a way that it's not just the biosafety officer doesn't like me, right? Well, now that we can measure it in a transparent way, there's a lot that you can do to start understanding, well, what are the differences between these low-performing and the vast majority of labs? What is it about the way the PI interacts with the lab? What is it about senior postdocs in the lab? What is it about their operations? So you can begin to answer those types of questions. To answer David's question about how these types of studies don't kind of reinforce the fear, I would say there's two things there. One is our studies that we publish, we always say that we're doing this because there's an intervention, right? We understand the rate at which Eppendorf tubes splash when you open them to determine whether you should use Eppendorf tubes versus screw cap tubes, versus open them in a biosafety cabinet more frequently, versus clean up more frequently. There's always a mitigation. You just have to know what the costs and benefits of that mitigation are, so you need that research. Secondly, and this was kind of epitomized during the gain of function, risk and benefit debate, there's often a disconnect in the public discourse between an incident and a pandemic. I drop the T150 flask and all of a sudden there's a global pandemic. When in fact, there's many, many levels of causation between those, all of which you can interrupt. So you drop the flask, then you fail to get out of the way, you fail to self-decontaminate, your PPE is also faulty for some reason, and then you get a lab-acquired infection. And then that person fails their occupational health and safety protocol, so they don't necessarily isolate, or they don't do whatever, and then they interact with the public, and that causes a secondary transmission. And then there's also a failure of nature in that the virus doesn't self-extinguish. There's all these cascading failures that have to occur between oops and pandemic that a lot of people don't get, and we try to always communicate that as well. I think lastly, related to Jonas, what you said, and also what Jens was saying earlier, related to the levels of biosafety and how biosafety tends to always be the science of go slower or the science of more, do more, because the reason why it's that way is we don't really have evidence. All we can say is, it seems kind of risky, let's also put this extra engineering control or this extra environmental control. And what I hope the biggest impact of this research is we understand the actual efficacy, the cost efficacy of each one of these things we're putting in place, which makes biosafety more sustainable. You do only the practices and buy only the equipment that is actually buying down risk. Everything else goes to support the scientific enterprise. And that's not only good for science in like the Western world, but also when you think about the global South. Right now, it's really hurting sustainability because we outfit these labs to Western standards when we might not need to. They could potentially do the work just as safely with half the equipment that they already struggle to maintain. So these data hopefully will help boost the practice of science worldwide by doing exactly what you need to do and no more.
And if I just build on that, I think there's particularly significant gap for biosafety research on the BSL-3 enhanced level, because there's a kind of a menu of options that labs can put in place to be enhanced, and yet I'm not aware of any research that's been done that correlates these additional safety precautions with actual reduced risk posed by whatever experiments or pathogens they're working with. So I think that is a big hole in the biosafety kind of research literature.
Yeah, I think maybe one or two more questions, because there's
The
no more
clock went
time in the clock. So,
Probably around
oh
the
my
time.
God, there's many.
5 questions. 10 minutes.
Okay, nice, thank you.
Okay.
Hi, this is a question for Greg. So very interested to see the information that you all put together. Been very impressed. And I think it kind of ties into some of the discussions we've had in earlier panels about the issue of transparency. But not all individuals, institutions, governments have same perspectives on transparency or the exact value of it, or what type of information we should be transparent about. So I'm just kind of curious in terms of whether your work has generated sort of negative reactions. You don't have to name names or anything like that, but just if it has, and if it hasn't, that's great. That's a good sign. But if it has, I'm just kind of curious about what kind of resistance you might be receiving in terms of making this information out there and available. Thank you.
Hi, quick question for Rocco. We know that when we talked a lot about risk assessment, but there are two sides to that, or two elements to that. The risk side, which is what we focused on here, but there's also the benefit side. And I know you've done a lot of work actually on the benefits side and how we elaborate that. And I was just wondering if you could quickly speak to that, just to put that on our map as well. Thanks.
Yeah, it is still two more.
Good morning, Johnny Nemi from WHO. I would like really to thank this panel. It was really insightful to see the evidence-based approach. I really commend this evidence-based approach, and I really think that scientists, we should be focusing all our risk information and all our approach to this evidence-based. And I'm very sorry to hear that there is a lack of funding for risk evidence, because in my opinion, this is a bottleneck that could really solve many of the problems that were discussed in the previous panels. The lack of trust, lack of discussion between governance and science, etc. I think our role as scientists is to be solid in evidence-based science and not talk about policy. It's not our job. We just stand behind our scientific results. And if I want to take one thing after this panel, is that make all the best to enhance and support this evidence-based approach and a risk management approach to biosafety and biosecurity, because all these issues you mentioned are really insightful, and I would really hope that a fora like this one would encourage donors to support this kind of approach. Thank you very much.
I think there was one last one.
Yes, hello. So I have a question about international cooperation. So the cooperation has been damaged, as has been said by Dr. Gao earlier. So, like, what are like the opportunities to restart, relaunch those cooperation, especially in the very tense geopolitical context between China and the US?
Okay, so I think we can begin maybe by Greg and the reaction to the BSL-3 studies.
Sure. So transparency was a very important part of our project from the beginning, and all of the information we used was from open sources, from the websites of these laboratories, scientific articles, the public CBMs that countries submitted under the Biological Weapons Convention, because they are required to declare any BSL-4 labs that they have. So all of that data was incredibly useful. And then we used that then to contact the labs and confirm the information that we were putting on the website. So our goal was to have this transparency, in part to provide this information to the public and policymakers and researchers, but also kind of to help demystify what these labs are and what they do, and not make them seem mysterious and and dangerous in any way. And I think some of the research we did has kind of dispelled some of the myths or misperceptions that you have in the public. So, for example, there is a notion that all the BSL-4 labs are all these gigantic research laboratories with thousands of square feet of lab space. The reality is, half of the BSL-4 labs are less than 200 square meters in size. Right? That's the size of a tennis court. Only, I think, less than 10 of these labs actually are more than 1,000 square meters in size. So they're just not the ones that are typically seen in the media. In addition, there's, I think, a misperception that most of these labs are military labs or top secret labs. The reality is most of them are public health institutions that are run by governments that are engaged in public health missions. So I think by providing this information, we're able to help kind of demystify what these labs do and how they operate. And I think that's to the value for the BSL-4 community, and especially in light of we are living now in an age of disinformation, and there's a lot of bad information out there about BSL-4 labs in general. I think we're trying to counteract that and provide an antidote by being as open and transparent as we can, and providing as much complete and accurate information as we can about these facilities.
So, Greg, to follow this question about the reaction of the countries where you were studying, so what happened with the countries where you ranked that the guidelines were around 0? So how do they react to that? And if there was a guideline or help that we can give to these countries to try to upgrade quickly the ranking, because they already have the labs, so...
Yeah, so far we haven't, I don't think we've encountered any resistance to our findings or disputing our findings. And in terms of what can be done, again, we have a whole bunch of kind of recommendations in the report. One thing I'll also highlight is the global guidance framework for responsible use of life sciences that the WHO put out last year has, again, a number of recommendations that any country can put into place, as well as things like ISO 35001, which is the international standard for laboratory biosafety and biosecurity, which provides a ready-made template that any lab can adapt. And also, it's worth noting that among the countries that tended to score lowest on biorisk management, including biosafety, biosecurity, and duty research oversight, many of those countries don't yet have operational BSL-4 labs. They're the ones that are planning to have these labs, or they're under construction. So there is still time to help those countries enhance their biorisk management policies and make sure they have the right legal regulatory infrastructure in place, so that when the laboratory infrastructure is operational, they'll have the right governance measures in place as well. So again, I think one of the values of this research has been to show where our current weak points and how much time do we have to help put in place some interventions. And I think especially the panel yesterday that had the International Federation of Biosafety Association on it, and the International Experts Group of Biosafety Biosecurity Regulators, those are the kinds of organizations that can provide the assistance to help make sure those countries can enhance their biorisk management policies in time for them to be operating their labs safely, securely, and responsibly.
Thank you. So I think we can continue with the other questions.
Sure. Philippa, to answer the question about assessing benefits, yeah, if you look at what we did in the risk and benefit assessment for gain of function, we don't expect anyone to be able to replicate that. That was thousands of persons' hours of research, understanding what the scientists themselves thought were the benefits, and then talking to pharmaceutical companies, people doing biosurveillance, governments, et cetera, about how those data are actually used. And no one can do that. So the benefit assessment, understanding the benefits of pathogen research, has always been the missing leg of the stool when evaluating the value of research. So scientific merit has always been part of the analysis. And then we've had biosafety risks and biosecurity risks, but there was never the piece of, well, what is the benefit to public health and medicine of this research? Because that's been too difficult to do. So a while back, we got funding from the Future Fund under the direction of Jonas. And we developed a very simple scheme that anyone could use. So like a group leader or even some like government employee could use to assess benefits of research by understanding the likelihood that the pathogen that's under study will circulate and cause harm, which is a concept that Gustavo mentioned just yesterday. It's that basic concept of how likely is this pathogen to cause harm. And then also how well known or how much anticipated any modification to that pathogen is going to be. Like if you know that there's evidence in nature that there's like genetic shift or genetic drift to evade immunological response that's going to create this pathogen or modify it in the future, then it has a lot more benefits to research that than a change that's just merely hypothetical, something that could occur, but there's no evidence that could occur. So by using those two factors to understand the potential benefits of research, and those are data that you could find basically from Wikipedia, right? It's not something that's hard to find. You can kind of place any pathogen research on a field of how much benefit it would be so that you have the evidence to weigh its scientific merit and biosafety and biosecurity risk to make a better informed decision. And once again, speaking of funding, because the Future Fund no longer exists, that work is kind of on pause.
Thank you.
I will finish.
Yeah, please.
Okay. I will comment on the funding issue and also the international collaboration. I think, especially in the synthetic biology area, I agree that the funding actually for the policy and also for the biosafety research are really limited. I think until last year, we finally convinced the government agency to fund the first project focused on the risk analysis related to the synthetic biology. That's so far only one in China. But meanwhile, we see the needs even for like quantitative methodology and for the fast-moving research area and very dynamic, and you need very sophisticated technology and analyze tool to deal with that. Those are not available right now. I think need people, need funding to do that so we can answer the question like I mentioned before, how to strike a better balance between the innovation and also the risk management. So I agree with that. In terms of the international collaboration and all that, I think actually I personally saw that, for example, the United Nations organization like BWC and the WHO already taking lead on that. I think I sort of hope that those kind of lead can be more significant. I think, for us, we do have individual collaboration across the country, but those are very limited. I think at the UN level, if this kind of platform or can provide this kind of a platform for the international collaboration focus on certain area like synthetic biology research and the risk related to that, that would be wonderful. So that's just my comments. Thanks.
Yeah, thank you. So I think the time is up, so we have to wrap up this session. So I think what I really like of this session as the WHO in speaker talk is like we really see the necessity of evidence in biosafety. I think it will really help all the different points we have been talking in this meeting. First, to really design measures we can prioritize that are really necessary and not to have the impression that we are mitigating risk, but maybe it's not the right answer that we're giving. Second, to the researchers, so we can ourselves understand the importance of each of the measures, so we can really understand the compliance, the necessity that we have to do. And third, I think we have talked a lot about the trust. So if we can really explain these are the risks, these are the benefits, and this is all the measures so we can mitigate the risk to have them almost zero because risk zero do not really exist, then I think it will be easier to build trust for the public as well as for the regulators. And on the international cooperation, I think sadly we don't have time. I think there's a lot of different issues we have to see because regulations are so different between countries and because we do not all have the same capacities, there's a lot of time and unequal exchange in collaboration, especially with the high-income countries to the developing countries. There's a lot of things they ask us that they know we cannot complain, but then at the same time, I think some exchanges, even of material, is a lot easier for us to send our viruses to them, and then we cannot even have them back to work on them. So this is another issue that we have to talk about regulation between exchange of materials and as well as other intellectual properties, both safety and how to help interaction and collaboration between countries so all of us can work in pathogens that will be of global importance. And thank you very much. I hope you enjoyed this session and welcome to the lunch. Oh, this is important. So the lunch. So the lunch will be in the Glow Bar and the program will resume at 1:30 p.m., please. Thank you.
can be a double-edged sword. It's important to ask ourselves, what happens when biotechnology is harnessed to instill fear or cause harm? Ordinary individuals use biological agents
Good afternoon, everyone. Could I ask you to take your seats, please? Please take your seats, everyone. We're ready to get started. So welcome back from lunch. I hope you're all feeling refreshed, ready to go. We've got an excellent next keynote set up for you all. I'm delighted to introduce and welcome President Amina Gharib Fakim, who is the 6th and first female president of the Republic of the Mauritius, who's going to be giving us the view from sub-Saharan Africa. A very warm welcome to you, Amina. Please come and join me.
First of all, I think I have to apologize for the quality of my voice. It's very croaky at the moment, so just bear with me. So, Dr. Bronson, Rachel, fellow co-chairs, ladies and gentlemen, good afternoon. First of all, I would like to thank the Bulletin for associating me with this very important initiative. The Pathogen project has provided me an interesting forum for exchange, and I have personally learned a lot in the process. Today I shall speak on the sub-Saharan encounter with the COVID-19 virus, and also on where we stood in terms of preparedness, readiness, and in many ways broke away from the doomsday scenario, sorry for the pun, that was predicated in the early days of the pandemic. Ladies and gentlemen, the coronavirus 2 SARS-CoV-2 first signal in the city of Wuhan, Hubei province, China, was first reported in the African continent in Egypt on February 14, 2020, and by March 11, 2020, the WHO had already declared it to be a global pandemic. Just a few months into the pandemic, COVID-19 had ravaged developed countries with significant case fatality rates in Europe and the United States. Considering the large number of people that live in poor, crowded, and informal settings in sub-Saharan Africa, the mode of transmission of SARS-CoV-2, the severity of the disease, as well as the existing fragile health systems, it was hypothesized that Africa may be markedly affected by the COVID-19 pandemic, resulting in disastrous consequences with large number of patients overwhelming hospitals and high case fatality rates. There is no doubt that the pandemic has overwhelmed health systems, has taken away scarce resources from fending off concurrent epidemics and managing an already high disease burden. It has been estimated that African continent alone carries 25% of the global disease burden. By June 2020, several countries were already witnessing record infections, but 3 countries with the highest burden were the United States of America, Brazil, Russia, none from sub-Saharan Africa. At that material time, the African continent was accounting for only 2.6% of global infections, with 2.8% death in 55 countries, which is far below the continent's 17.8% share of global population. 4 African countries, South Africa, Egypt, Morocco, and Algeria, comprise more than 52% of the reported COVID-19 cases in Africa, and only 1 of these countries is located in the sub-Saharan Africa region. South Africa had been the hardest hit African country with 42%, over 700,000 cases of all confirmed cases, and is ranked 8th in the world. Ladies and gentlemen, the question that everyone had is as follows. Why have the figures remained low in spite of previous predictions and also judging by the preparedness in terms of infrastructure and trained human capital. After all, Africa was fighting its battle with COVID with only about 3 million healthcare workers, and this breaks down to 3 doctors per 10,000 people, compared to nearly 30 for the Americas and more than 40 for Europe, and 1 hospital bed per 1,000 population. Countries like Burkina Faso, Mali, and Niger score lowest in the provision of essential health services. Conflict-affected countries were even less prepared to control and immediately respond to the pandemic. Although the global numbers of SARS-CoV-2 infections increased exponentially since the beginning of the pandemic due to ongoing transmission, the low number of infections and deaths recorded in sub-Saharan African countries have raised suspicion on whether they represent a slow progression of the pandemic in Africa, a lower case fatality rate, or simply lack of testing or reliable data. Empirical analysis have identified reasons as to why African countries have performed better in the face of the pandemic. One of the many, I list quite a few, many states implemented strict lockdown measures early and swiftly. They had already created more effective health emergency framework after the experiences with other infectious diseases. African states have active and cooperative societies with high community buy-in for lockdown measures. African countries are young. Only 3% of their populations are over 65. Many Africans live in rural areas, and African countries are less connected to other world regions. Ladies and gentlemen, this is where past experiences and their management, along with the power of institutions, can really change the course of events. The world remembers that between 2014 and 2016, the Ebola virus outbreak ravaged West Africa. Several important lessons were learned. The continent clearly needed stronger surveillance and governance systems and better national pandemic management capacity and capability, in addition to significantly more predictable funding. But to succeed, coordination, communication, and collaboration through the African Union were crucial. Interestingly, countries like Liberia, Sierra Leone, and Guinea employ the same methods and surveillance measures that fended off the Ebola outbreak between 2014 and 2016. They tested extensively, isolated people who tested positive for the coronavirus, and quarantined contact persons. These measures slowed the spread of the virus. The number of reported cases of COVID-19 in these 3 West African countries is 1/12 of that of South Africa. Senegal's success also largely stems from its experience from the Ebola outbreak and also its capacity building with international partners since then. Preparedness training included mock outbreak response exercise, constructing and staffing emergency operations centers. Political will and community buy-in have also greatly helped. In response, with evidence-based policies and transparent risk communication, in daily briefings on the epidemiological situation were essential elements of the government response from the very start. The development of COVID-19 rapid tests costing just $1 made it possible for large-scale testing. The Africa's Center for Disease Control and Prevention, the Africa CDC, has played a pivotal role in coordinating the African Union's continental response during the current pandemic and also released 6 weeks after the first confirmed cases. Because of the vaccine gap, I'm not going to go into all the controversies around this, so the continent had to rely on testing to get ahead of the virus. The Pan-African Partnership to Accelerate COVID-19 Testing was launched by the African Union Commission and Africa CDC as early as April 2020. Thanks to the partnership, the number of countries with testing capacity increased from 2 to 43 in just 3 months. More than 90 million test kits were procured and thousands of lab workers trained. Ladies and gentlemen, The African Union has also partnered with Africa CDC, the United Nations Economic Commission for Africa, and the African Export-Import Bank to create a medical supplies platform. The platform makes it easier for government to locate and purchase vital personal protective equipment by acting as a one-stop shop for procurement, which has improved Africa's bargaining power while supporting African manufacturers. The AUC and the Africa CDC also launched the Trusted Travel Platform to simplify the verification of COVID-19 test results and public documentation for travelers. The African Vaccine Acquisition Trust was established to complement initiatives such as COVAX, a global risk-sharing mechanism for pooled procurement and equitable distribution of COVID-19 vaccines. The trust has secured enough vaccine doses to cover 1/3 of the African population. Regional institutions had an important role to play that went beyond backstopping countries. They helped innovate and adapted response to regional needs and are close enough to decision makers to secure the required political support. All these were important elements for success. Ladies and gentlemen, on the way forward, these regional institutions will be called upon to guide priorities, coordinate policies and programs, and drive standard setting and disease surveillance, and include inter alia the following: local production of vaccines, therapeutics, and diagnostics to drive down procurement costs and increase response speed, investment in the public health workforce and leadership program, strong high-level partnerships, including between donors and government and the public and private sectors, and with public health institutions, and a greater role for regional organizations in pandemic governance by decentralizing institutions and through regional representatives in key agencies to ensure that the specificities and needs for each region are considered in the planning of central mechanisms such as surveillance systems. Also, a new public health order would require more predictable, long-term funding, not just in building the infrastructure, but also to train nurses, physicians, epidemiologists, and other healthcare workers. While there should be more domestic funding, it will not be sufficient for the needs of low and many lower middle-income countries, at least not in the foreseeable future. It must be bolstered by favorable financing options, supported by strong partnership and investment in pandemic preparedness and response, and backstopped by a fund that can pay for surge expenses as needed. Both the Independent Panel for Pandemic Preparedness and Response and the G20 High-Level Independent Panel on Financing and the Global Commons for Pandemic Preparedness and Response recommend a global fund. The G20 panel estimate that it will cost at least $75 billion over the next 5 years to fill gaps in pandemic prevention and preparedness. Ladies and gentlemen, the continuing threat of COVID-19, the effort to rebuild what has been lost over the past year and a half or more, and the task of ensuring that the next pandemic is managed more effectively require a fundamental rethink of our approach to global public health. We need more people-centered health systems that are inclusive. Equity starts by regionalization of health system so that when a crisis hits, regional have the capacity and ability to respond. COVID-19 is a tragedy whose lessons are too significant to ignore. If we take those lessons learned and translate them into a new public health order, we can lessen the effects of future pandemics on our lives and livelihoods in an increasingly globalized world. The COVID-19 pandemic has caused economic declines of unequal magnitude in nearly all of the African countries. Although the direct impact on GDP growth may have been less severe for African economies compared to OECD or Latin American Caribbean economies, in coming years, weak fiscal and external positions and large current account deficits, low levels of economic diversification, high vulnerability to climatic shocks and other natural disasters, and difficulty accessing supply chain may delay African economic recovery. Nonetheless, some positive lessons can be drawn, particularly at the overall macroeconomic recovery. The COVID-19 pandemic has highlighted the structural weaknesses of many African economies, namely the strong dependence on commodity export and knock-on effect of conflicts. The pandemic blatantly showed that Africa cannot outsource the health of its 1.4 billion people to the benevolence of others, or depend on unreliable and highly concentrated value chain outside of the continent. Africa imports over 70% of its pharmaceutical products, and only 1% vaccines are produced locally. The African Development Bank is strongly supporting the Africa 2030 pharmaceutical vision of the African Union, with the goal of increasing Africa's share of pharmaceutical production to up to 55% by 2030. The African Development Bank is proposing to invest $3 billion to support pharmaceutical manufacturing in Africa. A new mantra is evolving in the continent, is that investing in health is investing in national security. African leaders need to be reminded on the need to ask for the reallocation of the IMF special drawing rights, the SDRs, to be channeled through the African Development Bank, a prescribed holder of SDRs. It is now becoming increasingly clear how preparedness and response are interconnected processes and have to be articulated and enacted in different settings through formal assemblage as well as informal mobilization, including to mitigate the indirect effects of public health measures. Ladies and gentlemen, there are several other caveats to the wholly positive account of the African experience. The first is that the effects of public health response on economies, livelihoods, food security, and other health conditions have been devastating. The rhetoric coming out of African countries has been, why should I worry about infection when I'm most likely to die of hunger? The negative effect of lockdown restrictions manifested rapidly across the continent, with economic impacts intensified by high reliance of informal livelihoods and markets for food. The public health measures were instituted in the absence of formal social protection systems in most African countries. The extent of the precarity of livelihood was simply not accounted for in the preparedness plan. Politicization of the COVID-19 situation informs the second caveat for consideration of African experience, although this phenomenon is hardly unique to Africa. There have been marked examples of human rights violations, militarizations in some African setting, and indications that political distrust fueled by corruption aided spread of the virus. A third caveat relates to the evident resource limitations. Observations in regional settings in the early days of the COVID-19 suggest that anticipation of the pandemic was not matched by attention to the lack of capacity for response, with a strong suggestion that by one specialist that post-Ebola strengthening had encouraged a false sense of capacity. Major gaps emerged between policy guidelines and resource realities with respect to laboratory and clinical capacity, as well as standard preventing measures. Planning as if for Ebola is likely to have been a factor in the exceptionalist approach in the first period of COVID-19 preparedness, assuming a small number of cases treated by experts in specialist hospital, rather than a scenario of large numbers requiring mobilization of primary services. Towards the end of 2021, the institutional focus of WHO and Africa CDC shifted discernibly towards vaccine preparedness. So much so that many Africans were saying that the Omicron variant is the vaccine that we never got. Ladies and gentlemen, there have been intensifying concern about vaccine supply and access, as well as challenge to distribution, vaccine hesitancy, vaccine evasion by trial by viral variants have all suggested that reliance on technologies alone might be premature for Africa. Africa, with its 1.4 billion population, will need many different options for even better results on saving lives. I thank you for your attention.
Good afternoon. May I begin by thanking President Amina for her insights into what happened in sub-Saharan Africa. Thank you very much, Amina. Well, welcome to this panel on the roles and responsibilities of governments and international organizations. As we come towards the end of the meeting, this wonderful meeting, we have benefit of much insight and wisdom that has flowed through this room. A common thread since yesterday has been this whole issue of trust. So before we begin this discussion, I want to alert you to a report put out on Tuesday this week by the Reuters Institute at Oxford University. It's about people's trust in media and news. There are lessons in this report for us as well. The report states, and I quote, "There is no single trust problem, and therefore there is no single trust solution." The conference secretariat will forward you the links to this report. My name is Shahid Jamil. I trained as a biochemist and virologist. I worked in academic research for 25 years in India before transitioning into research, management, and policy, working with the Government of India and the Wellcome Trust. I now work at Oxford at the interface of science and society, particularly the role that faith plays in how we respond to contemporary challenges, challenges such as disruptive technologies, climate change, health, and so on. Today, we have two experienced, and if I may say, battle-hardened professionals on this panel. Jerry Parker, at the far end, is a professor and associate dean for One Health at Texas A&M. He chaired the US government's National Science Advisory Board for Biosecurity, which is affectionately called NSABB. Their recent report has made much news, and Jerry hopes to convince everyone not to be alarmed by their recommendations impeding their work, and also to convince us that biological threats are taken very seriously at the highest levels of government. Trevor Smith is at Global Affairs Canada and comes with years of experience working internationally to reduce the risk of chemical and biological threats. He's a part of the Global Partnership Biological Security Working Group, which recognizes that biological weapons and materials pose a significant and growing threat to global security. Trevor's work in this area has been recognized at the highest levels, such as G7. So let me start off by requesting both panelists for 5-minute opening statements. So Jerry, if you could please give us a rundown from Asilomar in 1975 to NSABB in 2023. Has planning, in your view, moved from being reactionary to being proactive and preparatory? Over to you.
Well, thank you for the question. And first, thank you for starting this panel discussion off on the theme of trust and reestablishing public trust in everything we do. And it's going to take, I think, all of us have a responsibility to help rebuild that trust in some cases and sustain it. So thank you for starting us off on that. So, and first, the short answer to your question, have we moved from reactionary to anticipatory? I think we are still in a reactionary phase, but I hope that we can move into a more anticipatory phase. So I'm going to just describe very quickly a little bit of the history of the NSABB and some of the policies that have happened since really the Selmer Conference in 1975 to the current NSABB report that was just released, and actually the policy that's in place, that was put in place in 2017 was a P3CO policy. And of course, this is an acronym-free zone, so that's the Potential Pandemic Pathogen Care and Oversight Framework. So first and foremost, the United States does have a comprehensive biosafety, biosecurity framework in place, but it has evolved in reaction to events since the Selmer Conference in 1975. And that, to some degree, that's natural. I think a lot of our policies, no matter what the topic, is in response to an incident or an event, and we have to be responsive to those incidents. But I anticipate the U.S. government will take another step forward soon, now that the NSABB report has been released just last month in 2023. And I have to make a comment here that although I'm a current member of the NSABB and chair of the NSABB since December of 2019, my comments today are my own. They're not reflective of the board, any government agency, or any institution, but I do have quite a bit of knowledge about the NSABB since I've been involved with it almost from the very start. I actually remember attending the inaugural meeting in 2005 and was an ex officio member of it as well when I was at HHS. So the NSABB was established in 2005. It was authorized by Congress, and it was established in response to the Fink report at the time. So I know many of you in this room are familiar with the Fink report, so I'm not going to go into that. And it was stood up to advise the U.S. government on policies that would be needed to oversee and govern dual-use research in the life science. And the NSABB produced really a seminal report in just 2 years from when it was stood up in 2007, that really it was a framework for governing dual-use research. And some of you in this room were actually worked on that report and spent a lot of time and thought into that report. But unfortunately, the U.S. government didn't act on that report in 2002, 2014. That's kind of a long delay. And actually only did so because it was in reaction to the 2 influenza papers that have been discussed already at this conference. And then, of course, there was a rash of serious laboratory biosafety incidents in some of the premier laboratories in the United States in 2014. And the Obama White House rightfully got so. Even those weren't associated with gain-of-function research of concern or dual-use research, they were nonetheless concerning. And so the Obama White House imposed a moratorium on gain-of-function research in 2014. The NSABB was called back to work and simultaneously to look at policies that would be needed to oversee gain-of-function research. Now, unfortunately, the term gain-of-function was used in that moratorium, and that really caused a lot of confusion. I think we recognize that confusion in retrospect than maybe when it was first used. But it caused confusion then, and it continues to cause confusion today. Well, the NSABB worked on that and produced another report in 2016 about governing and overseeing gain-of-function research of concern, indicating that the real concern and the issue was a subset, hopefully a very small subset, of research that could potentially generate an enhanced potential pandemic pathogen. So what we're really talking about is an enhanced potential pathogen that could be reasonably be anticipated to be highly virulent, highly transmissible, cause significant morbidity and mortality. And that potentially, if the information from that was misapplied, or if there was an accident, knowingly or unknowingly, that caused a laboratory-acquired infection, that could potentially lead to a pandemic, epidemic, or community outbreak. And we heard this morning that there are a lot of chain of events that have to happen for a pandemic to happen, but it's possible. So the goal of the P3CO was to make pre-funding decisions before embarking on research that might reasonably be anticipated to create an enhanced potential pandemic pathogen. So the White House OSTP released guidance in 2017 after based on the NSABB 2016 report. HHS developed a policy, the P3CO, the Potential Pandemic Care and Oversight Framework, in December of 2017. And several people, some in this room, remarked that looks like a fairly reasonable policy, and it looks like a good starting point, but we'll see. And so here we are 5 years later, and we're seeing. So and unfortunately, the 2017 P3CO framework, even though it was a reasonable policy framework at the high level, it wasn't accompanied with implementing direction, implementing guidance, what was expected for the risk-benefit analysis, what were expectations for transparency. So the NSABB was called back once again in February of 2022, and I still on my tenure as the chair of the NSABB, and the NSABB members worked very, very hard over the last 12 months to produce the report that just came out a month ago. I mean, several of us had at least weekly meetings, and just a lot of writing and a lot of debating, a lot of arguing to work through it. But the report was released in March 2023 and came up with 13 findings and recommendations. And I'm just going to highlight some of the recommendations. So number one was to develop an integrated approach for oversight of research that raises significant biosafety, biosecurity concerns, including EPP and DIRC research. And with the goal and a framework of how can we better integrate those two so they're not completely separate. The recommendations do recommend to expand the scope of what would constitute EPP research. It removes unnecessary blanket exclusion criteria, or what could be interpreted as blanket exclusion criteria. Importantly, there's a recommendation to enhance institutional responsibility to include articulating specific roles, responsibilities, and expectations across the review continuum from the PI and institution to the funding agency and all the way up to in this case, HHS or the department level, in case something does need to get elevated at the department level for review. And importantly, most importantly, to strengthen and harmonize and provide technical and financial resources for the institutional review committees, and actually even the government committees too. You cannot do this without resourcing it. And this is the concept we talked about yesterday. How do you link bottom-up responsibility and top-down guidance and regulation? And provide implementing directives, guidance, standards for risk-benefit analysis, and provisions for ongoing oversight. Take steps to increase transparency in the review process, including sharing a summary of key determinants that inform EPP research funding decisions. Adopt functional criteria for both DIRC and P3CO, no more just list-based. And require adoption and compliance by all federal departments and federally funded EPP research in the United States, and a few others. The NSABB received input from the federal department agencies, research investigators, institutional compliance officials familiar with EPP research, national security experts, professional scientific societies, the publishing community, and public comments as well. NIH also hosted a couple stakeholder listening sessions that include scientists, professional societies, and members of the public. I think in the future, though, I would like to see the U.S. government do more targeted outreach to the general public, because the general public may not be as familiar with these issues, may not be as familiar to look at when these announcements come out, and the general public needs a voice in these decisions when the outcome of an EPP research or dual-use research, if it went awry, will all be affected. So I just call for more public input. And as appropriate for a federal advisory board, the NSABB recommendations are what I describe it as strategic, what level of detail, and so the what level essentially sets the outcome standard. But the U.S. government now, the interagency, has got a lot of hard work. If they decide to adopt these recommendations, which I hope they do, they have a lot of hard work now to spell out comprehensively the how level of detail in an implementation directive and guidance and so forth. And I think, and most importantly, most importantly, we must provide resources, both financial and technical. We have to fund biosafety. I'll end there.
Thank you very much, Jerry, for really a comprehensive rundown. And Trevor, if I may come to you, and ask you about how you think the international security community works towards reducing biological risk, towards improving biorisk management, and cultivating a culture for safe and responsible research.
Thank you, Shahid. Hope is not a strategy. I wish it was, because if it were, my beloved Toronto Maple Leaf ice hockey team wouldn't have broken my heart every year since I was born. But there is proof that hoping that something will be won't make it so. The international security views biological threats as hope is not a strategy. So we need one. When it comes to biological threats, they are not just a public health problem. They are not just an animal health problem. And much of our discussion here has been about human health, but there's a critical animal health angle to this with zoonoses that we all recognize and must be part of our consideration. And then plant health. If we look back at the long and frightening history of biological weapons development by certain countries, there were dedicated programs to kill crops. Starve a people, starve their animals, you win. So the international security community has long realized it has an essential role to play in the global effort to prevent, detect, and respond to all manner of infectious disease threats, whether they are natural, as the vast, vast majority of infectious disease incidents will be, accidental, or, in the rare case, deliberate. For more than a century, the international security community has been in this space. We heard yesterday from a colleague from the United Nations Office of Disarmament Affairs about the really important work of the Biological and Toxin Weapons Convention, about the UN Secretary General's mechanism. I can't recall if the Geneva Protocol was mentioned, but it goes back even further, a century, and prohibited the use of biological agents as a means of war, as an outcome of the horrors that were witnessed in the First World War. But those were standards. They were norms. They were expectations. And more was needed. And the more became especially apparent following the terrorist attacks of September 11, 2001 in the United States. We all know that those attacks by commercial aircraft that were hijacked were devastating. How much more devastating would they have been if those terrorists had their hands on nuclear materials, biological, or chemical? Less than a month after the 9/11 terror attacks, we saw what a handful of letters with a few grams of anthrax could do. The cost of that, the terror of that, the economic impact of that. Relatively few people perished. Individual tragedies for every one of those families. But the devastation needs to be measured and recognized beyond those individual lives and what it can do. With this recognition, the group of 8 countries at the time, now of course we are G7, recognized that the status quo was not good enough. And at the Kananaskis Summit in Canada in June of 2002, they came together and created what is known as the Global Partnership Against the Spread of Weapons and Materials of Mass Destruction, the initiative that I've dedicated my entire professional career to. I won't ask people to raise hands. I don't like participation in group settings. But it would be interesting to know how many of you have heard of the Global Partnership. And I have a sense from conversations I've had, it's not that many of you. And it's interesting because the Global Partnership is one of the best unknown success stories in the international security community to come along in a very, very long time. Over the past 20 years, our now 31 members, 30 countries plus the European Union, have delivered more than $25 billion in concrete threat reduction programming to prevent terrorists and states of proliferation concern from acquiring biological and other weapons of mass destruction. And back to my somewhat flippant comment at the beginning about hope not being a strategy, we have strategies. To prevent biological threats, we have a set of 5 deliverables that our member countries agreed. And something I want to stress, and I'll probably return to in subsequent comments, is we did not develop these deliverables which focus on biosafety and biosecurity, on surveillance, on capacity building. We didn't develop these in isolation. The public health community, the animal health community were at the table with us from the very beginning and have stayed at the table with us over the long course of our history. So the international security community, Shahid, have a critical role to play. And if there's a message that I can deliver here, it would be for partners going forward to view the international security community as part of global health security and not an outside entity either to be feared or avoided, which too often to this day is the case.
Thank you very much. You raised some very pertinent points, and maybe there's one point, if there is time, I'll come back to. And that's the One Health point which you referred to, and Jerry, you are an expert on that. How do we get people from different sectors talking to each other? We'll come to the end if there is time, but keep that thought with you. So let me open the panel to some questions from my side, and I'll be grateful if we can restrict the comments to maybe about 2 minutes each. So Jerry, the first question to you is about the NSABB recommendations, and there have been several commentaries in reputed journals and elsewhere which suggest that the recommendations don't have universal support. Some have expressed concern that these recommendations, if adopted, may limit our future pandemic preparedness. Can you comment on that, please?
Sure, and in our day and time and our climate, it's not unexpected that there's not going to be universal support for almost anything, and it's no surprise that there may not be universal support for these recommendations. But I think there's more support than has been reported in the Science Nature articles. And I think one of the things it's important in the NSABB recommendations, and the thought that went into those recommendations was, let's not make policy now based on our institutional capacities to do effective, efficient, timely reviews. That we need to be thinking about the policies that are really needed to answer the charge that we got from NIH and OSTP for looking at how well the current DIRC and P3CO policies are working and what they need to change to so they will be more effective in strengthening governance and oversight of EPP and dual-use research while minimizing the impact of the scientific enterprise. I mean, that's the goal, much easier said than done. So with that, it will take some strengthening of our institutional capacities so that we can achieve the timely, effective, efficient reviews starting at the institutional level with the PI and the research compliance office at local institutions, as well as the funding agencies are going to have to beef up their technical staff as well. And if an EPP proposal needs to go up to HHS, they're going to need resources as well, or any other federal department level. So this is not resourced in 2017. And so I actually hear from a lot of people, and the people I hear actually say those recommendations are actually pretty good. And those are something that we really need to do. But then they also come back, they're concerned about whether the institution will get the resources, whether the IBCs, because the IBCs are already overstretched. And so the issue about resources is very real. And does need to be supported. In my opening remarks, we have to fund biosafety and biosecurity, and if we're going to improve and strengthen oversight of dual-use research of concern and EPP research, we're going to have to resource it that wasn't done in the past. And I'll end with the ASM actually came out with a statement when the draft report was released in January, and there's not that much change from the January to the March. It just improved it better. But they actually spoke very positively about the recommendations and spoke very positively that the NSABB through the deliberative process, actually incorporated the ASM recommendations, concerns, and so forth over the year. And they actually urged the administration, the White House, to urgently implement the NSABB recommendations. And they also actually urged the administration to begin a dialogue internationally and to take on the leadership role internationally.
Thank you. Trevor, let me come to you. And from the perspective of global partnerships, what and where do you feel we have the most serious biological threats?
It's a very big question, Shahid. Now, I will make it even bigger by saying when. Because we're often looking to the future and the new technologies that continue to race ahead. And what does CRISPR mean? The fact that we can, order pathogens online, what does that mean?
What does ChatGPT mean?
Precisely. Big problem. But we also must look back. Yesterday's biological threats have not left us. We need to focus more attention on the developing world and the disease burden that is so crippling in so many countries around the world. The Ebola outbreak in West Africa in 2014 and 15 that has been referenced multiple times was a terrible public health and human tragedy. It was also one of the largest proliferation events that we have seen in modern times. 300,000 samples of Ebola were taken and left behind, virtually abandoned. I'm not saying this to be critical. I'm saying it as a wake-up call. Biosafety and biosecurity were not a part, to the most part, of the response to the Ebola crisis in 2014-15. I understand that the priority was saving lives, and of course that's always where it should be. But we shouldn't do that at the expense of future threats and not doing the practical work that needs to be done to integrate effective biosafety and biosecurity. Bring an autoclave. When you're done with the samples, make sure they are cataloged. Instead, what happened is when the public health professionals left, having done heroic work, the international security community got the call. We've got a problem. So our programs through the Global Partnership have been working in West Africa for years now, helping our colleagues there not just clean up what was left behind, because that's not enough. What happens the next time? It's building capacity across the health security spectrum and not just dealing the old-fashioned way when we talk about international security, which is guns, gates, and guards. That's not biosecurity. Biosecurity is enabling our partners around the world to have appropriate capabilities in their public health systems, in their animal health systems, to deal with any type of disease that comes their way, to deal with it effectively, to deal with it collaboratively, and from the perspective of the security programs, safely and securely.
Thank you. Jerry, let me come back to you again and ask you about barriers to adopting more institutional responsibility, especially through biosafety committees, institutional biosafety committees in the US as well as globally in both high and low income settings. And if you could also address why it has taken so long for the US to act on these recommendations and take an international leadership role.
Sure, and first on enhancing institutional, say, biosafety committees in the United States and harmonizing and strengthening the IBCs in the United States. And I will commonly say, how do we elevate the IBC to be on par with our institutional animal use care committees or IRB type committees? They need to be elevated to be on that same par. So it won't be easy. And again, it's going to take the resourcing, it's going to take education, both financial and technical resources to do that. So even in the United States, it's not going to be easy. And of course, it's going to be more difficult as we think about that in low resource countries. And so we're going to have to, and perhaps what works in the US may not work in another country. So we have to think about the right mechanisms in every country to achieve, this bottom-up responsibility that's coupled with a top-down guidance, regulation, whatever it may be in different countries. In the United States, it's more guidance than regulation, but that's different in different countries. But it's how do you link and marry up the knowledge that our institutions have at the local level and the scientists at the local level. I believe that most best decisions are made locally, but some decisions, particularly if you're going to be generating there's some experiments, if you're generating an enhanced potential pandemic pathogen that it could affect the world, then that decision cannot be made locally alone. But it should be informed by it. And so we're going to have to maybe work with cooperative threat reduction and helping some of the institutional capacity building is maybe a funding opportunity through CTR and global partnership as an example as we think about doing that. And as far as, I don't really have a good answer of why some of the NSABB recommendations haven't been acted on, because they're over a decade. They're some of the first recommendations of the NSABB. I'm looking to others that the United States needs to take a leadership role in governance of dual-use research concern. And there's been efforts over the years to do that. It just hadn't been a sustained effort. You know, I would say the global health security agenda incorporated biosafety and biosecurity as part of that, but are very focused on the dual-use research concern. It's just been fits and starts, but I'm hoping this is a renaissance in biosafety that we're going through, and hopefully it'll be sustained going forward.
That's great. I mean, I think it'll be very useful if this sort of partnership comes along. So Trevor, about the biological threat reduction work that your group does in developing countries, what lessons have you learned from these efforts?
Too many to list here, but the most important one is one size does not fit all. And nor does hit and run training do anyone any good. Showing up in a country, providing a week's worth of training, and then saying good luck is not capacity building. I don't want to call it tourism, but it's certainly not providing the country what they need. There needs to be more listening, less talking from the perspective of donors as work begins. We've learned this over the past 20-odd years in some of the most effective collaborations that we've developed. We have a new signature initiative to mitigate biological threats in Africa that we have done in the absolute closest cooperation with the Centers for Disease Control in Africa. They are a formal dialogue partner. With our ASEAN partners, we have a program to mitigate biological threats. There are many other examples. And the important part, again, was going in and seeing what their perspectives were, what their priorities were, as opposed to saying, we're here to save the day. They don't want to be saved. They want to be supported to do what they needs to be done. The other thing I would say briefly, Shahid, that's very important, is to recognize that many of the solutions that were developed in Western countries, for Western countries, will not and cannot work in developing countries. We've heard some commentary in the last day and a half about challenges with laboratories in low-resource environments. This has been an Achilles heel of the global partnership for many years. We've struggled terribly with this. What do you do when you have countries that have no functioning capacity to safely store, secure, and work on high-consequence pathogens of security concern, of human concern, of animal concern? Do you let them continue to work in these abysmal conditions without the appropriate measures, or do we provide a technological solution, a laboratory, that we know is going to fail because it can't be maintained, it can't be sustained, there isn't the power, the water, the funding? And I say it can't because we've tried and they failed. So we're working now on a new grand challenge for sustainable labs. It was launched about a month ago in collaboration with the World Organization for Animal Health. It's building on more than a decade of work by the global partnership in this space. We're putting out an appeal to global innovators. Help us build a better lab, a more efficient laboratory that is going to work in low-resource environments, that is going to be operable, that is not going to cripple the governments, and that is going to be an asset and save lives, not an albatross.
You know, your comment about a one-week workshop is not training but tourism brings back memories of the late 1980s when I was starting my career as a virologist in India. We used to have a term called suitcase research. More about that later. Jerry, let me come back to you and ask you about how does the NSABB deal with dual-use research of concern and EPPP research policy?
Sure, and well, let me first answer the question about maybe what the NSABB can do and cannot do. And so NSABB only makes policy option recommendations. Our federal government's going to have to decide which recommendations they want to adopt and then implement and make policy. So we're just the NSABB is just the policy option recommendations. But in this most recent report, it does describe, in fact, the first recommendation does describe a framework for considering how to better integrate the DIRC and EPP research. And actually, it begins with not a list-based pathogen toxin, but it begins with the 7 experimental concerns ought to be the first question asked when something is being proposed. And then if one of those questions is relevant to the proposed research, then have a discussion. Have the PI and the local institutional bodies have a discussion about it. Is this going to be something that's going to raise security and safety concerns or not? If it is, well, we need a little bit more. Let's take a look at it. Maybe the federal funding agency or other funding agency needs to look a little harder. And if it then elevates to being need to elevate for a higher review, so be it. But the review process needs to be effective, efficient, and timely along that whole continuum. So the bottom line is the NSABB wanted to begin to move to integrate those 2 concepts, starting out with asking the 7 questions first. And I think beyond just this current charge that the NSABB received, I'm hoping that the US government will now also take a look at the whole entirety of the biorisk management framework. Because as I mentioned in my opening remarks, it has evolved over the since 1975 in a rational, reasonable, and good way. But maybe it's time to look at holistically at that whole framework. And where does DIRC, EPP fit in that whole framework in a more integrated fashion? And the Federal Select Agent Program is one too that probably needs to a review and analysis for what worked there, what's not working. And so I'm hoping that the U.S. government, the administration will also do a comprehensive reevaluation to look for opportunities for strengthening and improving and efficiency in the whole process.
So it really comes down to capacity with institutions, capacity with regulators, with funding agencies, and with journals.
And journalists,
everyone.
And also knowledge. I mean, there's a lot of our scientists are not knowledgeable about DIRC and EPP yet. Despite we've been talking about these issues for quite some time, it's been a kind of a smaller subset of our scientific enterprise that's been familiar with it. So we also need to do a better job of making sure that the knowledge is more distributed, because you never know when somebody's going to be thinking about an experiment. They may not realize this might actually pose up to that it needs a conversation about whether it meets the DIRC or EPP type review.
Yeah. Trevor, coming to you on dual-use research of concern, can you cite any specific collaborations at the health security interface that have meaningfully addressed this?
Thank you, Shahid, and thank you to colleagues yesterday who already spoke of many of the collaborations that Global Affairs Canada has supported as part of our contributions to the global partnership. And there's a long list of other contributions that have been made by the other 30 countries. We talked about the global guidance framework that the WHO has developed, a fabulous new document, fully funded by the international security sector. The WHO's revised biorisk manual, funded by the Global Partnership. Work being done by the International Federation of Biosafety Associations. Work being done by the World Organization for Animal Health, such as the recent Global Emergency Management Conference. Fully funded by the international security community. Now, I don't say this as a boast. I'll say it as a bit of a complaint. Where are the health partners? Where are the health partners in funding this critical work to deal with dual-use research of concern? And where is the receptivity to reach out to a broader community? Law enforcement. Law enforcement has an absolutely critical role, and I'm going to ask our colleagues to play in a moment a very short video that we have developed in partnership with Interpol. Interpol has an absolutely extraordinarily important role to play when it comes to dual-use research of concern and mitigating biological threats, and hopefully this clip will provide some insight into that.
Despite biotechnology being one of the greatest advances in protecting population health and livelihoods, it can be a double-edged sword. It's important to ask ourselves, what happens when biotechnology is harnessed to instill fear or cause harm? Ordinary individuals, terrorist groups, and criminals have the potential to misuse biological agents and equipment and release disease into a population, either intentionally or accidentally. When we think about protecting biological agents, we often think about limiting or securing their access. While this part of the issue is more widely discussed and easier to understand, awareness of the challenges of dual-use equipment in the field of biology is slightly more complex.
There's 14 more minutes of that video. We don't have time, but it speaks to the point. We need to think bigger when we're thinking about dual-use research of concern. It's not just those who have their hands on the materials in the labs. There are far, far many other sectors that are implicated.
Thank you. I'll come to the last set of questions, both of you. To Jerry first. What are the next steps for the NSABB report?
Sure. So the NSABB report, the charge of the NSABB has been completed. The report has been finalized. It's been submitted by NIH to the Department of Health and Human Services, and the department is forwarded to the White House. My hope is, and my anticipation is, and I'm pretty confident that will happen, that the White House will establish a policy coordinating committee, and it probably has already started, I'm just not aware of it, to look at strengthening actually many areas in biosafety and biosecurity, but then specifically the P3CO framework and the DIRT policies. And hopefully they will be informed by the NSABB findings and recommendations. That's why we were asked to do the hard work over the last year. So I suspect there already is a policy process underway, but I don't know that for sure. And that may take some time. Maybe they'll provide some interim recommendation. I just don't know. I've tried to find out, but I do not have any confirmed information I can share on that. And that's really their role to share that information anyway. But in addition to the administration, Congress has some ideas too. The United States Congress has ideas. And we had a conversation yesterday about regulation, guidance, and so forth. I really hope, and I really urge the administration to act on these recommendations rapidly. They may not, and we may not necessarily like some of the legislation that could come out of Congress that may not be as informed with the NSABB recommendations. Maybe they will be, but my real desire that the administration and Congress can work together to come out with policies that are meaningful, that will strengthen appropriately governance of dual-use research concern and EPP research while not stifling in scientific enterprise, and provide the resources that I talked about that are going to be needed from the institutional level into the federal government to govern and oversee this type of research and to make sure that reviews are timely, efficient, and effective.
So do you think there's a good chance of that happening before election fever takes over?
It better. No,
hope is not a strategy.
No, I mean, I've heard that they are taking it very seriously. And another thing that I know why they're taking it seriously, because the National Biodefense Strategy that was released in October 2022, really for the first time, has a section pretty significant section on biosafety and biosecurity, including laboratory biosafety and biosecurity and biorisk management. Past national biodefense strategies didn't have that much detail regarding these issues. So that's a good indication. It will be taken seriously. I would like to give them a suspense that they should have a comprehensive policy released in 6 months.
All right. Finally, Trevor, what is the current state of global health security cooperation, in your view?
I'm going to speak frankly. I always do. It's a slogan. Global health security is a slogan. If we think of it in the way that it was meant to be in, for example, the Global Health Security Agenda, which when that was drafted in 2014 and brought together truly a global health security community from across all sectors, was to prevent, detect, and respond to all manner of biological threats, whether they be natural, accidental, or deliberate in origin. That's not the GHSA today. And I don't want to say the international security community has been pushed out, but we've certainly been pushed aside as people felt more comfortable wearing their old shoes. I'm used to working with people in these sectors. It's hard to work with people over there. So the silos that were meant to be torn down have gone back up. There was a move a couple years ago in the United Nations, in fact. A number of countries put forward a proposal that we shouldn't use the term global health security anymore. Should change it to global health solidarity, because there's no place for security in global health. I beg to differ. And I think COVID has taught us many things. I'm not sure we learned a lot, but we were certainly taught lessons. And disease affects everything. And it affects every sector. And we simply cannot afford not to have functioning global health security. Our populations will not forgive us for not working across the hallways in our own governments with other agencies who are committed to the same objectives. I applaud the Bulletin of the atomic scientists for the crowd that has been assembled here, the expertise from a truly multi-sectoral group. We need more of this. And I'll make an appeal to our colleagues from the public health and the animal health community. The Global Partnership Table includes all of our health security partners, the WHO, WOA, FAO, IFPA. I could go on and on. Our primary partners, our public health agencies, our veterinary institutions. So the international security community includes public and animal health. I challenge you to name me equivalent tables on the animal health and public health sides that include international security. Thank you.
This is probably a good time to just go back to this question of One Health. And the public health, animal health, and environmental health, these sectors. In many countries where it matters, they are handled by different ministries. They don't talk to each other, and it percolates down. Animal health people have no idea about what's happening in human health, and vice versa. So quick comments from both of you on that. And Jerry, you go first.
Sure. Yeah, we've got to figure out how to crack the code, so to speak, in building bridges between our cylinders of excellence. That's silos, but because these are cylinders of excellence in health or security, law enforcement, intelligence, and science. We've got to figure out how to work across, say, ministries. We have to work as a multidiscipline, and I agree with Trevor. I want to really acknowledge the Bulletin for bringing such a multidisciplinary expertise to talk about these issues, including journalists who are going to write about these issues and tell the story. It's so important. So we've got to figure it out. What I've done, though, in the interim, because some things you can solve, some things you cannot, and I think about One Health as an approach and a philosophy, and whatever the problem is. But I think about One Health, and I tell my students that I interact with and other colleagues that are interacting. At the end of the day, One Health is figuring out how to work with the right disciplines, multidisciplines, to work on the hard global and local challenges together. And you got to sometimes just do it, irrespective of the bureaucratic hurdles that are in front of us. And so you just have to have will and build your coalition of the willing and able and do it. Trevor.
What he said. Multi-sectoralism is hard, but it's not that hard. Look at the problems that, I'll speak to the scientists in the room here. The work you do in your labs is mind-bogglingly hard. Putting people into space, which we seem to be doing every other day now, that's hard. Picking up a phone or having a chat group with people from another sector, it's not that difficult. It takes discipline, and it takes intent, and it takes a willingness to look beyond narrow views of what individual responsibilities are. Anyone who's working in public health and animal health, in health security writ large, cannot be an island. At minimum, you're an archipelago, but all of these things are connected. And when a disease outbreak happens, and I've seen this time and time and time again, and people are desperately trying to find somebody's phone number, that's not the time to be introducing yourself to colleagues, whether it's the border police, whether it's people at the airports, at the infectious disease lab. Multi-sectoralism needs to start long before there's a problem, and it needs to be built deliberately, much as my comment about hit-and-run training. It can't be a hit-and-run thing. Okay, well, we met with them. That was nice. No, it has to be a community, a practicing community. The successes that we have seen in building global health security over the past 20 years through the Global Partnership, forgive another reference to the Global Partnership, is because we've kept at it and because we're stubborn and don't take no for an answer.
All right. We have about 15 more minutes, so let me open it to questions at the back.
So, Trevor, you've said a couple of things which are very close to my heart, so thank you. Training can't be hit and run. I've been so fortunate to spend now 8 years going back to Pakistan time and time again. I've trained a lot of people, but the great thing that's happened in Pakistan is that they themselves, based on our training, have trained many, many more people than I have. So what the goal of sustained engagement can achieve is not just to build the capacity locally to know about these issues and to do biosafety in the labs, but to do their own training and their own research into biosafety issues that are local to them. For example, one question I had from a participant from Quetta, which is in the desert west of Pakistan, is how much water do I need to wash my hands properly? It's not a question we ask in the West. We don't have that problem. But it's also an issue that they can do the research on themselves, so long as they're asking the right questions and have the confidence to do it. And I think that's one thing we can give them, is the confidence to do their own research. The other thing I loved about what you said is this focus on the abandoned bio-waste at the end of a project. I think we need to concentrate more on a whole of life cycle approach to biosafety and biosecurity. Mm-hmm. And we may do that in the West, but I don't think our engagement activities have really focused on that sufficiently in the international sphere. So I'll leave it at that. Thank you.
Yeah, really what you describe, it's more than it's education. Well, you're providing an education foundation that allows them to go do the train the trainer, but it's an education, and I think our funding agencies need to think more about how do we build the educational capacities, including graduate degree training program or education programs in our international collaborations, because that's going to be sustaining. Unfortunately, I know the U.S. is too short-sighted. I'm be critical of my own country, but we are. USAID for International Development does tons of training, and it's necessary, but not sufficient.
Tim, the whole of life cycle element is critical, and it is at the core of the mission of the Global Partnership community. When we approached Africa CDC a number of years ago, about establishing this new signature initiative to mitigate biological threats in Africa. It was with this premise that we need to build biosafety and biosecurity, disease surveillance, into every aspect of operations, as opposed to it being a parasite, if you will, that attaches itself. We take that very seriously, and part of that is building up local capacities, and not just building a lab or giving some equipment. Example, in Kenya right now, in collaboration with our very good friends at the International Federation of Biosafety Associations, we launched a new degree program in biosafety and biosecurity at the Masinde Muliro University of Science and Technology. Members of the global partnership are currently supporting the operationalization of a new biosafety and biosecurity training center in South Africa at the the National Institutes of Communicable Diseases. Just a couple of examples about trying to build sustainable capacity in a way that is going to create the next generation of experts as opposed to a short-term group of people.
Please.
Hello. Yeah. Aurelia Tal-Johncoff of the Johns Hopkins Center for Health Security. Thank you both for a great session. Obviously, the NSABB recommendations are very US focused. So my question is for both of you, how can the international community, what are concrete steps that the international community can take to push forward on policy related to DIRC and EPPP? And also, going back to the US, what should the US government do to engage further on international regulations on these issues? Thank you.
No, it's a great question, and yes, they are U.S. focused because that was the charge of the NSABB, and I would say that we need to get our own house in order first before we can serve as a leader on the international stage. But hopefully, we will get our house in order so that we will have a more effective voice. Not that we can provide leadership now, but we will have a more effective voice once we update our policies. But then it's going to take a lot of listening and a lot of dialogue, and we have to use multiple forums because one approach is not going to work the same for every country. But I think there's some principles in the NSABB recommendations that can have broad applications. It's just how are they implemented in different countries is what we'll have to think through, and the countries are going to have to think through. We can't we have to help them think through what works. And there's efforts underway. I know there's a group at the State Department right now working with ABSA on some of international biosafety type things. Some of it's even in the agricultural space too, which I'm really happy to hear. So we're just going to have to work multiple fronts. It's going to be a diplomacy essentially, and work with multilateral organizations, work with funding organizations like the Global Partnership, and but it's just we're just going to have to do it. We're just going to build our coalitions of the willing and able and do it.
So we'll take one question here, and you have the mic there. So go ahead, Jesse. Your question and then your question, and we'll answer together.
Okay. My question was for Jerry, and one of the things that you had referred to a little bit during the process of the NSABB is, researchers sometimes are often having sort of low awareness and having not given much thought to DIRC, and maybe not being that supportive or just not caring that much. And I guess what are your sort of thoughts on, beyond the actual regulations, having gone through this process, how do you make researchers think and care more about these issues?
Well, it's a great question, and I think there's probably some lessons learned for us as a community when the DIRC policy was rolled out in 2014. Because when the DIRC policy was rolled out, there was a little bit more of a fanfare with that rollout, and there was companion guidance, and there was education, and there was webinars, or I don't know if it was webinars, but there was something happened to try to at least educate part of the community. It was kind of short-lived, about a year, because also the DIRC was given like a year before it was announced in 2014, and everybody was given a year before it was actually truly implemented. So we needed to do something very similar for the P3CO and DIRC, and we think about combining. But I think one of the rationales, too, with the first recommendation in the NSABB report was this framework of thinking about DIRC and P3CO together. And the first question to ask is my study potentially going to fall into one of those 7 categories of experiments of concern? Yes, no. And if it's yes, then we have to have a dialogue. But I think if the more we have our investigators across the world thinking about that. That one of the first things is my research going to maybe bleed into one of those questions, and we have to have a dialogue. And I think the more that people are starting with that in mind, then I think the goal was to help disseminate that thinking, from the very start. And one of the NIH listening sessions that we did, it was in the June-July session last summer. There was an institution that does that. So some of that was inspired by one of the universities that actually does that already.
Please go ahead. And then there is a question at the back over there.
Thank you. So my name's Jess Rogers. I'm a non-proliferation lawyer and current impact fellow at the Federation of American Scientists. Question for you, Trevor. So 5 years ago, the Global Partnership decided that one of its priorities for the next couple of years would be to strengthen national and international capabilities to rapidly identify, confirm, and respond to bioattacks. What kind of processes have been put in place since then, and how can these use beyond deliberate attacks?
Thank you for mentioning that, and you put a big smile on my face because that was something that was put forward during Canada's G7 presidency in 2018. And it was based on a meeting that we had held in Italy in 2017, where we brought together colleagues from all of the international organizations that would be involved in an attack. And we asked a question to each and every one of them, and some of them are sitting in this room. Phone rings. Country says, we've been attacked, send help, what do you do? All of them said, I'm not going to say what they said, it was rude, but it wasn't good. So there has been a sustained effort to build these mechanisms, and I would say across the board, we've made fabulous progress. The United Nations Secretary General's mechanism has gone from a name on a piece of paper to something that is getting close to operational, with fabulous support from Switzerland, which leads the Friends of the SGM group. Germany held a capstone exercise last October in Berlin to test the capabilities. Canada has created standard operating procedures. We're still not there, but we're far further along. WHO now has a dedicated unit funded by members of the Global Partnership that looks at deliberate biological threats. The World Organization for Animal Health has a dedicated biological threat reduction program. Interpol has come to the table and is leading, together with WOA and FAO, a major project on agrocrime and agroterrorism. So compared to 2018, we are leaps and bounds away better than we were. We're still far from the finish line of where we need to be. So I can assure you that there are continued investments, continued strategies to get us to where we must be, because we don't know when that phone's going to ring. Thank you.
Okay, so that will be the last question. Please, go ahead.
Oh yes, this is for Trevor. So in the different sessions, some of the different sessions and speakers have talked about how the pandemic has revealed that we're working in a very challenging information environment. And unfortunately, that very much applies in sort of some of the work that you all deal with, in the sense that, without going into details or naming names, that there is a coordinated, high-level, government-driven, deliberate disinformation effort targeting the exact type of assistance efforts that you work on a daily basis. And so, again, without necessarily going into the specifics of what that disinformation is or who's putting it out there, I guess I'm interested in your take on, one, the risk that poses, how you see it, the risk that kind of disinformation campaigns pose, to what extent you think that they've been effective or not, and then a message you might deliver to this group in terms of the role that anyone in this room can play in terms of helping to push back on those things. Thank you.
Yeah, Dan, thank you, and I'm glad you raised that because I did want to get to disinformation because massive problem. Those of you who work in public health, I mean, vaccine hesitancy, disinformation about vaccines, and so many other things. The international threat reduction community is relentlessly targeted by disinformation. program that I led in the Kyrgyz Republic many years ago. We were going to build a new laboratory for human and animal health based on the Canadian Science Centre, which combines both human and animal health in one facility. After 5 years of effort in great collaboration with the Kyrgyz government, it was targeted by an external disinformation campaign, and we were forced to terminate. There's a detailed working paper that was prepared for the BTWC because last fall the BTWC had to convene a meeting because the Russian Federation made allegations that the United States was developing biological weapons in Ukraine. I will say with 100% confidence, that's crap. But it speaks to the power of saying something that is not true, and how do you stop it? We don't have an answer yet. I'm very grateful to Philip Alensos and the team at King's College who worked with us to develop Bioweapons Disinformation Monitor that was specifically about looking at those incidents in Ukraine and trying to provide positive information. As a global health security community, we need to do a better job, though, anticipating disinformation and not playing whack-a-mole. Every time says something wrong, we feel we have to defend it and somehow disprove it. It's a losing game. We need to get ahead of it. So there's an effort underway right now within the G7. Canada is coordinating, that is bringing together both the global partnership community on the weapons of mass destruction side and those responsible for disinformation under the rapid response mechanism to try to come up with a longer-term vision of what a disinformation counter strategy can look like, because we're going to need one.
All right. So this is the end of the session. Thank you, Jerry, and thank you, Trevor, and thank you, the audience. I'm told to let you know that the session will resume again at 3:15. I don't know what the consequences will be if you're not here. Thank you very much.
Okay, hello everybody. Thank you for showing up so late in the afternoon on the second day of a conference. I know that's tough for some of you, but you'll be glad you came here today because this is going to be an exciting panel. I've got very, very accomplished journalists to talk about various aspects of biosecurity, biosafety, covering COVID, all sorts of things. I did want one of the journalists. Sorry, again. This is not working. Okay. Now maybe we all can hear me. One of the journalists who's supposed to be here today, Kai Kupfer-Schmidt, has had an emergency, couldn't make it here today, and Sarah Napton has agreed to fill in for him. So if you've got an old agenda, you know, that Sarah is filling in. And as I said, I think this is going to be maybe one of the more interesting of the panels, just because we're journalists and most of you are experts in various aspects of biosecurity. And I think when you listen to the people up here, you get some semblance of, well, journalists think a little bit different about these things than maybe some of you do. And I think we'll be able to pull back a curtain a little bit and give you a little bit of an inside look at how journalists think, how they work, and how you can work with them if you're an expert. Let me real quickly give short introductions here. Down at the end is Catherine Eban. She's a contributing editor at Vanity Fair and a very accomplished investigative journalist and author. Sarah Napton is science editor at the Daily Telegraph, and Natasha Loder is the health editor at The Economist. And I'd really first just like to, rather than avoid the elephant that's standing here in the room, I think we're going to talk first about the COVID-19 origins debate. It's kind of ridiculous to avoid it with 4 journalists up here, and including people who have covered it at great length and wonderfully, I believe. So I'm just going to ask you all, in turn, first of all, explain for the people here what it is you've done, sort of a really quick recap of how you've covered the origins debate, what you've done, and then anything just that you think is noteworthy, something that our experts may find interesting or surprising or maybe even slightly horrifying, because it has been a very, very contentious debate. So, Catherine, throw it to you.
Thank you so much for having me. It's just great to be up here with colleagues whose work I really respect and admire so much, and to be here with all of you. I first began reporting on COVID origins in the spring of 2021, and it really came from an informal conversation with my editor, where we had been covering COVID from the start of the outbreak at Vanity Fair, and we were sort of putting our heads together discussion, and he said, well, what are the big unanswered questions of the pandemic? And he sort of answered his own question, and he was like, where it came from. And I was like, okay, yeah, that would be interesting. Let's look into that. Well, I'm still standing 2 years later, and I have done a number of deep dive stories on that. And it has been really covering it. Maybe the good news is it's been a story like no other. I'm told we don't have a week for this answer, so I will try to keep the remarks on the shorter side. First of all, when you, in reporting, when you put out information, it is the typical experience that you will get information back. And sometimes the more information you put out, the more you will get back. And so, in coverage of everything from 9/11 to the anthrax attacks to CIA interrogations, you will get tips that come in all forms once you start reporting and basically announce your presence. But there is a kind of silence at the heart of this story, which I think is very challenging for journalists. I mean, in a normal story, if there was such a thing, we would by now be inundated with, whistleblowers from the Huanan seafood market, or whistleblowers from the Wuhan Institute of Virology, the market worker, the lab tech. You would have audit reports and internal memos and, WhatsApp messages and all kinds, webcam videos and all kinds of things that are, challengingly absent in this story at this point. So that makes it a very, very challenging story for journalists to cover. I like to think that once I really get into a project of length, sort of the ratio that I am comfortable with is that I will use 1/10 of what is in my notebook, and 9/10 winds up on the cutting room floor because you're distilling things and winding up with the most critical information. But in this case, there is a sort of paucity of information in the public square. There is, information in China that we still don't have access to. There is information in the intelligence community that we still don't have access to. And so I think that absence of information, or information that is slow to come, has been challenging both for scientists and for journalists. So that has been, and then a lot of the information that is in the public domain is fiercely contested information as to what it means, as to how important it is, which has left journalists with the job of having to sort of thread their way through that information, often with great difficulty. So that is something that is really unique about this story. The other thing that is, I think, unique, at least in my experience of this story, is that, journalists are every bit as competitive as scientists, and we always want to be first. But in this case, it's been my experience that the journalists who are covering this topic have begun to talk to one another, because it is such a difficult story, and many of the journalists that I've spoken to say it is the most challenging story they have ever covered. And we have sort of talked about how you approach a story like this, how it's important to really ground the reporting in documents, in real-world events, not just in speculation and hypothesis. So we have sometimes commiserated, well, if we could all just work together, maybe we'd actually get somewhere. And maybe we should, I don't know.
But, good luck with that. Yeah.
But those are just a couple of the things that really stand out to me as unique in covering this very, very challenging, but very critical, very important story, in my view.
Okay, thanks, Catherine. Sarah, sort of same question to you. How did you get into covering the origins debate, and anything that you've found perhaps a bit strange about doing it?
Yeah, thanks for that. I got asked to do this over 4 glasses of wine last night, so apologies that I'm not absolutely on top of it as much as these two. So I'm a daily news journalist, so I cover all areas of science. And so as soon as we knew that there was something happening in China, we started looking at it and did all the press conferences. And then I remember getting an email from our Chinese correspondent on January the 20th, 2020. And the sequence had just come out at that point, and she said there's this rumor flying around that it may have come from this lab in Wuhan. They were looking at bat coronaviruses. It seems very close to it. Someone had published a preprint. It's the start of this glut of preprints that were coming out and would confuse everyone, saying that there was, I think that was the one that said there may have been some sort of HIV insertion into it. The FCS, I don't think had come out at that point. But there was clearly something there, and within sort of a few hours, I was being told from China, from my Chinese team, oh, don't worry about it, it's a conspiracy theory, no one's looking into it, we're being told on the ground, it's nothing, it's nonsense. And I sort of thought, well, yeah, but you can't just leave it like that. So I started going to the people that I would usually respect, and still do respect. I mean, I don't think there was any agenda there, and sort of saying, can you take a look at the sequence for us? Is there anything there that suggests foul play, anything a bit dodgy? They all came back to me, absolutely not. There's nothing in this. They said to me the technology doesn't even exist to create something like this that could have leaked from a lab. It's just not possible. Which kind of I don't think was true. I'm not sure that the people who told me that necessarily knew that for sure. But the problem was those people were people that I really trusted, and I didn't know where to go after that to find anything out. And within a couple of months, we were in lockdown anyway. So I think that was one of the problems of reporting the pandemic. It was kind of like you were in a war, but a war where you couldn't do any war reporting on because you weren't allowed out in the scene. You couldn't get to China. You couldn't get really out and about to talk to anyone. And I think the other problem was, I think the lab leak got conflated by the fact the engineered virus versus the fact that it may have just been a collected bat virus that then just accidentally spilled out. I think those two things got conflated very early, and everyone thought that the lab leak had gone away because the engineered virus had gone away, and so people sort of shut it down. But yeah, I think even now I feel quite disappointed in some of the scientists who I really trusted from big institutions, Imperial, UCL, Cambridge, Oxford, who just told me that there was no way this could have happened, when you don't even have to start looking through the literature very far to find where this has happened multiple times before, in China, in Britain, foot and mouth in Britain. It does happen. And so to dismiss it so quickly, I found very surprising. I think it's done a lot of damage. And I think Trump hasn't helped. So I think that was a problem that it seemed to come from the Trump administration. And I don't think until Trump stepped down, anyone really looked at it properly. Anyone was willing to stand, put their heads above the parapet and look at it properly. And I think when Nicholas Wade's article came out, I think that did a lot of good. And then the letter in Science from a lot of you here saying that it wasn't a fringe theory anymore, and suddenly you were allowed to talk about it. And since then, I don't think there's been as much of a chilling effect as there was in that first 18 months. But it's been very hard to report on. And I felt quite exposed as a journalist in Fleet Street. I'm about the only, I think me and Ian Birrell at the Mail are about the only, and Natasha are about the only people that are really doing it in Britain.
Yeah, I think that feeling of being out there, on the gangplank, waiting for somebody to push you off is pretty universal for journalists reporting from all aspects of this. But Natasha, why don't you give us your...
My sort of potted summary. So I'm a health journalist, and again, like Sarah, I write about a very wide range of topics. I'd heard the stories about lab leaks, by February of 2020. And my reaction was, well, that's interesting, but do we have any good reason to think that there was anything wrong with this laboratory? And my sort of rudimentary poking around at the time made me think, well, I don't see a good reason to be worried about this lab. And so it wasn't really until the Washington cables, the Wuhan cables came out, that it sort of came up on my radar again, and I felt like certainly I and other people in the office felt that it was time to do the story. And I was lucky enough to share an office with the defense correspondent, and he pointed me in the direction of Philippa Lentzos, and we wrote our first piece. And I'm an ecologist by training. I've written about emerging diseases for years. I've written about zoonoses for years. I've interviewed Peter Daszak and enjoyed his company. There you go. There's an admission for you all over many years. And that first piece we wrote did, of course, talk about zoonoses. It did mention the word conspiracy theories, but we also spent about 25% of that piece talking very squarely about a sort of non-natural origin, a lab origin, we talked about the furin cleavage site. That was April 2020. And although I've swung backwards and forwards on where I think the weight of evidence lies, I'm now firmly on the fence. Don't ask me. I don't know. I have no idea. I do think, I've lost my thread there. But in any case, I think, we have a responsibility to keep asking these questions. I haven't done that many stories. I tend, when we do them, I'll do a deep dive and then I'll move on to do something else. Sometimes I'll get a call from the desk, the news desk, they'll say, can you do an explainer on the origin of COVID in 700 words, please, for 2 days? So you get these challenges, and as a journalist, you have to rise to them, and they're not necessarily how you would choose to cover them, but those are the things that you're asked to do. I don't get bylines, so you won't really generally be able to look me up like Catherine or Sarah Napton. That's just the way that The Economist works. Yes, it is the hardest story I have ever worked on. It's partly to do with the silence. It's also to do with the kind of prominence of the story. Now, at The Economist, I would find that people would return my emails, people who are at the heart of a hot story. That's not necessarily the case with a story like this. It may be that, Eddie Holmes has spoken to CNN and the BBC, and he hasn't got time to speak to me. And all that I will see are the few clips that they decide to use. And I don't have the benefit of the long interview that he's given or that someone else has given or if Philippa is quoted in the media. And so there is a problem there in kind of keeping up. And, the sort of method of communication that we have, maybe we can talk about that in sometime later, has not been great. So it's been hard. And then lastly, one of the most unusual things, I'm used to getting criticism as a journalist, right? And, it's part of the job. And it's fine for people to criticize like how I've covered a story. And of course, everyone's like, oh, you gave too much prominence to this. You made this factual error. You spelled this guy's name wrong. Whatever it is, it's fine. What is difficult about this story is when you are personally attacked as a journalist, your motives are questioned, you're being told that you have an opinion, you've pre-formulated opinion, you're told that you do not have enough expertise to even ask the question. You can't ask that question. You don't know what you're talking about. And this all sort of like raises the game for being able to participate in this story, and that makes it very difficult.
Yeah, and you sort of led right where I wanted to go, which is this story, me personally, no idea what the origin of COVID-19 was. And I think generally, that's pretty much where it is right now, but through reporting, just essentially that. The levels of attacks and taking sides with politics mixed in was really it was disconcerting, but more than that, it buried the story. The search for the truth of this. It took a year before really the media was coming back to seriously look at, what's going on here. And so what I'd like, you all in turn, again, to talk about, well, what lessons can we draw from this? Move a little bit more forward looking. We're going to have more outbreaks. We're going to have things that get politicized and whatever. What lessons are there for both journalists and scientists about how we can have a better discussion that explains to the public more effectively than what has happened here, the state of play of this inquiry? And so, Natasha, why don't you go first, since we've...
Are we going to do scientists or journalists or both?
Why don't we do scientists first, and then we'll come back and grill ourselves.
Okay, well, let's talk about scientists, because actually there was one point I didn't make, actually, which sort of touches on this as well, in that you know, for most of the stories that I cover, the questions are amenable really to sort of the scientific process, and they're kind of, you can crack them open. But you know, here the real curveball we've got is like the intelligence services and the sort of this information that they have that we don't have. And that kind of adds a whole nother dimension to the story. And so, you know, you can cover the science story, but then you can be missing the bigger picture. And so I suppose the lesson for scientists is that, you know, there is an additional dimension to this story. This isn't just a story about science. That's one of the things I would say. The lessons for scientists, well, one of the biggest lessons I've learned for you all is be polite on Twitter, okay? Right? Because it reflects really badly on you, and you may think you're being clever, but you're not. And, you know, it is, I'm sure journalists are infuriating. I'm sure I personally am infuriating. I'm sure my questions are infuriating. I'm sure lots of conspiracy theorists on Twitter are infuriating. But, you know, what is it? Well, you know, when they go low, we go high, right? And there is a certain level of expectation from the public that scientists do occupy some ivory tower, some moral high ground. No, you know, you don't, right? You're humans just like us. But I think that it's a mistake to hang everything out there on Twitter. I really do, and I think you shouldn't do that. One of the things I've really struggled with, and this is about access to information. And what I don't understand is, like, you know, you may give an hour-long interview with a journalist, and they'll use, like, you know, 3 lines of your quote. Well, why would you not just record it on Otter or something and then put the transcript up? Or put something on your website saying, I just spoke to a journalist and these are the things we talked about. If you think about what it's like to cover a fast-moving story, and it's like, well, I have to wait until you publish something, or you're going to tweet like 280 characters. So I just sort of think, like, if you are willing to spend time with 1 or 2 journalists, then why not share that with everyone? Because then that's knowledge and information we can all use, right? What are my other lessons? Well, recognize the legitimacy of the questions about where this thing came from. And I mean, I suppose I'm speaking to an audience that's kind of more receptive to this. But, you know, there are certain conferences I could go to where the scientists would be quite upset, perhaps, at being continued to ask, well, could it have been a lab leak? And, you know, that's something that I just have to deal with. I have to deal with that. But, you know, it would be good if you as scientists could create the culture where that's allowed. Sorry, I'm doing too much of the talking, and I may take all your points. I'll let you guys answer some more of the questions.
Yeah, we'll see if Sarah's got...
Yeah, what she said. I think one of the main problems, and this wasn't just a lab leak problem, this was an entire COVID problem, was groupthink. And scientists got into their kind of pack mentality. This is what I saw. Maybe you didn't, from the inside, maybe it felt differently. But there was definitely groups, and almost organized groups that, especially as Natasha said on Twitter, were really doing their best to shut down debate.
Yes.
And trying to pick your way through that, it felt like you were going a bit mad at times, because you were like, this is a legitimate question. And 10 people now have started sort of a Twitch hunt against me, and I'm trying to defend myself, and it's just getting worse and worse and worse. And it was awful. And you know, especially in the UK, there was groups that were specifically set up to do that. You know, Independent Sage, we know, was set up by the Citizens, which was a political organization, which they themselves said Indie Sage was an experimental stealth project. They said it was. They say that themselves. So I think there was a problem with that. I think too many scientists waded into areas that they knew nothing about. It was one of those problems, I think, trying to get hold of people in the pandemic. You just heard the word scientist, and it was like, that was good enough to get on Sky. You know, you might be a biologist, but suddenly you were commenting on, you know, something that was completely outside of your field, just having an opinion, and that suddenly turned into scientific fact when you were a big head on Sky News. So I think that's a really important point. And then if you don't know something, just say so. You know, you don't need to kind of make up an answer or deflect from it or say, you know, oh, that's definitely not the case if you just don't know. If you just don't know something, say so. We would rather know that. That's as much as an answer as anything else. So they would be my 3 points, I think.
Okay, Catherine.
Yeah. So I would say, you know, early on in the pandemic, many scientists were really uncertain about the origins of COVID. They did not know, and a number of them suspected it may have come from a laboratory. They were raising questions about, you know, unsafe research that was being done at low biocontainment levels. Many of those scientists expressed their doubts privately, and publicly, they basically said, well, it looks like a zoonosis, you know, it's just a typical, you know, this is just sort of a playbook spillover, albeit a very bad one. And we really didn't learn that those scientists had their own doubts until there were leaks to the press, there was FOIA litigation, Freedom of Information litigation, and emails came out. And I can imagine that for scientists who were having their emails FOIA'd, it's a very unsettling, difficult experience. But I also think that for the public, it was a difficult experience, sort of an exercise in cognitive dissonance to hear one thing and then actually see another view entirely being expressed. And I think it's a kind of useful thought exercise to say, you know, what if the NIH had come out early on and said, we don't know, we're not sure. We have these doubts, here's why we have these doubts. We are going to continue to look into this, the science is going to evolve, we're going to move with the science, and you know, we'll get back to you with our latest thinking. And meanwhile, China, you know, could you please hand over, you know, this necessary data? And, you know, that would have put the NIH really where it should have been, which was at the forefront of seeking information, rather than being in the position of guarding information and being, you know, blanketed with FOIA requests and releasing FOIA documents where, you know, whole pages are blacked out. I don't think that that is a good exercise for science. I don't think that was a good exercise for our, you know, leading scientific agency. And so I think that, you know, transparency is a good lesson to take away from that. You know, you might ask yourself, well, you know, given the you know, information environment we're all living in, would you really want to get up and say, I don't know? To that, I would say, there are some scientists in this room who have done that. They've really done that. They've done that very bravely, and they've suffered attacks for it. So we know from that model that it is possible for scientists to express doubt and uncertainty. I think that has served the public well, in my opinion.
Okay, after we journalists have, you know, put scientists on the rack here for a while, which we're always willing to say bad things about other people, but I think it's time to talk about how could the journalism have been better? I mean, this was an issue where, for a long period of time, many mainstream outlets hewed to one story that really wasn't the whole story. And I'm just curious, what do you all think about, well, how could journalists have approached this differently? Is there a way we could have made it not get mixed up in the politics and the division and not be a you're on one side or the other side kind of issue? Or is it just, is this a sui generis thing? Is this just so unique that, no, there aren't really any lessons for journalists? What do you think, Natasha?
Well, I mean, journalists are a really diverse bunch, and it's very hard to come up with sort of hard and fast rules. And the question you're asking me is from a sort of very particular context. It's from a US context. And I hear again and again this narrative about how the sort of politics thwarted the discussion. But I don't swim in that water, and I never did. And it never really mattered to me that it was the Trump administration that had said that there was this evidence. It didn't, all due respect to the concerns about racism being stimulated that just wasn't a conversation that was happening in the UK. I never needed to censor myself. I never needed to say, I'm not allowed to ask this question because I am pushing a Trump agenda or I'm being racist in asking this question. And so it's very much context dependent. Now, it's hard for journalists who work within certain contexts, because remember, okay, all journalists feel a responsibility to the story, but also we feel a responsibility to our readers, and our readers have certain expectations, and that gets filtered through to our editors. And so it's hard for a lot of journalists to jump out of the water they're swimming in, or even to see the water that they're swimming in. So that's a really bad answer, I'm afraid. I would say there are no simple answers. I would say the one thing I would like scientists to understand about journalists is that our interests don't always align with yours. And I'm sure you know that. I mean, that's kind of pretty self-evident. But we still need your help. And we can't tell the truth if you don't answer our calls, if you're not brave enough. There are people who are brave and they do talk to us. They talk to us in confidence on background. You don't need to go on the record. But, you have to speak up. And I know it's controversial and it's difficult and you'd rather not get involved and you're very busy. But people have to do that. So I would just say, look, it's difficult as a journalist, but if we work together, I think we can get better coverage.
Yeah, I mean, I think generally good journalists and good scientists and experts, they overlap a lot in a real quest for truth and facts. So, Sarah, what could we do better in this kind of really contentious situation to work together with, good-meaning scientists?
Actually, I was going to say the exact opposite, that we shouldn't be doing that. We're not science communicators. I think there's a problem that is happening a lot in science journalism at the moment, in that science journalism is becoming science communication. And scientists are almost seeing science journalists as their marketing department to get out their work. And journalists, that isn't their job. We should be challenging scientists to tell us why they've come up with this, what the confounders are and why they've done it like this and not like that. I just don't think there's enough challenge of science. Scientists are often held up as these kind of, bastions of truth, and we've seen through the pandemic that's not always the case. They have agendas too, they get things wrong too. And journalists need to be questioning that. And I also think science journalism in general is just horribly under-resourced. I mean, when the pandemic started, there was one science journalist at the Telegraph, one health journalist at the Telegraph in news, trying to cover that whole thing. It was just impossible. And it's not something that a normal a general reporter can do. They don't have the expertise to look through a scientific paper and understand what that means. So you really need that niche specialism to be able to do it. And the resources are not there anymore. So I think from that perspective, I think we almost need to go I would say we need to go the other way, and science journalists need to be a bit more tough about challenging some of the science.
Catherine, what can we do better?
Well, I have a relative who does a lot of business in China, and I'm very fond of him. And early on in the pandemic, and I had really just started my coverage, and he was like, everybody in China, all my business colleagues are saying it came from a lab. And he started explaining to me, he's like, there's this lab and it's really close to this market. And I'm sitting there and I'm thinking, well, first of all, that is just ridiculous. And then I'm thinking, I wonder what his information sources are. God, he can't differentiate, the New York Times from, a supermarket tabloid. So, I pretty much dismissed that out of hand. And then, Trump went on to make his infamous, relatively fact-free statements about, we know it came from a lab, and that was, at the White House podium in April of 2020. And, at that point, the story was just developed a kind of, and I hate to say it, but a real ick factor for the mainstream media. As I had one source who said to me that, there was like an antibody response inside the US government. And, nobody wanted to talk about it. Nobody wanted to be on that side. Nobody wanted to be allied with an agenda that was, certainly in the US, seen as harmful to Asian Americans, but racist, xenophobic. So then you go and you start reporting on the possibility of a laboratory leak. And, you're like in a low-rent neighborhood. You're just looking around and, are you really reporting this? Like, who are you talking to? Who are your sources? And, it is a very challenging place for a journalist to be. But I guess what I would say for journalists is, even when there is a toxic messenger, you still have to ask questions. You still have to do your homework. When I started reporting, what I found out pretty quickly was there are non-crazy people inside the US government who actually think it was a lab leak, and they were asking questions, and those questions got buried for a whole range of reasons. That was my first story on the topic. So I think, I would say try to set aside the sort of milieu of the story, try to really delve into the questions and tease out the facts, and then be as unafraid as possible to report what you find, so long as it is, done as accurately and fairly as you can.
Yeah, I'd like to turn real quickly here away from COVID origins slightly. It's really not away from it, but to a degree it is. Gain of function has become almost a boogeyman, right? People say gain of function, it's supposed to be something evil, something wrong, bad, whatever. And I really haven't seen all that much in the way of decent reporting on the difference between different kinds of research that might or might not be termed gain of function and, the relative value of any of them. And I just wondered, again, I'll just go down the line, Natasha, but how do you think journalists should be approaching gain of function right now?
I think none of them should be covering it at all, and they should leave it to me, because that's why I'm here. Sorry, you wanted a serious answer. How do I think they should be covering it? There absolutely is. It's the key question, isn't it? Is, what do we allow and what do we not allow? And actually, can we even not allow some stuff, right? It's like, is it even in our capacity to do that?
How could you regulate
But from a journalistic perspective, the way I would look at that story is to say, the public will be really interested to hear about research that is going on to benefit them, that might not benefit them. And isn't it fascinating that, the risks and the benefits of doing some of this research are not necessarily aligned with the public interest? And that's a really kind of key idea, is that, a scientist may decide to, tinker with H5N1 virus and publish it and say, this is really important, we do this. But the public at large may be like, in fact, scientists at large may be kind of horrified by this. And so I think it's really important that we find a way of alerting the public to the fact that this work is being done paid by them on their behalf, but actually their interests may not be perfectly aligned with the scientists, and that's something that they need to take an interest in.
Yeah, Sarah, I mean, from a daily newspaper point of view, these kind of really complicated scientific issues must be a real bear to deal with. I mean, I would, in your position, you know, somebody comes up and says, hey, do a story about gain of function. I mean...
I would say if you met Natasha from The Economist, she'll do it for you. Yeah, it's difficult. I think, though, there's ways of simplifying things down, and I think the public will go along with you if you keep them informed. I think it's when you don't inform them that they get suspicious that there's something going on behind the scenes. So, for example, there's a genetic engineering bill that's just passed through Parliament in the UK with a whimper. Not you know, no one's been arguing about it. No one sort of said it shouldn't be happening. You know, we can now have genetically engineered food if we want. If that had happened sort of 10 years ago without all the work that's been going on and all the positivity towards that, I think there would be protests in the streets and you know. But so taking the public with you is the way to do that. But I think as well, I think gain of function. I was talking to Peter Daszak about it actually, and his definition of gain of function, I was asking him whether if you know, they had engineered a bat coronavirus, whether that would have counted as gain of function, and he told me it wouldn't have, because bat coronaviruses couldn't have infected humans in the first place. So it just seemed a really disingenuous sort of circular argument that you could be doing some work that essentially put something in that would make something very infectious to humans, but because it wasn't infectious to humans beforehand, that wouldn't count. And the way he explained it to me is under NIH rules, that is the current explanation, which I think it's that sort of thing that the public gets really suspicious about and thinks if you're being that disingenuous about and getting around things with mealy-mouthed wording, what else are you keeping from us? So I think that's a problem that we're going to have to address at some point.
Yeah, Catherine, is there a way to rescue gain of function from being the boogeyman? I mean, there are different kinds of research, and some of it is important to do, you know, and that's cast under this shadow of, gain of function. Is there a way for journalism to deal with this that doesn't distort the bejesus out of it?
Well, you know, first of all, I think reporting on this story, it is very easy to get trapped by these phrases because you need a succinct way to describe something, but of course, the phrases very often don't convey meaning. So, I mean, I think for journalists, you know, you want to be able to write a story that would not necessarily have to use any of those terms. I mean, you could explain it in plain language and then say, you know, which some people refer to as gain-of-function research. But, you know, having spent 2 years trying to figure out how to explain a furin cleavage site in a single sentence, and by the way, tip to journalists, this was the lesson for journalists, if you figure out how to do that, keep repeating it in every single story because you're allowed to plagiarize yourself. You know, so, but I just think that it is important to, you know, get more granular in what one is describing. So, you know, gain-of-function research of concern. You know, what is that? What is gain of function, which, as one person said to me, is like all of virology, you know. You know, but to try to get both more granular and more accessible in the language that we use as science communicators.
Yeah, I think that's the key thing, is that, you know, what you mean by gain of function is not what everybody is, what does everyone else understand by that?
Yeah, as soon as you all come up with the furin cleavage site accessible explanation, let me know.
But, I mean, I think the public is perfectly willing to accept that there's lots of virology that is perfectly fine and is worth doing. That's not the issue. The issue is defining the boundaries of what is acceptable and what isn't. And I don't think that you guys have a good handle on that, judging by what I've heard.
Okay.
You don't know where to draw the line.
When you say you, who are you talking about?
This conference.
This conference.
You don't know where the line is or should be drawn, or even how to define the line, or what the line looks like for that matter. I mean, I mean, there's no consensus. And so if you're expecting a sort of coherent line in my journalism, to emerge, you're asking me to solve your problems. I can't do that. Right? So, you come up with a much clearer way of defining what research, the risks and the benefits, and how we should proceed. And then we'll have a much clearer message. I mean, maybe I will solve your problem for you, but you shouldn't count on it. Right?
Okay, thank you all. This is wonderful conversation up to now, but I think it's time to go to the audience and questions. And let me look, boy, lots of questions here. I think that gentleman there, where January is handing him the microphone. If you all would identify yourselves in a short affiliation.
Okay, so my name is Jonathan Latham, and I'm a virologist by training. I brought up an issue yesterday, and I made a request of the organizers that I could pursue this idea a little bit further, and they kindly agreed. And so they gave me this little spot to do this, and it is a communication issue in part. So I think it's appropriate here. So first, thank you. Secondly, yesterday I discussed how successful reform efforts in the technocratic sphere pretty much require an inside effort and an outside effort. So these are two groups that differ in almost every conceivable way, but they share a common goal, making them in principle a coalition. Now, many factors drive them apart, and one of those is deliberate establishment strategies, and I talked a tiny bit about that yesterday, so I won't do that again. But the biggest single threat to this coalition is, in my opinion, that people on the inside get perceived as stooges, right, or patsies. So they maybe have a genuine interest in changing the system and in improving biosafety in this case, and so on and so forth. But the view from the outside, from Twitter and the media, and people who are not in this room and not privy to these conversations, do not necessarily know how to judge what's going on the inside. It's very difficult. So there's a trust issue, right? So the solution to this, in my opinion, is that people on the inside have to actively demonstrate in a determined and thoughtful way their sincerity, right? It's a difficult problem because you've got people on the outside who lack technical knowledge, they have so many difficulties. And so the problem for the people on the inside is not to lose the trust of those people so that they then disappear and then no longer form part of the coalition. They're not the noisy people on the outside that you need who have a concern, who make the noise. So my suggestion is that the way for people on the inside to solve that problem is to step outside of the tram lines that are set by the establishment norms, okay? So this requires a certain courage on the part of the people on the inside. And I have two suggestions for this. So the first one is that, many people perceive that some kind of international institution is seen as needed to build capacity and oversee improvements in global biosafety. Now, my suggestion is that this institution should not be housed at the World Health Organization, right? So in this community, in this room, the credibility of the World Health Organization may be very high. But in the wider world, the credibility of the World Health Organization is close to zero. And this is where the wisdom of the crowd becomes interesting, because the World Health Organization is effectively controlled by the US government, the Chinese government.
Oh my goodness.
Hold on just a little bit here. What I need you to do is come to a question, please.
We're just about
I mean, I'll let you go on for like 3 solid minutes. Yeah. Do you have a question for us?
No, I'm just about finished. I wasn't asking for a question, actually, when I discussed
this
with
the
organizers.
Question and answer, period.
Yes, I understand. But you keep, the organizers of this meeting keep asking for feedback from the audience. We want to hear from the audience, and so we hear this in every session. And so I'm now offering that. And I'm not saying that my opinion of the credibility of the WHO
Okay, I think you misunderstood.
What I'm saying
talking
is
about
you made your one point, and you said there were two. If you could move on to point number two, and then we're going to have to wrap up pretty quickly.
I'm nearly done. Thank you. So the WHO is essentially controlled by the Gates Foundation, by Big Pharma, so on and so forth. That is the perception of people on the outside. And I would say that reflects actually a certain wisdom. And so if people on the outside want to step out of the trend lines, one option is to say that housing this organization in the WHO would be inappropriate. So it would be
you've
the
already said
equivalent.
you want this organization to be outside of the WHO.
Yeah.
What's your second point, please?
The second point is to ask the question, who should run this organization, right? If it's not the WHO, who should do it? And my suggestion would be that it should be the scientists whose credibility has gone up the most in the whole of this pandemic. And my suggestion for that would be Richard Ebright. And that would be because he already runs an institution. And what the world needs is a scientist with credibility who actually has concerns about these issues to run that organization. So I'm just about finished. I'm just pointing out that these are controversial things. They will be challenging for people in this room. But it requires going outside and tapping into information and stepping away from the ivory tower that most of us live in to think about these issues. So I've said enough. I'm just putting forward a suggestion. Don't have to take it, but I'd like you to listen. Thank you.
Yeah, we appreciate it. Thank you. January, I guess the closest to you is down at the end over there.
Hi, Gustavo Palacios from Mount Sinai. I want to ask this question regarding, I think that journalists and scientists are very similar in the fact that what our more treasure is our reputation. Whenever we lost credibility in what we say, there is a cost. So most scientists are very cautious to talk about what they don't know for certain. What I don't understand is when a journalist receives information or that is misinformation, where it finds out that it's being told lies, or when it's clear that there is a very strong spin in what they are receiving from a source, why we are always hearing the same sources? Why there is not a change in the sources that we are looking for information when we have been told misinformation, if you want, when we find out that some things have been hidden from a journalist? I don't understand that piece, because it should work in the other way. If you find out that someone have exaggerated, you will not use it as a source.
Okay.
Well, there's a difference between misinformation and lies, right? And so if someone's lied to you, obviously you don't use them again. There's also misinformation. Then there's people who perhaps have a strong belief but also agenda. I mean, Mr. Latham, I thought that many of your comments were riddled with misinformation, and I don't agree with many of the things that you said. So, and all you can do is just make a decision about how credible that person is and decide whether to use them again. You presumably have an example in mind. It would be useful to know who you're talking about. Who are we using in the media that you think we shouldn't be using? Right. But so that does, I will admit to you that the people who haven't been, and it is difficult. And, when Richard Ebright emailed me about his new biosafety initiative, I said, thank you very much. I think this is a very important initiative. But by the way, I do think you need to be more polite on Twitter, because I think it undermines the good work you're doing. Didn't get a reply. Now, there are situations where, if he is still the world expert in something, you may talk to him. I would find it difficult to quote him after watching how he has behaved on Twitter, but I couldn't rule it out. If the story required it, you have to go to these people. The same with Peter Daszak. He's still one of the world's expert on zoonoses. You can't necessarily rule these people out. And that's why I would encourage scientists to be polite on Twitter, because when they're not, you certainly do have to draw back a little.
Yeah, Catherine, did you have something you wanted to say?
Yeah, I just wanted to say that I think, just speaking generally, it can be, I'm a magazine journalist and I do long form reporting, so I tend to have more time for my stories. But I think, speaking as a former newspaper journalist, it can be very challenging when time is of the essence and, you essentially have a group of sources that you have on speed dial. You reach out to them under a deadline pressure, but I think it can be very problematic, as you point out, to keep going back to the same sources. And I do think it is the obligation of the journalist to diversify the perspectives in your story. I think that's incredibly important. So I think, your point is a good one.
Okay. I think this lady right here, I'm sorry,
Yeah.
I can't call you by names because I can't see that.
That's no problem. My name is Melissa Salm. I'm an anthropologist of science and a biosecurity fellow at Stanford Center for International Security and Cooperation. I'm really curious about your thoughts as journalists on conspiracy theories and how you make sense of them as an alternative mode of storytelling, but also as like a way to unauthorize and stigmatize some narratives. And what role did conspiracy theories play in shaping and reshaping the narrative in an uncertain environment?
Who wants to take that?
You should take one.
Yeah,
Yeah, you should.
So first of all, it's a great question. It's a really complicated question and answer, I think, for every journalist writing about COVID. I mean, we're literally in a landscape that is, awash with conspiracy theories, and every journalist pretty much is on Twitter, which is like doubly and triply awash in conspiracy theories. I mean, I have written specifically about, anti-vaxxer conspiracy theories, the possibility that we might be looking at an environment in the US where one of two political parties is actually aligned with the anti-vax movement. I mean, we're possibly headed towards that, so it's very ominous. I would say on the topic of COVID origins, to the extent possible, it is really, really important to sort of disentangle the different types of information and the different sources of those information, and to do it specifically in your stories. So, just because you're talking about a lab leak does not mean you are talking about a bioweapon being cooked up, in the back of the whip by Anthony Fauci. Those are very different things. And so it's really the job of the journalist to communicate sort of the full register of difference in these things floating around in the atmosphere, is what I would say.
I did want to point out that in this particular story, a big thing at play was to make out the journalists who were asking the question, could it be a lab leak, to make them into conspiracy freaks of some kind. And that was a thing that some scientists did very clearly on purpose. And I think that's worth some study at CSAC over there. You might take a look at that. Yeah, we've got about 2.5 minutes there, so this gentleman in the back there, because the microphone just happens to be close to you.
Just quickly, for me, the unique and novel feature of covering this story has been the importance of unconventional sources. Amateur investigators, internet sleuths, citizen scientists, whatever you call them, people like the seeker, Francisco Ribera, the engineer, Gilles Desmaneuf, coming up with much more important revelations than a lot of conventional sources have. I think that's a very interesting feature of journalism.
it is a very interesting feature, but it also created a lot of rabbit holes. Right? And so had you been following all of that very closely, you would have spent a lot of time worrying about a mine in the Mohang mine. And so without wishing to devalue what they're doing in any way at all, because I agree with you, they have surfaced some important information, but information is not knowledge. And so, that's the problem you still have of sifting all this stuff.
Yeah, I was going to say that sifting the wheat from the chaff in this has been an absolute nightmare. I mean, for every conspiracy theory that's turned out to be true, another 20 have turned out to be nonsense. So just trying to work out. I remember one earlier in the pandemic that suggested the reason why black people were getting infected more and suffering worse symptoms was because scientists had been experimenting on HeLa cells in the lab, and it's crackers, but that was doing the rounds for a long time. So it was really difficult, and I think for every drastic, we're good at digging out some stuff. There's been organisations you would ordinarily have not liked to work with. You've been sort of forced to in a way because the sources who should have been doing this haven't been doing their job. So it's a difficult one, and I've lost a lot of trust in science over this, in scientists, and I hope it comes back, but keep the faith. Yeah.
Okay, the clock here is telling me I have 15 seconds to thank all you, really, for coming to the conference and for being such a great audience. I wish I had 20 more minutes to take your questions, I really do. But I'll be out there, so will the other journalists, buttonhole us, ask us all these questions that I see bottled up here that could be asked. Thank you, and I'm supposed to introduce at this point our speaker for our keynote speaker, and of course I was handed a little card that's had all the information about him, and it's disappeared somewhere. So I know it's Mark Lipsitch of Harvard is going to come up and talk to you now, but thanks again, y'all were a great audience.
Great panel. Thanks. Can I have my slides? While we're getting the slides, I want to really thank the Pathogens Project and the Bulletin. That's changed. Well, let me just... Okay, looks like they're okay. The font's all changed, and that's interesting. I want to thank the Bulletin and the Pathogens Project first for assembling such a spectacular group of globally diverse, institutionally diverse, and background and specialty diverse people. I think this is the most richest group of people, richest in quality that I've had a chance to work with on this topic in a long time. And also for inviting me to speak here. I want to talk about, I've titled my talk Pathogen, which you can't read, Pathogen Enhancement and its Regulation in the COVID-19 Era. And I want to really talk about the gain of function of concern topic that was mentioned in the last session, and I'll situate that a little bit in a couple of slides of history just to remind us of how we got here with some of the highlights. And I will take a somewhat US-centric perspective where necessary, because that's what I know, and try to be as general as possible otherwise. So some of the early events I think that were crucial in helping us to all understand the potential concerns were first the mousepox recombinant experiments that raised biosecurity fears when it was enhanced with IL-4, suggesting a way to make a vaccine-resistant smallpox virus, which brought biosecurity to the front of the debate. Some laboratory accidents in SARS-CoV-1 in 2003 and 4, where individuals were infected in 3 different labs. The reconstruction of the H1N1 virus in 2001, and I'll share all these slides, so don't worry too much about writing anything down. The Purebright outbreak in 2007, which was a laboratory-associated foot and mouth disease outbreak in the UK. And then the sort of more modern history started with the controversy over the H1N1 enhancement papers that were published in 2012, and that debate continues to this day. I've somewhat grandiosely put the founding of the Cambridge Working Group on this slide, which I was one of the co-founders of, not because of trying to be grandiose, but for specifically trying to mention the importance of biosafety, which I think had been not so important in the discussion until a number of us raised it in 2014. And then the funding pause that happened in 2014 continued for several years until it was lifted in 2017 with the entrance of the P3CO guidance. And then for the period of the COVID pandemic, we had stasis in much of this discussion because people were focused appropriately on other things, and I certainly was. In 2021, the US Health and Human Services Department stated that it had subjected 3 projects to review under that guidance. Not a very large number, in my opinion, and we'll talk about that in a few minutes. And then in the last couple of years, the NSABB, which we heard about from Jerry, that he chairs, has begun to readdress these issues. So I want to make about 10 claims, 11 claims with some subparts to them. And so the first is that I think in the broad category of gain of function, meaning adding functions to organisms, almost all of it is safe, and we don't need to be talking about it. So for example, altering flu viruses to grow in eggs and cell culture for vaccines is a safe thing to do. Routine genetic engineering of other functions in microbes is a safe thing to do. And I mention this not because I think it's controversial, but because I think politics has entered that discussion. And one of the moves that we need to resist is the use of gain of function as a broad term by politicians and people with political agendas to say gain of function experiments are important, they help us make vaccines, and therefore we shouldn't regulate them. They do help us make vaccines, and that's not what anyone's proposing to regulate to a first approximation. We can argue about the borderline, but gain of function is a very large category. The concerning experiments are not the ones that make vaccines, and they're the ones that we need to be talking about regulating. Some gain of function, which I'm going to use the term gain of function of concern. It's not a perfect term, but it's the term that I think best explains what we're talking about, is risky, and specifically that which involves enhancing potential pandemic pathogens. So in 2014, Tom Inglesby and I made some calculations which we thought were on the low end with each of our assumptions that if you multiply small risk times large potential impact, we should be concerned about causing multiple fatalities per year of enhanced biosafety level 3 work. Not that many people are going to die each year, but that the low probability times the high potential outcome gets you to these numbers. Ron Fouchier argued in a reply to that these numbers are off by a factor of 1 billion. So we have a lot of orders of magnitude separating the two sides of the debate. I think it's worth saying that whichever end of that range you fall on, even if these numbers are off for Ron Fouchier's lab, which is certainly, as we heard this morning, even safer than certain labs in the United States, underreporting and the global variation in quality that we also heard about mean that there's opportunities for important breaches. The third thing I think is true, and Jerry also talked about this, is that the US is moving toward a pretty good definition of gain of function research of concern requiring enhanced review. And I say on paper because I think the devil is in the details, which I'll mention in a minute. I'm not going to read the whole thing, but I think the reasonably anticipated language is very important and a positive part of this. It means that we're not going to be able to see in advance every experiment that might generate something dangerous. But on the other hand, it will dramatically reduce risk if we focus on those things that are reasonably anticipated to create dangerous pandemic-capable pathogens. My preference would have been that this recommendation would include low pathogenicity, non-zero, but low pathogenicity, and some colleagues and I have said that in writing, but I think this is a pretty good definition. I said the devil is in the details. The biggest detail where I think the devil is in the regulation in the United States, and I can only assume it's similar in other places, though I don't know, is that we've reviewed 3 projects in the United States under this enhanced type of review over a period of 7 or 8 years. We heard this earlier from Jonas, that he has a list of the flu gain-of-function work that has been done, most of it not in the United States, but numerous projects have been performed. And among the things that were not reviewed under these for various reasons were the Wuhan bat coronavirus recombination experiments that we've heard mentioned, that were US funded, the immune escape selection experiments on SARS-CoV-2, monkeypox recombination experiments at the NIAID that have been recently queried by the Republican leadership in Congress. What the purpose of those is unclear, and there is, after several months, no answer from the NIH to the oversight committee's questions. The Boston University controversy about recombination experiments with SARS-CoV-2 that came out a few months ago, and the construction of a measles virus that escapes vaccine immunity that was published in 2021. Those are some of the things that should have been reviewed if the policy was robust and applied widely. And there are various reasons, some of them perfectly reasonable given the system we have, and some of them, I think, bad judgment by those who were trying to regulate. This is one of my favorite photos. This is a soldier during World War I and the flu pandemic doing infection control. There are gaps in the US process, as in this photo. Some of them are being fixed or are potentially being fixed by changes that will happen as the US implements the recommendations of the NSABB. We review only only research that's sponsored by the Department of Health and Human Services. The review is at the time of proposal and doesn't keep up with changing aims of the research, which naturally happens in any good science lab. As I was told once by my mentor, if you know at the time if you do the research you proposed 5 years ago in your grant, you're committing scientific malpractice because you haven't learned nothing in the last 5 years. The grants are pieces of science fiction that help us to evaluate whether someone can think scientifically. They are not operating procedures. The funders' incentives appear to favor finding ways to keep proposed work out of the system, and there's extensive discretion about what goes in. And for now, until those recommendations are implemented in the US, it's only highly transmissible and highly virulent organisms that would fall in the review process. So when I say that we need a process, that is not a process to stop all gain of function of concern. The point is that all research that raises the potential of causing a pandemic should be reviewed, and then some of it should proceed because it's scientifically good, it has public health benefits, and it can be made safe enough. And I'm going to talk a little bit more in detail about how I think we can do risk-benefit weighing in an intelligent way that is not, as Rocco said, doesn't require thousands of hours of person time, and it's certainly not a full solution to the problem, but I think there are ways forward. one rule of thumb I would say is that the risks are smaller and the benefits larger when we're dealing with a current rather than a potential one, threat. And I think that was something Rocco said, although I'm not sure I totally understood your comment this morning. In particular, for example, selecting immunoscape in SARS-CoV-2 may be risky, depending on how it's done, but and should be reviewed, but then probably should proceed because of the potential and actual benefits for public health. And although I'm fairly skeptical of many of these kinds of experiments, I did specifically say in writing and in other ways that when the SARS and MERS adaptation to mice was was included in the funding pause in 2014, it should be removed from that because of the public health benefits and relatively low risk. In that review process, we need transparency, and that's also been a theme in the last several sessions. And I mean transparency not in quotation marks. So the US government's transparency statement describes the reasons why we should not be transparent in the review, and specifically why the names of the people involved and the arguments pro and con for the review of proposals should be suppressed. That is not transparency, that's the opposite, obviously. I think it's kind of impressive that someone would think that they would to put that in something called a transparency statement. But you know, I don't know if I need to make an argument for this or not, but at least it might be relevant that we hold civil and criminal trials in public, and the people's names and the events, those are all made public before the person is judged guilty. So the idea that we can't put research in the public domain when it raises a potential threat to humans seems a little crazy. All right, so how are we going to weigh the benefits? I think that has been a major challenge. I would argue, and I hope to discuss with some of you afterwards if you agree, but I would argue that there are three things. First, they should be public health. If there is a risk of a pandemic from an experiment, in the unlikely event of a laboratory accident, there should be public health benefits and not purely scientific benefits offsetting it, so that we're weighing lives against lives. The diagram comes from from the same piece written with Tom Inglesby, which I think is actually the most important thing I have to say. The comparison we should be doing between research that involves enhanced potential pandemic pathogens and the alternative is not, should we do this research or should we do nothing? It's not, should we do this research or should we buy a bomber? It's not even, should we do this research or should we build a hospital? It's, should we do this research or should we do other research that costs the same amount? And that actually is a big point, because the biosecurity and biosafety is expensive. So the same amount of money could buy you a lot of other kinds of research. And should we, and what are the marginal benefits that we get from doing the risky experiment instead of the next best safe experiment? And I think that actually solves a lot of the problem. And finally, it needs to be specific and subject to scrutiny. And I'll give some examples of that in the next couple of slides. So, for example, if you look at the list of mutations identified in the H5N1 enhancement studies that were performed in the 2 laboratories in Wisconsin and the Netherlands, none of those mutations associated with transmission in those studies was novel. Every one of them had a prior publication about it. The sources are listed in this correspondence. And moreover, a number of them depended on the context. So they had the phenotype of creating transmission in one background, but not in another background. And therefore, if you tried to use simple presence or absence of those mutations to say this is a dangerous virus or this is not, you would get the wrong answer. Those are examples of a more general phenomenon, which is that throughout viruses, context matters, and one mutation changes the effect of another mutation. That's the phenomenon of epistasis. And it means that how it happens in the lab is not always informative and can, in fact, be misleading if we are using it as a proxy for what can occur in nature. So the idea that to know what to worry about in nature, we can just study it in the lab, cause it to happen in the lab, and reason from that is mistaken on several points. This diagram from an article with Alison Galvani and CIDRAP a while back tries to break down that argument, but just 3 examples of that. In a meeting we convened in Cambridge where Jesse Bloom was present and some others, we concluded that the 2009 H1N1 pandemic strain had 0 of the 3 properties which were thought to be essential for pandemic potential in 2008. 0. It didn't pass any of the 3 tests. And it soon acquired those 2 of those properties, but it didn't have them at the beginning. So our ability to generalize from several studies is limited. Other work that Jesse was also involved in was showing that the laboratory experiments on prior strains, which had shown what the effect of oseltamivir resistance in flu was, those were completely misleading when you applied them to the current strain, where in fact oseltamivir resistance went from 0% to nearly 100% in a single flu season because of an intrinsic fitness advantage that Jesse's work helped to explain mechanistically. But all the previous experiments done in other perfectly reasonable strains showed that it had a completely crippling fitness cost. So another example where trying to sort of map simply mutations to danger doesn't work. And I'll skip the last one for reasons of time. I think when we're looking at benefits, we need to be precise about the specific contribution about the risky study. And it's kind of bad manners in a scientific discussion to say that other people's claims about the importance of their science are overblown. But I'm going to do it. I hope that's not like being rude on Twitter. But this is an example that I think really typifies why it's hard to talk about these things in objective terms rather than in wishful terms. So the exceptionally interesting and scientifically triumphant, I think it was a major accomplishment to reconstruct the 1918 virus from RNA. And sometime after that was done, the authors of that study wrote a paper claiming that had reaped unexpected rewards. And note it says reconstruction. First they figured out the sequence and then they reconstructed it. Figuring out the sequence is danger-free, more or less. Maybe a biosecurity risk, but certainly much less risky than actually making the virus. And they have eight or so sections in this paper where they claim the benefits of having reconstructed the virus. 5 of those sections, 7 of them, sorry. 5 of those 7 sections describe things that could have been done with just the sequence or just the structure. And 2 of them describe non-public health benefits that are scientific benefits but not public health benefits. So these are not legitimate claims of what you need to do dangerous research for. They're legitimate claims of something you can learn, but there are other ways to learn it. And so again, when we're comparing the benefits, we really need to be comparing against the safer alternative, not against not doing the experiment. How should we do this weighing? I would say that pandemic risk concerns should be on a par with the kinds of other concerns that already constrain our research. Many of us deal with human subjects concerns. If you stigmatize a person in your research, there's a risk that that research will not be allowed to happen. If you risk stigmatizing a person. If you torture animals unnecessarily in your research, it will be stopped, as it should be. If you use chimpanzees, the director of the NIH proudly trumpeted that we will no longer support that work, any work on chimpanzees. If you propose a study that is better than 4% of the other studies that are being proposed, you will not get funded to do it because the pay line is 11th percentile. If you propose the best study in the world that costs $1 trillion, you will not be allowed to do it. That's not breaking your scientific freedom. That is responsible weighing of the upsides and downsides of the research. So why is gain-of-function research so hard to think about in that sort of relatively everyday context? Nobody argues that we should fund $1 trillion great idea. A lot of us argue that the 11th percentile is too low because we're in the 12th and we really wanted to get that grant. But nobody thinks we should be doing dangerous human subjects research or torturing animals. I think one of the properties is that the risk that we're talking about, and this is the kind of classic equation, that risk is likelihood times impact. But in the case of gain of function of concern, it's tiny likelihood and gigantic impact, and the product of those is really hard to think about. And probabilities that are small are hard to think about in particular. Another aspect is that the people who are put at risk are unaware, they're certainly not consenting to being put at risk, and they may be very, very far geographically from the work that's being done. Relatedly, I think the regulation and the thinking about policy on gain of function of concern collides with a number of incentives and conflicts that we have. Incentives, habits, biases, and conflicts that we have. The first is in the category of academic and scientific freedom. I think the idea that we should be allowed, someone said it this morning, that scientists think that if their intentions are good, they should be allowed to do anything, putting aside the fact that we don't get funded to do most of the good ideas we have. And relatedly, the notion that science has unpredictable and enormous benefits, which I agree with. I think a lot of that really boils down to this notion of weighing. Again, the NIH budget does not go up if we do more gain of function of concern. It probably goes down through political processes, but it certainly doesn't go up. And therefore, if you're talking about a fixed budget, it's not a question of doing no research or doing research. It's a question of doing better, safer research or more dangerous research. Sometimes the more dangerous research is worth it, but let's make the case. Another point that I had not thought about, but my colleagues philosophers at Rutgers pointed out, is this very strong feeling that we have that we should do something. That if we have a threat, if we have a potential pandemic pathogen, we should do something to study it, no matter whether that's a good idea or a bad idea. And if you haven't read this paper called Cure Me Even If It Kills Me, Preferences for Invasive Cancer Treatment, it's quite a fascinating paper in medical decision making about how patients think about cancer treatment. Another related point is that we are unfamiliar with and unused to regulating research risks to non-participants. All of the machinery that was built up after the Second World War to regulate risks to humans from research was about human research participants, for very good reason, because that is a very risky kind of research. But this graphic from our commentary in PNAS about the idea of non-participant risk points out that when there's a transaction between say a clinical trial involving treatment of an infection between an experimenter and a participant, the non-participants may have some risk as a result of that. And we surveyed in a couple of different areas the literature on whether there's any obligation to protect non-participants, and it's a very murky frontier as we described in this paper in Clinical Trials. I think there is also obviously the funder, institutional, and other incentives to do and fund and publish research in synergy with entrenched positions and false entanglement with other topics. I don't know where that bird came from, but it might have something to do with that. And then finally, a tendency to underestimate small probabilities, which is a psychological bias that's been well documented and I made allusion to a minute ago. And actually strong incentives in people who are trying to maximize their career potential or their other outcomes to take inadequate care to prevent small risks. And that was something we also wrote about in thinking about why we don't adequately protect against very low probability but high impact events. I think we have dealt with the topic of gain of function of concern in the setting of enhancing flu viruses. And I think David Relman and I wrote a piece in 2015, that predicted that it would get harder, and we didn't know exactly how. But I think some of the ways that we thought it would get harder have come to pass. The early experiments dealt with known and named pathogens for which we knew a fair amount about them. They involved expensive government-funded studies in labs that were known and public. And they involved a limited profit motive. It was mostly a matter of public goods versus public goods. I think that's going to start to change, and some of those things have changed. For example, the possibility that viral prospecting and viral discovery experiments could lead to starting a pandemic. Whatever you think of the COVID origins question has now come onto the table and raises the question of how to deal with that, which I don't know the answer to. I think we've heard a little bit about the role of journals, and of scientific journals, and I want to reinforce that thought. This is Daniel Bernoulli, who was the first mathematical epidemiologist by many people's accounts, also a Swiss person, so I wanted to put him on my slide. And he published in this journal in Paris. But a lot of us in more modern dress have other things on our mind, and some of them are more prominent than others. But it's clear that the ability to publish in a prestigious place is a major motivator for scientists. And that gives the journals the ability to have influence. We can't publish anywhere respectable if we haven't followed human subjects guidelines and animal guidelines, irrespective of who funds us. That's not the funders, that's the journals. More and more, if we don't make our code available or our data available, we can't publish. So the journals have figured out ways to incentivize behavior by scientists. How do we do that? I think one way to do it would be for journals to insist on a certification that proper biosafety and security have been certified. And I don't think that would be the perfect answer, but I think it would help. And it would have a global effect irrespective of who funds, and it would help to educate people about the issue. We've heard about the importance of internationalism and the value of a conference like this in trying to incentivize it. I think we also need to keep in mind that one country at a time making some progress will help. It will set a global example if the large research funders make progress, and at the same time we need global thinking to help us solve these hard problems. The Washington Post had an article last week or the week before about a Thai scientist who had said to the US government, "Thank you for your viral discovery funding. I think this is dangerous and actually not really helping public health, and I'm going to give it back to you." That voice is not exactly well, that voice is Thailand educating the United States, in my view. Of course, the people affected are everywhere, and so that makes it a global problem. Funding crosses borders, if not the viruses. And nonetheless, as much as globalism matters, each time we make some progress in one country, it will help. I got a little lesson in French from my friends when I was thinking about this slide. Apparently in French this is not true, but in English a canard, I mean I know what a canard is in France, but it's not, and in French, but apparently it does not mean a falsehood that is repeated for effect. But in English that's what it means, as most of you know. So we have to counter some of the canards. And I appreciated Zeynep's doing so last night for her whole talk. There was a lot of canard hunting. Some of those canards are responses, reasoned responses to some of the canards that are most important are, first of all, gain-of-function research of concern is not producing vaccines or other countermeasures. Not to say it never can, but it is not right now. And when prominent people go on television and say gain-of-function made your flu vaccine, that is not helping the discussion. Regulating this research is no more of a threat to academic and scientific freedom, I think, than human and animal regulation, open science, and so forth. Third, I think really importantly is that harm reduction works. We are not going to get to perfection, but making better policy and better mechanisms to implement that policy will make us safer. And we should try to be incrementally beneficial rather than waiting for the perfect thing. Relatedly, I think there's been a suggestion that if we regulate in one country, it will just push the research to elsewhere. I think that's not, it might have that effect in the very short term, but I think if the research is limited in certain countries and and builds a culture in which that is not, in which you think twice and ask the question, does this need to be done in the most dangerous way, or are there ways to make it get the same public health benefits more safely, that will filter to the whole world, because nobody, as we've heard, nobody is anxious to have an accident. It's simply a question of what kind of research people choose to do. And finally, I think with all the interest of the last session, I want to just emphasize that the wisdom of whether we regulate gain of function of concern and how we do it has almost nothing to do with the COVID origin question. So in conclusion, I think we are at the COVID-19 has brought us new salience to this notion that accidental pandemics would be bad and something we want to avoid. I think this meeting has done a really good job of assembling concentrating a very diffuse solution of people who are in the reasonable middle. I don't know everyone's views in the room, but I think there are more people in this room who have moderate views and are interested in trying to work together to understand the competing views and make sensible rules than almost any other group I've been a part of. Having said that, I think that there are still a lot of research projects happening that have little or no public health benefit and create real risk of causing outbreaks or a pandemic. But we have to preserve a way to do the limited subset that is both risky and incredibly valuable. I think there are ways to close loopholes and do the risk-benefit weighing that are not overly burdensome. I think if we really adhere to the concept of comparing research that creates potential pandemic pathogens or enhances them against the next alternative that is not as risky, we will solve many of the benefit questions. I think we need a lot more thought about the viral discovery question, and do we need limits on it? Is it dangerous, and what are the short-term and long-term benefits of viral prospecting, and where should we do it and where should we not? And clearly now is the time to act. We heard that it's been 10 years of not following up on recommendations. We have the salience of the pandemic, and if we're not going to do it now, we're not going to do it. So I'll stop there.
A very warm thank you, Mark, for your fantastic keynote, our closing keynote. It's about 10 years since Mark and I were last together in Geneva. At that time, we were up the hill at the UN, also incidentally speaking about gain of function. And so I just wanted to take this opportunity, Mark, to thank you for your leadership in this debate over the last decade. I think you really have made an impact, and we're so pleased that you could close our conference for us here today. We are nearly at the end, everyone. Jesse and I are going to try to make some closing remarks. At the international level, discussions on how best to manage high-risk pathogen research have tended to be either absent or very politicized. Our aim with this project has really been to contribute to an informed and conclusive conversation about global biorisk management and to actively try to incorporate some of the voices and perspectives that often aren't heard. I think we've managed to get off to a pretty good start. Jesse and I and our co-directors and task force members have all listened very carefully to the very rich discussions that we've been having over the last few days or last couple of days, and we'll certainly be digesting some of that material in the days and weeks to come. We're not going to try to summarize the discussions we've had. You'll be pleased to hear. I know we're standing between you and the reception outside. But we did think we would try to provide some of the some key points that we individually take away or personally take away, some snippets of things that we've found interesting at this meeting. From my perspective, there seems to be much that we actually agree on. But what has also been made clear is the importance of building in layers of complexity and the nuances into our discussions. To get more granular was one of the terms that was used. To dig deeper or to problematize was another term that we heard. So to problematize some of the concepts that we've been drawing on. And this is going to take some work. So for example, I think we agree on the need to limit risks of research, but we've also been reminded that there are risks to not carrying out the research too. On red lines, there seemed to be some agreement that if a virus is not currently circulating in nature, then it's much harder to justify working on it. But then, quickly, that shifted to a much fuzzier category of reasonably expected to occur naturally. Well, what is reasonable? And from whose perspective, right? This, to some extent, becomes a subjective judgment. We generally seem to agree on the need to build trust with publics, and that we need to identify the pillars on which we can build that trust. But we also need to recognize that there will be significant and growing proportion of our society that will simply not trust data or traditional sources of authority. We need to recognize that scientific practices are changing. For example, the rise of preprint servers and media reporting of preprint data as scientific facts. And we also have to recognize that there are coordinated, deliberate, government-driven disinformation campaigns. And we need new strategies to manage this. So it's easy to say we need to build trust with publics, but we've got to complicate that discussion too. Transparency. Another aspect we generally agree on the importance of, but again, not straightforward once you move from the abstract into the real world, where you find different political cultures, different lab cultures, different worldviews, different ground truths. So there can, for instance, be information hazards or security vulnerabilities attached to transparency. We agree on the importance of multi-stakeholdership, social justice, evidence-based policy. But commitment to those goods takes sustained funding, a point that was made again and again over the last 2 days. And we can't all rely on Trevor to fund our work. So some of this is going to, as I said, take time to digest. We are, as a task force and as the team of the Global Pathogens Project, going to be working on this over the next little while, and hopefully we'll certainly be paying very close attention to everything we've been saying here, and hopefully we'll come up with a good product. I'll turn to you, Jesse, to elaborate on some of your takeaway messages.
Okay, thank you. So I've had, maybe because I'm co-directing this, a number of people sort of ask, what do you hope to get out of this meeting? And the truth is, I'm sometimes sort of wondering that question myself as well. But I want to sort of first describe how I sort of came to think about this being important to be involved in. So my lab primarily researches the effects of mutations to viruses, particularly during the coronavirus pandemic. We've been trying to research the effects of mutations on, let's say, the ability of the virus to bind to cells or the ability of the virus to escape antibodies. And actually, for those of you who follow this sort of thing closely, our lab and other labs in the field have started to have a great deal of success for this. We've identified these sort of famous coronavirus mutations with names like N501Y or F486P or things like that that have actually come up in nature and turned out to be really important. And I think this is sort of a remarkable scientific achievement. I think it's also an indication that while it's still true, as many people have noted, that we don't really understand viruses enough to really rationally change them, that's less true now than it was a decade ago. And it will probably be less true a decade from now than it is now. So I started to think about this when I was looking through the MBio table of contents, and I saw this article entitled Rapid Proliferation of Pandemic Research, Implications for Dual-Use Risks. And it was written by Greg Koblenz and Joshua Monrad and Jonas Sandbrick, who are all sort of sitting out there. And so I was reading through this. I thought it was pretty interesting. And they're going through their lists of sort of, high-risk potential dual-use research. And I get to reference 16 there, and it's one of our papers. They're calling out one of our papers that was sort of looking at trying to identify SARS-CoV-2 antibody resistance mutations as an example of this high-risk potential dual-use research. So I took Natasha's advice and I immediately got on Twitter. No, I'm kidding. I didn't do that. So instead what we did is we emailed them and we ended up setting up this meeting where we were sort of going to discuss their paper in the context of our research and the topics they were discussing. And I remember when I did this, I think I asked like the 2 people in my lab who'd been working on this paper to also join, and I just kind of mentioned it to the other lab, like if anybody else wanted to join the Zoom meeting. And like every single person in our lab, all the grad students, all the postdocs wanted to come to this. They were all super interested to discuss this. None of them, despite being grad students and postdocs who'd been studying molecular biology and virology for, in some cases, quite a few years, had ever been involved in anything like that before, as had I not. And I just think it was a really interesting discussion, you know, sort of going back and forth, hearing this different perspective. And it really made me think, and sitting through these sessions has made me think that as scientists, we're really trained to sort of try to answer questions with simple answers. Like, it doesn't mean that getting to that answer is always simple. Sometimes it requires a lot of complicated reasoning or math or analysis or something. But in the end, in science, we sort of get to simple answers where there's an answer to the question, you figure it out, you move on to the next thing. And the reason that we sort of approach those sorts of problems is because it's very powerful. It's that sort of reasoning that's led to things like the COVID vaccines, which are, you know, almost kind of this miracle. I remember thinking when I got mine, they just inject this little thing in your shoulder and now you can go back out in society. It's kind of like a miracle, right? But there's other important questions out there that don't have the sort of simple answers that as scientists we're trained to pursue, and we're trained to think in that mindset. And so, for instance, when we think about the Bulletin of Atomic Scientists, we watched this this video at the beginning of the workshop yesterday. And one of the things that struck me is that, like, doomsday clock, it was always within like 15 minutes of midnight, right? Even though they had Einstein and Oppenheimer and all these people involved in the Bulletin of Atomic Scientists, all these smart people, they never managed to figure out how to get the doomsday clock back to, you know, 6 a.m. or something like that. And I think that sort of, in some ways, reflects on the types of questions we're dealing with here. I don't think we're going to come up with any real long-term answers. The technologies are changing. A lot of what we're talking about are weighing risks and benefits. A lot of what we're talking about involve very difficult social problems where probably the best we're going to be able to do is mitigate the number of catastrophes, you know, we have in coming years. And I think it's important to recognize that these really interesting questions that sort of fall at the interface of science, where you can sort of get these simple answers that those of us who are scientists are used to doing, and these questions that involve these much, much harder sort of social problems. There's this really good essay, since a lot of people have been talking about physicists, by Richard Feynman, who's this famous physicist, who wrote this essay called The Value of Science. And he talks about this. He says, you know, from time to time, people suggest to me that scientists ought to give more consideration to social problems, and especially that they ought to be more responsible in considering the impact of science upon society. And he says this same suggestion must be made to a lot of other scientists. And it seems to be generally thought that if scientists would only look at these difficult social problems and spend less time on scientific problems, we'd all be in a better place. But he wrote, you know, it seems to me that scientists do think about these problems from time to time, but we don't really put full-time effort into it, the reason being that we don't have any magic answers either, and that in general, solving social problems is a lot harder than solving scientific problems, and we often don't really get anywhere when we try to do it. And so I think it's important to just recognize that perspective when we think about this. This workshop is not going to come up with the answers. This is a fast-moving field. The technologies are going to be different. The perspectives are going to be different. The social dynamics in which all these questions are going to be asked, they're all going to be different in a few years. That said, I do think we can try to take away sort of a few lessons, and I'm going to focus more on the sort of detailed scientific things like Mark was talking about in his talk. So first of all, I think we can all agree that the vast majority of research is beneficial or sort of at least benign, and we don't want to hinder it. So I think sort of the worst outcome that could come out of this area, workshops like ours, would just sort of be more general red tape that everyone's dealing with. I think we really need to focus in on what's important. And we're going to need to keep researching these topics because I think we all agree that there are going to be more viral outbreaks in the future. You know, I would be shocked if there's not another viral pandemic during my lifetime. I mean, if you look at the frequency of them, they happen every couple of decades. And certainly, there are probably going to be more outbreaks that involve some sort of zoonotic origin. There's probably going to be more lab accidents in the future. Maybe there'll be significant lab accidents. And so those are going to happen, and part of what we have to do is make sure that we're still doing the research to be prepared for those. But we obviously also want to sort of minimize the chance that that research backfires. And I don't think we totally drew where the red line should be, but I think one of the themes that came up again and again, Mark really emphasized it in his talk, Jens was talking about it in his talk, is a lot of the focus really needs to be on research where accidents has the potential to cause a pandemic. And this is, as Jens emphasized, distinct from high biosafety research. There's a lot of research with very deadly pathogens that's done at BSL-3 or even BSL-4 that involves things that do not pose a pandemic risk. So obviously those good biosafety practices need to continue, but I don't think they're the sort of societal issue that we're here to talk about now. And I really think that we need to draw very tight and focused lines around this kind of research that has the potential to cause pandemics. You know, I would even draw these lines, you know, more tightly than someone like Mark was describing. You know, in my view, for instance, even these famous experiments that Boston University did, where they made chimeras of 2 different SARS-CoV-2 viruses and got a lot of negative publicity, I don't really know that those are experiments that really pose a pandemic risk. In the end, they're working with 2 recent SARS-CoV-2 variants. And I think a really important thing that we as scientists need to do is, if we don't want sort of general alarm in the public and general concern about all research to sort of lead to what, in my view, is honestly an overreaction to these Boston University experiments, we need to recognize that there are experiments out there. They may not be those experiments, but there are experiments out there with things like engineered H5N1 or the 1918 flu or some bat SARS-related coronavirus with pandemic potential, that there really are good reasons for people to be alarmed about that. And I think if we recognize that fact and draw those lines, hopefully we can get those lines drawn as intelligently as possible. Another theme that came up a couple of times is the idea that we as scientists sort of need to think about doing research in the safest way possible and try to create the incentives and framework to do this. A couple of people even made the analogy to human subjects research, where if you look at human subjects research and you look at the history of virology research, you know, 50 or 60 years ago, some of the most informative experiments in the field of influenza immunity was done by challenge studies. They just infected, if you read the methods, they describe them as prisoners who were volunteers. And these were, if you look at things from a purely scientific perspective, highly informative experiments. You're actually learning what happens when a human is infected with an influenza virus. But nowadays, we don't do that type of research anymore because we recognize that that sort of research is not ethical. We don't do infection experiments on prisoners. We still do human subjects research because there's a lot of questions that can only be answered by human subjects research, but we do it as it's needed, and we all accept the need to think about it and justify it and do it in sort of a regulatory framework. And I do think that we can move towards that in virus research. A number of people made the point, again, came up from Claire, it came up from Jens, Stuart Neal was posting a long thread about it on Twitter under this hashtag, that in many cases, there are experiments that can be done with alternative systems like pseudoviruses or attenuated viruses that can answer the scientific questions that we need to get at. In fact, I would say most of us who are scientists have had the experience where we feel like a reviewer is trying to make us do some live virus experiment that we don't actually think is necessary to prove the point in the paper. Again, that's not everything. Often these experiments with real viruses that are human pathogens are needed, just like sometimes human subjects research is needed, but it's not always needed. And again, I think that's an area where we as a scientific community can really think about a framework where we maybe create norms and create regulatory frameworks where we try to do the research in the safest way possible, recognizing sometimes we need to work with real pathogens, but often we can answer important questions, you know, working with less dangerous systems. So my hope is through some combination of regulation around this really sort of red line research with potential pandemic pathogens and a broader acceptance among scientists and better interaction among scientists and people in the biosafety and biosecurity fields, that we can really get to a collaborative place where we can keep research going to do the important things we need to do. We can maintain as much support and involvement from the public, and we can hopefully mitigate some of the risks that, you know, are the reason that people have the concerns that started this whole workshop in the first place. So anyway, I would really like to thank everyone who attended this workshop. As Philippa mentioned, we're going to try to put together some sort of document starting to draft it over the next day, along with all the members of the task force, and we hope that that can be a good starting point. But it's really my belief that if this conference has a long-term benefit, it's primarily going to just be getting people talking and thinking about these issues. And we're going to be dealing with these same questions years and decades from now. But hopefully we can kind of get it off on a good foot, on a more collaborative foot, and make progress and do the best we can and hope we have as few pandemics as possible in the future.
So, nope. Hold, we're not there yet. So, as Jesse said, the hard work starts now for the task force. Our next step is to start developing a report out of this meeting. We'll be doing that over the next few months. So watch this space. You'll, of course, all be notified when we get there, and to produce a series of recommendations for how we move this debate forward. So in that vein, can I please remind the task force that we have a meeting tomorrow from 9 till 12 in the hotel here in the Apollon room on the lobby level. So we'll see you all sharp at 9. For everyone else, I wanted to add my thanks to, first of all our amazing speakers who have provided such insights and been so sincere, also added some humor, and it's been really a wonderfully engaging set of discussions, I think, that we've had. In no small part, that has also been due to the engagement from all of you in the audience. So a very warm thank you to you as well. We also would like to thank our funders and the entire Bulletin team, who is just an absolute dream to work with. There is one person in particular that we want to thank for all her work, and that is Rachel Bronson. Could you come up and join us here, please? We have a little thank you for you, because Rachel has been very much in the background at this meeting, but she has been very much in the forefront in planning all of this. So, Rachel, we brought you a little something just to say thank you for all the work you've done. Please join me in thanking her. So we can now move on to a reception, the final bit. Enjoy the final bit of networking, and safe and smooth trips home to everybody. Take care.